The Committee of Finance is hereby called to order. Madam Clerk, may I have a roll call, please?
Senator Marvin A. Blyden. Senator Blyden, present. Senator Samuel Carrion. Senator Carrion, absent. Senator Dwayne M. DeGraff. Senator DeGraff, absent. Senator Donna A. Fred Gregory. Senator Fred Gregory, absent. Senator Javon E. James Sr. Senator James Sr., present. Senator Janelle K. Saru. Senator Saru, absent. Senator Kurt A. Vialet.
Here.
Senator Vialet, present. Mr. Chair, you have 3 present, 4 absent.
Thank you, Madam Clerk. Any correspondence?
Yes, Mr. Chair.
You may proceed.
Correspondence dated August 19th, 2022. Honorable Kurt Vialet, Chairperson, Committee on Finance, Legislature of the Virgin Islands, 3022 Estate Golden Rock, Christiansted, St. Croix, Virgin Islands. Dear Chairperson Vialet, please accept this letter as a formal notice of my absence from today's Committee on Finance meeting, which is scheduled to begin at 9 a.m. in the Fritz Lowetz Legislative Conference Room on St. Croix. Thanks for your consideration in this matter. Kindest regards, Donna Fred Gregory, President, 34th Legislature of the Virgin Islands.
Please mark Senator Fred Gregory as excused. Any more correspondence?
Yes, Mr. Chair.
You may proceed.
Correspondence dated August 19th, 2022. Honorable Kurt A. Vialet, Chairman, Committee on Finance, 34th Legislature of the Virgin Islands, 3022 Estate Golden Rock, Christiansted, Virgin Islands. Dear Chairman Vialet, I will be late to the start of today's Committee on Finance hearing scheduled for August 19th, 2022 at 9 a.m. As a result, I humbly request that you excuse me until my arrival. Thank you for your consideration and understanding. Sincerely, Samuel Carrion, Senator, 34th Legislature of the Virgin Islands.
Please mark Senator Carrion as tardy. Any more correspondence?
No, Mr. Chair.
Can I get the count again?
Mr. Chair, you have 3 present, 2 absent, 1 tardy, 1 excused.
Thank you, Madam Clerk. You may proceed and read the agenda into the record.
The Committee on Finance Fiscal Year 2023 budget hearing for Friday, August 19th, 2022 at 9 a.m. in the Fritz E. Lowetz Legislative Chambers, Christiansted, St. Croix, U.S. Virgin Islands. The Committee on Finance will receive testimony on the proposed Fiscal Year 2023 executive budget for the Government of the Virgin Islands of the United States. At 9 a.m., the Department of Human Services invited testifiers Kimberly Causey Gomez, Commissioner. At 12:30 p.m., Office of the Territorial Public Defender invited testifiers Samuel L. Joseph, Esquire, Chief Public Defender. And at 2 p.m., Legal Services of the Virgin Islands invited testifiers Shelby King Gaddy, Esquire, Executive Director. Mr. Chair, this concludes the reading of today's agenda.
Thank you, Madam Clerk. I'd also like to welcome Senator Joseph. Thank you for coming. Senator Nobel Francis and Senator Angel Bolquez. Thank you all for coming. Good morning to the people of the Virgin Islands. Good morning, testifiers. Good morning, colleagues. Today we're beginning with the Department of Human Services. I'm going to give the Commissioner an opportunity to put her name and title on the record, along with those individuals who will be supporting her in her testimony today. So I'll begin with you, Commissioner.
Kimberly Causey Gomez, Commissioner, Virgin Islands Department of Human Services.
Thank you. Next.
Good morning, Carla Benjamin, Assistant Commissioner, Department of Human Services.
Next.
Good morning, Lydia McGrath, Chief Financial Officer.
Good morning, Mikal Rima Brown, Assistant Commissioner, VI Department of Human Services.
Thank you. Next, we'll go with those individuals.
Excuse me, Senator. We have 2 more.
Okay. Next.
Morning. Deputy Commissioner Miguel Tricoci, Department of Human Services.
Next.
Good morning, Kimberly Berry, Chief Legal Counsel.
Thank you. Those individuals who are participating virtually, Ms. George. And unmute your device, Ms. George.
Wow.
Okay.
Good morning, Alicia George, Acting Director of Treatment at the Youth Rehabilitation Center.
Thank you. Mr. Milligan.
Alvin Milligan, Assistant Administrator for Division of Senior Citizens Affairs, St. Croix.
Thank you. Ms. Martinez, Velez Martinez.
Good morning, Ana Velez Martinez, Director, Residential Services, Albert Gregg Home for the Aged.
Thank you. Ms. Hart.
Good morning, Sharice Hart, Administrator for the Division of Children and Family Services.
Thank you. Ms. James.
Good morning, Evie Monique James, Administrator for the Office of Residential and Interstate Compact Affairs.
Mr. Smith.
Good morning, Gary Smith, Medicaid Director.
Ms. Bailey Poole.
Good morning, Justina Bali-Poe, Systems Manager, DHS.
Mr. Torres.
Good morning. Juan Torres, Acting Chief, Youth Rehab Center.
Mr. Tutine. Thank you. Ms. Tutine.
Good morning, Kendall Tutine, Director of Nonprofits and Support Services, DHS.
Ms. Washington. Thank you.
Good morning, Kimberly Washington, Acting Administrator, Disabilities and Rehab Services.
Thank you. Ms. Denon.
Good morning, Laura Denon, Contract Administrator for DHS.
Thank you. Ms. Lewis.
Good morning, Natalie Lewis, Administrator, Office of Intake and Emergency Services.
Thank you. Ms. Bailey.
Good morning, Natalie Bailey, Administrator, Division of Family Assistance.
Ms. Natalie Lewis.
She introduced herself earlier.
Okay, thank you.
There's two Lewises. So my name is Masika Lewis, the Office of Head Start Administrator.
Okay. Armstrong. Nicole, I think it is.
Good morning, Nicole Armstrong, Labor Relations, HR Division.
Thank you. Ms. Phillips, all set? Tasha? Ms. Dorset?
Good morning, Tasha Phillips Dorset, Assistant Administrator, Division of Family Assistance.
Ms. Tucker Lance, thank you.
Good morning, Tishma Chapman, Administrator for Office of Child Care and Regulatory Services.
Okay, thank you all for your introduction. Commissioner, you may proceed.
A pleasant good morning, Honorable Senator Kurt A. Violet, Chairman of the 34th Legislature, Committee on Finance, distinguished committee members, non-committee senators present, members of the Department of Human Services team, and the viewing and listening audience. I'm Kimberly Causey Gomez of the Virgin Islands Department of Human Services. I appear before you accompanied by my senior leadership team, Chief Financial Officer Lydia McGrath, Assistant Commissioner for St. Croix, Carla Benjamin, Assistant Commissioner for St. Thomas and St. John, Mikkel Reimer Brown, Chief Legal Counsel, Kimberly Berry, Esquire, Deputy Commissioner of Operations, Miguel Tricoci. Our newly appointed Deputy Commissioner of HR and Labor Relations, Mr. Trotman, is not available due to a family emergency. However, our administrators and directors of our major divisions and offices are appearing virtually. Thank you for the invitation to appear before this body today to testify on the Virgin Islands Department of Human Services proposed fiscal year 2023 general fund budget, to inform you of how our professional staff serve our most vulnerable populations. DHS plays a critical role in helping approximately 40,000 Virgin Islands residents throughout their lifespans by accessing services either directly or through a network of continuum of care provided by agencies and nonprofits. Through our dedicated workforce, one of our priorities is to provide quality and professional social services territory-wide. The hardworking men and women of DHS assist individuals, children, families, people with disabilities, and our elderly in reaching self-sufficiency when the economy is strong, or lend emotional or financial support when the economy is faltered. DHS is truly honored to serve the public with the support of the Honorable Albert Bryan Jr., Governor, Lieutenant Governor Tregenza Roach, members of the Cabinet, and the members of the 34th Legislature. This is truly a time of togetherness and focus on our constituents who need us. Scope and overview. The Virgin Islands Department of Human Services receives its authority pursuant to Title 34 of the Virgin Islands Code and is a designated state agency for all publicly financed social services programs except those in public housing and health. DHS is one of the largest departments of the government of the Virgin Islands, serving over a third of the population within the territory, with 707 active employees, 15 divisions, and 84 programs. In addition to our local and federal mandates, DHS has significant disaster responsibilities as the lead agency for Emergency Support Function 6. ESF 6 is organized into 4 primary functions: mass care, emergency assistance, housing, and human services. This is a mandate that requires significant fiscal and workforce support in terms of budget, staff, volunteers, and resource coordination with our ESF 6 partners. Shelter operations is triggered only when the governor issues an emergency declaration. Shelter inspections have been completed and primary evacuation shelters have been identified for all 4 islands. However, as we have noted in the past committee hearings and in our public messaging, due to COVID, shelter in place is crucial for the health and well-being of our community. Despite this historically being unfunded mandate, DHS works in partnership with the American Red Cross and other ESF 6 agencies to support and to ensure successfully our community is safe and is a priority. In addition, DHS strategically operates points of distribution or pods where the public can pick up life-sustaining commodities such as emergency food, water, and other pertinent disaster items following a disaster or emergency. DHS also assists FITEMA with coordinating community assessments, recovery efforts, and post-disaster initiatives. All employees of DHS are deemed essential in the event of a disaster declaration. The fiscal year 2023 budget narrative. To support the initiatives and fiduciary responsibilities of the Department of Human Services, the general fund recommended appropriation is $66,725,295 for fiscal year 2023. Included in the general fund appropriation of $66,725,295 is a miscellaneous section, which equates to $625,000 for the following programs: Energy Crisis Program, $500,000; Eagle's Nest, $40,000; Collective Collaboration, $40,000; the Centennial Living Treasures, $25,000; and Mission Outreach, St. Croix Mission Outreach, $20,000. The Department of Human Services is expected to receive $188,889,272 in new federal grants for fiscal year 2023. Awarded funds are primarily derived from formula grants. Formula grants are based on our census. In addition, DHS continues to manage multi-year grants. Additionally, DHS will receive non-appropriated special funds in the amount of $2,466,108, which includes an estimated of $1,678,108 for the Pharmaceutical Assistance Program, or Fund 2146, $500,000 for the Senior Citizens Center Fund, an estimated of $288,000 for the Homes for the Aged Revolving Fund, which are derived from fees paid by the residents. Historically, DHS has allocated $1 million for the Crisis Intervention Fund, by way of 33 Virgin Islands Code, Section 3091, which was established as a special revolving fund to be distributed to nonprofit agencies and youth services. Although this is not included in the fiscal year 2023 budget as a separate legislative bill, however, currently there is a fund balance of $2,061,695.65, which will allow DHS to establish and expend its annual $1 million budget. Throughout the pandemic, DHS played a critical role in sustaining individuals, families, organizations, and the local economy by providing our direct services daily, as well as successfully pursuing and securing additional federal funds. The fiscal year 2023 budget will allow us to continue to make advancements on a slate of critical programs and policies, expand our digital outreach, maintain staffing levels, and continue to provide social support services to the most disadvantaged and vulnerable people in the community. The total combined general and federal funding level reported for the Virgin Islands Department of Human Services is $258,080,675 for fiscal year 2023. As noted before, additional federal funds are continuing to be received, which will increase the total combined budget. Personnel. Our department began fiscal year 2022 with a workforce of 679 active positions across all divisions and programs. During the past fiscal year, 119 positions were filled to include 44 new hires, 34 rehires, 15 transfers to DHS from another government agency, and 26 internal promotions. It's estimated that 59 transitioned out of DHS for the following reasons: 32 retirements, 25 resignations, 1 untimely passing, and 1 termination. As of this date, this testimony was written, our current DHS workforce includes 707 employees, including 66 members of our Senior Community Service Employment Program, or CSEP. Only 11% of, or 80 employees, are exempt in status. DHS has 146 vacant positions, 53 general fund, 63 federal, and 30 general or federal match. 51 new positions, 31 general, 11 federal, and 9 general federal fund match. That's listed in the 2023 personnel listing for a total of 197. Of the 146 positions listed, 45 have been filled. Since we last appeared before this body, we've made significant changes to our human resources leadership team. Our new deputy commissioner began on August 1st, and the labor relations manager began on July 18th. The assistant director of human resources has been selected and is anticipated to begin on August 29th. The new leadership blends well with our seasoned human resources team, and services to our employees are being enhanced. The divisional summary. As we provide an overview of our divisions, please note that a detailed narrative data and statistical trends may be found in the division summary in Appendix E. The Office of Head Start serves children from low-income families who are 3 to 5 years old with the enrollment period. The Head Start program promotes the school readiness of young children by providing health, education, nutrition, and disability services. 10% of Head Start enrollment is designated for children with disabilities. Head Start's funded enrollment is 794, 500 preschoolers on St. Croix, and 294 preschoolers on St. Thomas, St. John. During the COVID-19 pandemic, the federal performance standards 1302.93, were modified to require that all Head Start staff wear masks on site and all staff be vaccinated or undergo COVID-19 weekly testing. To this date, these federal requirements have not changed. For the 2022-2023 school year, Head Start will assume the cost of the weekly COVID-19 testing of its unvaccinated staff. Below is also a chart detailing Head Start disaster recovery grants with the current active projects or closeout periods, with a total of $46,914,918. The Office of Child Care and Regulatory Services, OCCRS, provides low-income working families with access to affordable, high-quality early care and after-school programs by licensing, monitoring, and providing quality improvement resources for all child care facilities in the territory, and issuing subsidies in the form of vouchers for qualifying children so that they may access child care. Federal grant opportunities will be available for licensed child care providers to receive hundreds of thousands of federal dollars with the submission of an approved application. It's important to note that eligibility is contingent upon registration with GVI BY. To continue to provide child care services to a key segment of the community, the OCCRS has amended the territory's child care policies to continue to include essential workers as a high priority group for subsidies. This makes essential workers categorically eligible for child care subsidies. The state plan will be amended to make the modification permanent until otherwise determined by OCCRS. The Office of Intake and Emergency Services receives, assesses, and investigates cases of suspected child maltreatment. Staff are on call 24 hours a day, 7 days a week, to respond to child abuse and neglect matters, as well as to assist people in crisis. The Intake Services provides services to families with youth who present behavioral problems. The office also provides emergency financial services in the form of one-time rental payments to prevent displacement, utilities payment to prevent disconnection, or to facilitate reconnection, one-time purchase of urgently needed medication, and purchase of essential appliances. The transient repatriation service is travel assistance to return non-residents that are new to the territory to their places of residence to protect them from potential harm, as well as to prevent additional longer-term drain on our local public assistance systems. Intake also provides burial and cremation services for indigent individuals. The Division of Children and Family Services provides income and out-of-home placement for children and services to children and families. The Protective Unit provides services for families with an elevated risk for maltreatment to resolve issues and lower the risk. The Foster Care and Adoptions Unit provides services for children in the department's care and custody. Both units conduct custody and adoptive local and international home studies for the courts for public and private matters. The division recruits, trains, licenses, and monitors foster and adoptive homes. Currently, the foster care payroll supports 16 foster homes. This division has responsibility for implementing programs specifically geared toward children in care and must manage the combination of local and Title IV-E and Title IV-B funds that support children's programming. Work is done in conjunction with the courts and other local stakeholders, with technical support from the Children's Bureau and the Capacity Building Center for States. The Division of Intervention and Prevention Services is formerly known as the Division of Juvenile Justice. This division serves youth whose primary presenting problem is behavioral. Youth become clients of this division after being assessed by another division within DHS as being at high risk for involvement in the juvenile justice system or after they become adjudicated. The division is comprised of its district offices, the Youth Rehabilitation Center, or YRC, and the Annis Hope Group Home. Minors are remanded to YRC pre-trial or when they are adjudicated. These minors can be remanded from age 13 and up to 18 or 19 years of age if the court exercises its judicial control. Minors legally transferred to adult status for committing serious felonies may also be remanded to YRC or incarcerated at the Bureau of Corrections. Staff at YRC, in conjunction with the Operations Division, are currently compiling quotations and developing an execution checklist to complete several capital projects and procurements intended to improve the aesthetics at YRC. Improvements that will be durable. These projects will be implemented in a staggered approach. The Office of Residential and Interstate Compact Affairs coordinates, facilitates, and monitors client placements and therapeutic progress in 14 residential facilities locally and outside the territory for children, adolescents, and adults who require specialized treatment not available in traditional out-of-home settings. The office houses the territory's Interstate Compact for the Placement of Children, or ICPC, and Interstate Compact for Juveniles, ICJ. Currently, there are 84 human services clients in residential facilities. 36 are out of the territory and 48 locally. The department manages services provided by the residential facilities utilizing a fully local budget of more than $13 million, which is approximately 20% of our budget. The cost of placement currently ranges from $100 a day to $826.27 a day for those with complex diagnoses. It is important to note that we have many clients who have been in our care and in residential services for an extended period of time. Individuals do not come into care for just a season, but most likely a lifetime. The resident at a placement for the longest period is a 58-year-old male residing in a local facility. He's been in placement for nearly 28 years. The eldest resident in placement is 69 years old. He's been in placement outside of the territory for nearly 23 years. Currently, the youngest individual in placement is 3. The Disabilities and Rehabilitation Services, or DRS division, is a core component of the local workforce. The division partners with private employers, government agencies, and community stakeholders to facilitate employment and training of persons with disabilities. Currently, under the third-party fiduciary, the federal division is responsible for the oversight of 7 program areas that help to educate and shape the lives of individuals with disabilities. They are as follows: vocational rehab, pre-employment transition services, supported employment, Randolph Shepherd program, the Older Blind Independent Living program, Independent Living for Persons with Disabilities, and Statewide Independent Living Council, or SILC. During fiscal year 2022, DHS was pleased to relocate our St. Croix Division of Disabilities and Rehabilitation Services from their temporary post-Hurricanes Irma and Maria space on the campus of the Youth Rehabilitation Center facility to a new location located at number 2 Estate Carlton in Frederickson. Our clients with disabilities and their family members now have free access to the staff of the Disabilities Division with ADA accessible entrances and internal offices and conference and resource rooms. 60 new clients were deemed eligible for vocational rehab services in 2022. We had 28 successful closures, or persons who have obtained employment and or received VR services to include financial assistance to attend universities, colleges, and vocational training institutions in the territory or on the mainland. Please take a moment to read the personal testimony, which can also be found in the appendices of our written presentation, of Mr. Steven Santora, a VR client who obtained his bachelor's degree in healthcare management and is now employed. His story and others illustrate the critical need to provide local matches for our federal programs. The Division of Family Assistance is responsible for the management and disbursement of the department's critically important food, cash, and energy assistance to vulnerable individuals and families in the Virgin Islands. DFA also administers the Nutrition Education Program to promote healthy nutrition choices among our SNAP residents or recipients, and the employment and training programs associated with TANF and SNAP. The Division of Family Assistance administers several grants, which include the Supplemental Nutrition Assistance Program, or SNAP, the Temporary Assistance to Needy Families, or TANF, Aid to Aged, Blind, and Disabled, AABD, Personal Responsibility Education Program, PREP, Low Income Housing Energy Crisis Assistance Program, or LIHEAP, and Low Income Housing Water Program, or LIWAP. It is important to note that although the Department of Human Services is not traditionally viewed as a revenue-generating entity for the U.S. Virgin Islands, just through the food, cash, and energy benefits dispersed by the Division of Family Assistance, over $70 million in federal assistance will be added to the VI economy in fiscal year 2023 from our SNAP, LIHEAP, and cash assistance funding. Since April of 2020, the Division of Family Assistance has successfully applied for and dispersed $29 million in the Pandemic Electronic Benefit Transfer, or PEBT, and over $40 million in SNAP supplemental emergency allotments. The Division of Family Assistance is slated to transition to its new VI Integrated Eligibility and Enrollment Benefit System, or VIBES. VIBES is a state-of-the-art automated system that will move the large DHS federal eligibility programs to an integrated information technology platform. DFA has also launched, or is in the process of launching, several pandemic-related benefit programs to the Virgin Islands residents, and these include the Pandemic Emergency Assistance Fund, or PEAF, Phase 1, was launched officially on May 18, 2022. This program was made available to 50 existing temporary assistance for needy families or TANF clients only. Clients were awarded in total a $1,200 base plus a $300 per child. PEAF Phase 2, or the Pandemic Emergency Assistance Fund, will award financial assistance of $400 to $500 to families with non-recurrent short-term, or NRST, benefits for crisis situations or episodes of need resulting from the economic hardships of the COVID pandemic. Eligible families with children must have a maximum annual household income of no more than $50,000. Applications are currently being reviewed by the DFA team. The Pandemic Electronic Benefits, or PEBT, the VIP PEBT plan for fiscal year or school year 2021-2022 for school children was submitted to USDA Food and Nutrition Services Division and received final approval just recently on August 12, 2022. We anticipate the PEB benefits will begin to be dispersed during the week of August 22nd, which is next week, to 12,540 children who were enrolled in public, private, and parochial schools and who were duly approved by the National School Lunch Program to receive free and/or reduced meals for their students. An estimated of $6,477,054.84 in PEBT benefits will be issued. The school year 2021-2022 PEBT application process has been a complex initiative, including all the eligible territory public, private, and parochial schools. DHS would like to take this opportunity to thank the Virgin Islands Department of Education and the private and parochial schools for their collaborative in this undertaking. It should also be noted that most students attended in-person school during the school year for 2021 and 2022. PEBT issuance will be lower than the previous year. PEBT is only issued for the days when students were attending school virtually. Now that the school year PEBT plan has received approval, DHS actually submitted and finalized the summer PEBT plan yesterday, actually late last night. The PEBT summer issuance is anticipated to be dispersed to eligible children no later than the end of October 2022. The VI Medicaid program provides health insurance coverage to qualified residents of the U.S. Virgin Islands. Eligible covered groups include low-income adults, children, pregnant women, aged adults, and people with disabilities that, through an application, meet financial and non-financial criteria such as residency, immigration status, and citizenship. Medicaid is a federal and local governmental partnership to ensure access to health care. Thus, federal funds in conjunction with local matching funds pay for costs for providing access to inpatient hospital services, outpatient services, clinic services, and a variety of other healthcare services for approximately 36,778 VI Medicaid members. Throughout the COVID-19 pandemic, the Medicaid program has maintained the eligibility of our members to ensure their continued access to quality health care during the declared public health emergency. Under Title 42 of the CFR Public Health Statute, Medicaid will continue to provide eligibility extensions for our members through August 31st, 2022. Because of the declared public health emergency, the current VI Medicaid program has a federal Medicaid assistance percentage, or FMAP, for Medicaid claims for state-approved services. The current FMAP is 89.2% federal and 10.8% local. VI Children's Health Insurance Program, or CHIP, has an FMAP of 85% federal and 15% local. Medicaid also receives federal funds from CHIP to operate as a Medicaid Expansion Program, or MCHIP. The Medicaid provider enrollment. Ensuring access to care involves enrolling qualified providers to render the appropriate necessary medical care, supplies, goods, and services to Medicaid members and providing minimum essential coverage. We have successfully streamlined the provider enrollment process. All Medicaid provider agreements are executed in-house upon the signature of the commissioner. This fiscal year, 58 Medicaid provider agreements have been processed and approved within DHS. Additional information is also provided in the appendix section. Medicaid presumptive eligibility. Frederiksted Health Center, Inc., St. Thomas East End Medical Center, and the Department of Health staff have been trained to perform presumptive eligibility, or PE, enrollment in their facilities. The Juan F. Luis Medical Center and the Schneider Regional Medical Center continue to benefit from their uninsured patients who are deemed eligible for presumptive eligibility. Outstation eligibility enrollment caseworkers are stationed at both of the hospitals. Their presence at the hospital makes it easier for patients or their family members to submit the required support documents to become full Medicaid members. From October 1st, 2021 until June 30th, 2022, Medicaid paid to our local hospitals and our federally qualified health centers for claims submitted. The Juan Louis Hospital, over $7 million. Schneider Hospital, over $6 million. Frederiksted Health Center, over almost $7 million. And the St. Thomas East End Medical Center, $2 million. The grand total for this is $22,674,560.60. The Personal Care Attendance Program. In fiscal year 2021, the VI Medicaid program completed a Medicaid State Plan Amendment, or SPA, to include personal care attendants as a covered service. Personal care attendants provide personal services that are part of the client's established plan of care. VI Medicaid has 8 local PCA providers enrolled who will give PCA services to our Medicaid members, which basically means that members with disabilities and chronic health conditions can continue to live at home, and PCA services can also assist family caregivers who are often challenged with providing care for their loved ones. The Medicaid Information Technology Initiatives. The implementation of the Territorial Health Information Exchange, HIE, will connect both hospitals, both federally qualified health centers, and Department of Health clinics, local private providers, off-island providers, and other stakeholders. The DHS Medicaid program is a lead agency on the HIE project, but work closely with the public and private entities across the territory to complete the state-of-the-art system. The HIE initiative is part of the Governor's Healthy Horizon initiative and the federal mandate to implement a 21st century healthcare system. In addition to the HIE, DHS is currently working on several other health information technology projects to include the patient access and interoperability, electronic visit verification, provider enrollment applications, cybersecurity system environmental scan, and the VIBES integration project. All information technology projects have garnered millions of dollars in federal government support. Most of the projects have up to 90% of their costs financially supported with federal dollars. However, there is a requirement for local government matches. The Division of Senior Citizen Affairs, through the efforts of our dedicated staff, has continued to be on the front lines of providing critical in-person services to our seniors aged 60 and older and adults with disabilities ages 18 to 59 throughout the COVID pandemic. Because of the vulnerable populations that Senior Citizen Affairs Division serves, our staff members never stopped providing in-person services, even during the height of the pandemic when there were no COVID-19 vaccine options or boosters. During fiscal year 2022, the SCA division resumed senior center activities on St. Thomas, St. Croix, and St. John. Our seniors and staff returned to the newly reconstructed Adrian Center. Thank you to the VI Housing Authority for bearing the full financial cost for the reconstruction and furnishing of the Adrian Senior Center. Both the St. Thomas Strive Senior Center and the St. John Adrian Senior Center reopened with a festive cultural affair, which included Department of Health mobile vans who offered free COVID testing and vaccines. The Richmond Senior Center on St. Croix resumed center activities in outdoor spaces and had a large celebration with music, dance, and of course, lots of local food. We are currently in the last lap of repairs of our Richmond Senior Center. Bathrooms were gutted and completely renovated and will be ADA accessible. We anticipate our seniors will return to the Senior Center by the end of October 2022. I'm pleased to report that during fiscal year 2022, the St. Croix Senior Citizens Affairs Division relocated their program and administrative offices from the Herbert Grigg Home for the Aged campus to an office suite at Mars Hill in Frederiksted, located right next to the Division of Family Assistance in our Medicaid office building. As a result, our seniors and adults with disabilities can access several programs at one location. This past fiscal year, DHS continued to provide elderly protective and social services to include adult protective services, homemaker services, family caregiver support services, pharmaceutical assistance, and medical supplies, and made important referrals to community resources for our seniors. Our APS social workers were instrumental in screening and facilitating the transition of 6 boarders from the Juan Louis Hospital and 4 boarders from the Schneider Regional Hospital to community homes and our homes for the aged since 2020. Our staff took the necessary precautions to ensure new seniors were admitted following our COVID-19 screening and quarantine protocol. To this date, as of yesterday, no senior at the Herbert Grigg Home has contracted the COVID-19 virus. Throughout the pandemic, SCA Division has benefited from several COVID-19 related federal grants for Meals on Wheels, homemaker services, and health and vaccine promotion. During fiscal year 2022, DHS provided 148,151 nutritious hot meals to 951 seniors across the territory. Before the pandemic started in 2020, DH served approximately 450 to 550 seniors in our Meals on Wheels program. That's almost doubled. Now, as the pandemic and the public health emergency is fading, so are federal funding opportunities available to sustain the new influx of seniors, many of whom safely isolated themselves during the safer at home period as per GVI health and pandemic safety guidelines. During this period, we enrolled a substantial number of seniors. The federal funding allowed us to provide a larger number of clients who needed nutritious hot meals to be delivered to their homes. The reduction of federal funds, also known as the unwinding of federal COVID-19 financial assistance and flexibilities, will challenge us at DHS, but we will continue to work with our federal and local partners to assist as many seniors as our funding levels allows. While discussing the beloved members of our senior citizen community, it's particularly important to acknowledge that the Virgin Islands needs more nursing beds for the frail elderly and assisted living residential facilities, for those seniors who require supportive services with their activities of daily living and independent living seniors community. Both the Juan Louis Hospital and Roy Schneider Hospital have an average of 5 to 8 boarders. Boarders are those patients who have officially been discharged because they no longer meet the regulatory standards or have a medical necessity for inpatient care in a hospital, but really have no safe residence to turn to. Persons categorized as boarders may have family members in the territory, but these family members may not be able to take care of them due to their intensive care, or they just really don't want the responsibility of caring for a dependent adult. Although DHS is moving forward with the plans for extensive reconstruction and new construction of a 60-bed nursing facility and nursing home at the current Herbert Grigg Home for the Aged and plans for new construction of another 60-bed facility and nursing home to replace the current Queen Louise home for the aged on St. Thomas. Completion of these facilities will likely not be completed until the late 2024 or early 2025. DHS currently provides residential services at the Queen Louise Home for the Aged with a capacity of 17, and the Herbert Grigg Home for the Aged has a capacity to house and care for 26 residents. Since the 2017 Category 5s of Irma Maria, Herbert Grigg Home had to reduce its capacity from 40 to 26. DHS continues to work with our 2 local hospitals and family members to secure safe accommodations for our frail elderly seniors who need nursing home level care. However, our current ability to accept new residents at both the Queen Louise Home and Herbert Grigg for their age is extremely limited. The Office of Legal Counsel provides advice and identifies legal issues within and on behalf of the department. It is responsible for drafting, reviewing, and facilitating the execution of DHS contracts, overseeing the Crime Victims Compensation Program, taking a crucial role in drafting legislation that impacts the department and its constituents, managing the hearings and appeals process for all benefits offered by the department, assisting in the oversight of the Medicaid fraud unit, providing advice on personnel disciplinary issues, and providing policy and procedure guidance to all DHS divisions. Thus far, this fiscal year, the office has executed 17 new professional service contracts, MOUs, and MOAs, drafted proposed legislation to enhance the territory's child welfare statute, and established the territory's first ever child fatality review team. The CRFT, a 16-member panel created through Governor Albert Bryan Jr.'s Executive Order number 515-2021, will examine the circumstances of deaths or near deaths of minors to provide policy recommendations to prevent avoidable childhood death or severe injury from occurring in the future. In fiscal year 2022, the Crime Victims Compensation Program reviewed 58 applications and approved 54 claims. Of the reviewed claims, CVCP has approved $391,888.89 in payments that remain outstanding. Our goal is to make sure that that's paid by the end of the fiscal year. We're also working to pay, as we work to pay all the outstanding claims by the end of the fiscal year, this would result in about 70% or $278,516.62 of federal reimbursement award. The Division of Operations includes maintenance, transportation, capital projects, and disaster recovery. DHS recently hired a new OSHA specialist who will work with our divisions and programs to review, evaluate, and design programs and procedures to ensure workplace safety for our residents. With capital projects and disaster recovery, some major DHS territorial projects are underway. The Richmond Senior Center was awarded $61,910 in FEMA Hazard Mitigation Grant, or HMGP. Based on the walkthrough by HMGP, the Department of Public Works determined that visual assessments of the complex were insufficient in determining an accurate vulnerability and engineering analysis of the complex. Therefore, a request was made to HMGP for the required software needed to complete the structural analysis. A required software structural analysis will also be needed to complete a wind vulnerability study for the following projects: Kings Hill Head Start Wind Retrofit, which was awarded $83,659.93. The Hurricane Wind Retrofit for Mars Hill Administration Head Start, which received an award of $54,988.85. The Anna's Hope Complex Wind Retrofit, which received a Hazard Mitigation Award for $83,715.52. The Estate Diamond Complex Wind Retrofit with an award of $20,286.49. These projects are still currently under DPW review, awaiting the results of a digital structural analysis before we can submit a final assessment. The Youth Rehabilitation Center was awarded a total of $1.1 million for the wind retrofit project. We're still in phase 1 of that project. The Queen Louise Home for the Aged, pleased to announce this, has been awarded a full prudent replacement at a cost of $73 million by the Federal Emergency Management Agency. This award represents an excellent opportunity for DHS to improve the care of the elderly in the Virgin Islands. DHS, with the assistance of Department of Property and Procurement, will be entering into negotiations with the owners of the selected site for the new Queen Louise Home for the Aged skilled nursing facility. The Herbert Grigg Home for the Aged was also awarded a full prudent replacement by FEMA. $100 million will be provided in the pending obligation. The funding will be used towards the construction of a new 60-bed nursing facility right at the site in Kings Hill. Herbert Grigg Home also reopened their newly refurbished kitchen, looks beautiful, dining area, conference room, and front lounge patio as part of their quality improvement initiative. The Division of Operations has oversight of the transportation unit, which the staff are instrumental in delivering services to the frail and elderly. In addition, DHS has 22 facilities that require regular and routine maintenance. Under the Office of the Commissioner, the Management Information Systems Office supports over 700 employees spread across 3 islands and 13 sites with a staff of less than 10. The MIS office is also slated to make a complete overhaul of the VIDHS website to one that is more state-of-the-art, visually appealing, and easier to access for our clients and the public. MIS is currently overseeing the migration of the DHS website. The office also provides nonprofit and support services, which is programmatic and fiscal oversight for DHS assigned private sector nonprofit agencies appropriated funds in the miscellaneous section of the GVI budget. DHS provides programs and services to prevent homelessness, and we rely heavily on our partner agencies, both government and nonprofit, to assist in the intervention to provide substance abuse services, behavioral health, and treatment services and housing to those clients in need. The Department of Human Services has oversight of 29 GVI-funded programs through Act number 8489 or Bill 34-0124. The Crisis Intervention and GVI Miscellaneous Act 8474, Bill number 34-0109, totaling $2,849,000, of which 23% fund 9 homeless programs territorially. Services also funded include 1 soup kitchen, 4 shelter-based programs, 2 transitional housing, and 1 street outreach, and 1 homeless prevention. Recently, the Department of Human Service, in partnership with government agencies, nonprofit, and community-based homeless providers, hosted the 2022 Project Homeless Connect events held in May. PHC is an outreach activity to assist the unsheltered homeless and persons at risk for homelessness to gain access to much-needed services. Medical services were provided by the Department of Health and Frederiksted Health Center. In conjunction with Project Homeless Connect, partner agencies established a disaster registry of unsheltered homeless. The registry serves to ensure unsheltered homeless are identified for access to services pre-disaster, during, and post-disaster. Approximately 211 individuals receive services and/or linkages to services at the PHC events. Our Office of Communications is responsible for coordinating and comprehensive effort to inform the public of the department's goals and plans and activities through various media outlets. The team also oversees and coordinates the writing, publication, and production of all communication products, printed materials, photos, videos, website, and social media postings generated from DHS. We recently hired a Director of Communications and Public Information Officer to enhance the department's public and digital outreach. In recent months, the office has initiated radio commercial campaigns for the Office of Head Start's preschool registration, the Division of Family Services PEBT and PEEF disbursements, and the Affordable Connectivity Program under SNAP and Medicaid to heighten the awareness of many services DHS provides to the community. In addition to producing educational promos on DHS topics such as Medicaid presumptive eligibility and ESF 6 mass care, The communications team also scripted a web-based Did You Know electronic ad series to provide the public with pertinent information that may not be widely known. During today, I believe earlier today and maybe after, we'll be showing a highlight video, and therefore I will not read the next section. These are highlights from our 2022 year, which basically lets you know exactly what we've been through and what we've accomplished. For fiscal year 2023, our goals, we continue to strive to be better each year. This year, we plan to execute an increase in professional and credential workforce throughout DHS, provide professional development and training opportunities for the DHS workforce, increase internal and external communications using multimedia sources. We'll assess and improve our customer satisfaction, restructure the fiscal office, create a mass care disaster preparedness office, successfully advance the Head Start disaster recovery projects to construction phase, meeting all projected scheduled deadlines. Issue requests for proposals for architectural and engineering services for the Herbert Grigg and Queen Louise Holmes skilled nursing facilities and nursing homes. We'll execute the PSC for selected vendors and initiate that design phase. We'll implement a collaborative multi-agency child care conference. We'll vet and finalize updated dependency code language for sponsorship and action by the end of the fiscal year. We'll obtain FEBLA obligation for both the Homes for the Aged projects and enter into the design phase. We'll challenge the most recent FEMA denial of the prudent replacement decision for Newt Hansen to receive at least 50% of the replacement. We want to complete the temporary repairs to the St. John Multipurpose Center in this first quarter of fiscal year 2023, completing the renovations to the group homes and YRC facilities, execute the Red Main contract amendment to complete the VIBES Phase 2, and proceed with finalization of VIBES integration for Medicaid, SNAP, TANF, childcare, AABD, and the LIHEAP and ECAP programs. We'll identify and appoint required members for all three disabilities state councils, the VI Developmental Disabilities Council, the Statewide Independent Living Council, and the State Rehabilitation Council in full alignment with the federal statutory requirements. And we're going to begin working on our DHS policies and procedures. Senators, thank you for giving my DHS team and I the opportunity to present our fiscal year 2023 budget recommendations to you this morning. We're very proud of our accomplishments as these directly impact the services delivered to the most vulnerable and those in need. We recognize the challenges ahead of us and are excited about the opportunities those challenges will provide. With the support from this body, our community, and our local and federal partners, we will continue to provide social services that will enhance the quality of life for individuals and families with diverse needs. Our goals and mandates are ambitious, especially our vision of the 2 skilled nursing facilities and the state-of-the-art Head Start centers. I would like to thank Governor Bryan, my fellow colleagues in this administration, and the 34th Legislature for your ongoing support for the people we serve daily. And as always, a special thank you to the Department of Human Services employees, our workforce. None of our accomplishments could have been realized today without their daily commitment and hard work. Honorable Chairman Senator Kurt A. Ville, this concludes our fiscal year 2023 budget testimony. And as the DHS stands by, ready to answer any questions the Committee on Finance may have. Thank you, sir.
Thank you, Commissioner, for your testimony. I'd also like to welcome Senator Kenneth Gittens, who have joined us, committee member, Senator Dwayne DeGraff, who has joined us, and I think I had everybody else before. I did say your name, you were not here. We're going to go to a 7-minute round, colleagues. I said Senator Kenneth Gittens. You guys are not listening or no? That's different. Point of inquiry, Senator Kenneth Gittens. Okay, go ahead.
Thank you, Mr. Chair. Good morning to all. I listened to the testimony on my way here and picked up where I came out of the car to here, but did I miss anything about...
1 minute, Senator Gittens. Let's take a 1-minute recess. I was just being informed that you had a video presentation.
Yes, yes, sir.
Did you want it shown?
I would prefer to, yes.
Okay, so let's go ahead with a video presentation, then we'll go to the point of inquiry.
The Virgin Islands Department of Human Services cares deeply about our community, and it shows through the direct services we provide daily to our constituents, which includes your mother, father, grandparents, aunties, uncles, children, cousins, classmates, and friends. In fiscal year 2022, our dedicated workforce of about 700 employees across St. Croix, St. Thomas, and St. John provided services to approximately 40,000 community residents to ensure daily access to critical resources to our most vulnerable. The Virgin Islands Department of Human Services was awarded $42 million in federal funding for the construction of 8 Head Start facilities throughout the territory. The grant award will require zero local match to fund the construction and restoration of facilities territory-wide. The Office of Head Start provided in-person early childhood educational services to over 500 preschoolers in the territory for school year 2021 to 2022 during the COVID pandemic. The Office of Head Start was awarded a new 5-year grant to administer Head Start services after successfully attaining a recompete bid for renewal. The grant will help administer Head Start services to approximately 794 preschoolers in the territory. The Office of Child Care and Regulatory Services made over $1.5 million in COVID-19 funds available for improvements to licensed child care facilities to provide improved quality child care to our children through mini grants. This year, the Office of Child Care and Regulatory Services received $34 million in American Rescue Plan funding for child care stabilization, which helps eligible child care providers by covering their full operational costs for January to June 2022. Our Office of Intake and Emergency Services provided a Child Protective Services System Awareness Initiative and provided interactive virtual child abuse and neglect trainings locally. The Division of Children and Family Services provided family support and therapeutic in-home services for more than 140 children in Department of Human Services Protective Services Unit and served an additional 79 children in foster care. The Office of Residential and Interstate Compact Affairs provided support services to 104 Virgin Islanders who have been placed in local and off-island residential facilities. A total of $65.4 million in Pandemic Supplemental Nutrition Assistance Program emergency allotments, known as PSNAP, were issued to nearly 14,000 SNAP households in fiscal year 2022. DHS applied for and secured nearly $6.4 million in additional federal Pandemic Electronic Benefits Transfer, or PEBT funds, for approximately 12,500 children and youth in public and private schools. These benefits will help with food insecurity across our territory and assist the economy by providing emergency food assistance. Our Medicaid division has enrolled over 1,127 medical providers here in the territory, in Puerto Rico, and the mainland to provide critical medical services to over 36,000 residents enrolled in the VI Medicaid program. This is an additional 327 more providers and 3,000 additional Medicaid members as reported last year. Last year, Medicaid launched a new business opportunity called Personal Care Attendant, in-home support services that will benefit our senior citizens. Under the Brian Roach administration's broader healthy housing initiative, DHS and other stakeholders actively participated in intensive work sessions to help utilize our financial resources to either build or retrofit facilities for at-risk populations. Through collaborative efforts, DHS has made significant progress in the ability to launch the Health Information Exchange through partnership with the Office of the Governor to draft legislation, a telehealth strategic plan, and secure the federal dollars to contract a leading project management organization to help lead the design and development of the HIE.
Thank you for that presentation. We can now move to, that's the end?
Not really, but that's okay.
Okay, we'll move to a point of
We'll submit that.
We'll move to a point of inquiry. Senator Gittins.
Thank you. Thank you, Mr. Chair. Good morning again. As I was saying, I was tuned into the testimony on my way here, and coming in, I picked up where I left off, but I didn't hear anything on premium pay for your employees. Did I miss that? Or can you tell us something about the premium pay before we get into our discussion?
Sure. Department of Human Services submitted our application by the end of May, which was the due date to Division of Personnel, and it's currently being reviewed. So how I feel is Department of Human Services have essential employees, and so we recommended highly that they get premium pay.
Thank you so much, Commissioner. We'll go to a 7-minute round. Human Services is a big entity, a large entity, so every senator will have 7 minutes. Senator Blyden, you recognize.
Thank you so much, Mr. Chair. Good morning to my colleagues, listening and viewing audiences, staff, central staff. Good morning, Commissioner Cozy Gomez and your support and management team there. And thank you so much for that most comprehensive testimony. Yeah, it is a large agency. You have a lot of responsibilities, and you play a vital role here in our community. I'm going to focus my line of questioning mainly on the grants area, and I have a comment right quick before I go into my testimony, because I know you mentioned the emergency pandemic funds for family making below $50,000. I know you're on the board of the Housing Authority. Have you spoken to the director and the board in terms of sending out notice to the residents immediately to assure that this money is available for them? Because I know there are many residents that call my office on a daily basis that needs this assistance. Have that been done?
Informally, we spoke of it, but it was an open enrollment. We did put a public press release out on it.
Okay, I'll reach out to the authority. They need to put out something to the residents like ASAP, because that's the only way the residents respond.
We got over, I believe it was over 2,000 applications within the first week.
From the housing communities?
No,
exactly.
within our community,
That's
yeah.
my point. That's my point. You have over 2,500 individuals within housing and Section 8. They need to get information immediately. I think that will help. Okay, it's about using the money, right? That's what it's for.
Oh, yes.
Emergency. Okay? Very well. Let me go to the post-audit report. I know you mentioned you have 146 vacancies. Those 146, first of all, are those vacancies funded at 100%, 50%? How much are federal? How much are under the general fund?
So we have some duplicated accounts, because in the post audit, you'll see the match requirement. So you'll see the positions listed twice, and that means that some are general and fund. So you'll make sure that you understand that. So right now, of the current vacancies, we have actually filled 57 of those. We're in the process of 25 interviewing and onboarding. We've posted currently 12 on our Division of Personnel website. 4 were posted, but we didn't get a response. Unfortunately, the credentials didn't meet. We're restructuring another 4, and then 17 are not necessarily in the budget.
Quickly, of the 146, you say you filled 56. Is that subtracted from the 146 or in addition to?
Correct.
So it's subtracted from the 146.
So some of those that were listed as a vacancy, we've since filled.
Okay, very well. Thank you for that. And in respect to your budget and the post-audit report, page 2, is showing actual for fiscal year 2022 is 21,970,320. But is that actual, or is that amount expended year to date? Can you clarify for me? Okay, you have the 2021 expenditures, 18,982,000. Fiscal year 22 actual, 21,970. Is that actual or amount expended year to date? And if not, how much have you expended thus far year to date?
We can, CFO McGrath, you have the expenditures to date. I'm not exactly sure where you're looking on page 2.
She would know. Page 2 of the post-audit report.
Under general fund or federal funds?
General fund. I just need to know, is that correct? It says actual for 2022, or is it amount expended?
In the total for general fund that we've expended 73 million.
Excuse me?
I'm looking at the chart, so you can, where it has the actuals for 2022 of the 73
Correct,
million,
at the
which-
bottom, but I'm talking in personal services. That's what I'm talking about, in personal service.
Personnel services for 2022 to date, general fund.
Correct.
Actually, we analyzed this yesterday. We have spent 15,521,557. We're projected to spend another 4,068,757 for a total of 19,590,315.
Okay,
for
that's
fiscal year 22.
Okay, very well. That's what I want to find out. So that's basically $1 million below what your appropriations are, and most likely that will cover the vacancies, the difference. Okay, let's go to federal grants. What's your actual for federal grants for this fiscal 22? Amount expended to date. Personal service.
1 second, we'll pull it up for you.
Okay, why is she looking?
Sorry, Lydia McGrath, CFO. For federal grants, we've expended 11,635,511 to date. We're projected to spend another 3,050,085 for a total of 14,685,596.40.
2 minutes.
Okay.
So our total combined expenditure expected for 2022 is 34,275,911.80.
Thank you for that. Let's take on the federal grants, because I know that in the postal report you have a chart for federal grants on page, I believe, 7. Is that 7? Yes, 7. And you have the amount, the period, what it's for, and the funding, but you do not, and most of them have expiration date of September, most of them. Do you have a chart showing the balances that's left in those funding accounts? Because it's important to know if we are spending the money and what the balances are. If not, can you please provide that to the chair?
Chair, sure.
So we need to know the balances, and if you do have it, can you share it with us via
So page 6 is what you're
Electronically?
referring to, the formula grants?
6 and 7, yes.
So page 7 is actually
I know 7 is local grants, but nonetheless, we need to know what the balances are, because it's critical to know what the balances are
Really know.
moving forward. Okay, it's very important that we know, because I know you have some $200+ million in federal grants, so we need to know exactly what's being spent, what's not being spent, and if so, why not, and what needs to be done on behalf of us, how we can assist you in spending those funds. I think that's very important to know, because you have a large responsibility, and that's why I asked you to assure that the housing authority, they actually give that to the tenant in their hand. It's very important that we spend these funds. And I know you spoke to 9 different funds you get in terms of homelessness and housing. And on a daily basis, myself and many of my colleagues get inquiries every single day in terms of assistance from our constituents. And I would like to know in terms of those different funds, especially when it comes to the non-for-profit, which fills a very important void, Mr. Chair, in our community. And when it comes to many of these individuals, my brother's works at Croix Mission Outreach, Catholic Charities, these amount also is not sufficient, because I send people there on a daily, and they out of money, they out of funds. Is there any other funds within your department that can assist those areas and those individuals? Because right now we're in a crisis, as you know, and we have a lot of funds in a lot of areas. How can we supplement? How can we assist moving forward from your point of view?
I believe our nonprofit director and support services, Kendall Tutine, has been working with the nonprofits, so we may be able to look to see if there are grants that they can individually apply for versus having to go through the government. So most of them are nonprofits, and sometimes they are eligible for that. But within DHS, I don't think we have any extra money for those that are in the homeless population, but I do know that that's a big concern.
Well, I think it's important that we have the balances, so because I really want to deep dive into the balances, but I don't have the balances, so I cannot inquire about that. And I think that's critical.
Each
Okay?
grant is specified for a particular purpose, and so like an ARPA Meals on Wheels would only provide Meals on Wheels.
Understood, but still it's good to know the balances
Sure.
while we are doing a budget.
Be happy to.
Budget. Thank you, Mr. Chair, for the time.
Thank you, Senator Blyden. Commissioner, I reference your Meals on Wheels and the concern of those vendors with the escalating price of food.
Yes.
So when you originally entered into the contract, food was a certain price, and now it has literally almost doubled.
Correct.
A lot of them are struggling because there's no longer any profit and they're actually losing money. Have you been able to take care of that?
Not yet, but we are working on it. So we are working on increasing their all of the contracts for the food costs to a couple, especially
Okay.
since you called. Yeah.
What's the delay though? They're literally going belly up trying to
Well,
provide food.
we have to do an amendment, but we just need to make sure that we identify the funding to increase that.
You have a target date? Anyone has a target date as to when we'll be able to? If not, some of them are just not going to continue to provide the service because they can no longer afford it.
We'll do the assessment, and I'll make sure that I'll do the follow-up next week to see what we can do.
You need to really, really.
100%, agreed.
Senator
Yes, sir.
Joseph, you recognize. Senator Francis, excuse, I'm sorry. Go ahead, then, Senator Joseph.
A pleasant good day to you, Mr. Chairman. A pleasant good day to our colleagues, as well as the listening and viewing audience and the testifiers from the Department of Human Services. I just want to say thank you to all of you and all the employees at the Department of Human Services for doing the job that you do. I know it's not easy. The work is very challenging and it can be frustrating, but I definitely want to encourage you to continue to press on regardless. Commissioner, you and your executive team, I want to thank you also for a comprehensive report. It was well put together. I would like to begin my line of questioning on page 19 of your testimony. And I'm focusing mostly on the services that are being provided under this program on page 19. Kindly indicate the amount of persons being served right now for this program.
So for VI Medicaid, it's over 36,000.
36.
Each we get a daily rate, so sometimes it's 36,678. Some people
36,000. I'm not going to ask you for the breakdown per district. How much has been expended? And this is VI Medicaid. This is an expansion program, correct?
We have actually 3 grants under Medicaid. So you want to know for each one?
Yes, that would be
Okay.
helpful that we know how much has been expended thus far. And give me a moment too, because I'm here trying to make sure I jot down these notes. Okay.
I believe you're pulling that up.
Okay, my time.
The actual amount expended on Medicaid for each of the federal and the general fund?
Yes, I'm going to need that information.
Okay, we will provide that to you.
Okay, so if you could provide that. Also, then I wanted to skip, if we can, to page 24, relative to the Crisis Intervention Fund. Kindly indicate for us the amount of funding currently available in the Crisis Intervention Fund. Please know that I note in the post-audit report, getting a little acclimated to taking my notes electronically and putting them in, that there wasn't any monies that were expended. I don't see anything here relative to expenditures in that fund. So if you could put on the record how much has been expended to date, and in addition to that, I will also need from you the amount of cases that are open and as well as the amount of application that are scheduled for payment. There wasn't any information on that.
For
I
crisis?
noticed, Yeah, the crisis. Please bear with me and follow me. I noted last year you mentioned 405 cases. So I did a brief comparative analysis, and I just wanted to see how much have been actually paid out.
Just want to make sure we're talking about the same thing. So the criminal victims is what you're referring to, not the crisis intervention fund.
It's the criminal victims, yes.
Okay.
I'm sorry.
Yeah, they're two different funds. Chief Legal Counsel Kimberly Berry.
The mic, please. Thank you.
So can you repeat specifically what number you're looking for?
Okay. Actually, it's the amount that has been paid out for the criminal victims. Let me see something here.
So we have an outstanding dollar amount of $331,537.41, and we're $331. $331,000.
Just pull the mic a little closer, Attorney.
$331,537.41 as of June 30th, 2022 is the amount that we've awarded but yet to pay.
Okay.
We plan to pay that full amount by the end of the fiscal year.
Okay. Thank you so much. And how many applicants would that serve?
I do not have that exact number. I know that we have reviewed and approved 54 applicants this year, but there were applicants from previous years that were approved and were not paid because we didn't have the funds.
Okay, and do you have a number amount that you need to have to pay those who have not been paid, and you have applications that have been approved?
So, yeah, so that amount would be $391,880.89 as of yesterday.
Okay, and so you may not have sufficient funding in your fiscal year 2022 budget to cover those costs?
Correct, but we are hoping to pay that. Yeah, we're hoping to be able to pay that full amount.
All right, I will move on. My time is running. I do have another question. In your fiscal year 2022 budget hearing testimony, Commissioner, you indicated you have received funding, and this is for the YRC, and it was $1.1 million. What was the funding source?
That was the local general fund, I believe.
General fund.
But we also have a WIN retrofit program going on for YRC.
Well, let's just focus on the general fund for this line of questioning. Where are we with that phase of funding and to complete the phase that was required for YRC, the 1.1 million?
It's in various phases, but I'm going to allow Deputy Commissioner of Operations, Miguel Tricoci, to talk about it because he's been actively involved.
Good morning, Deputy Commissioner Tricoci, Operations, DHS. Thank you, Commissioner. Senator, as the Commissioner indicated, we are in...
Be comfortable. Yes.
We are in different phases for that 1.1 million. We have looked at and we're getting quotes for changing out several things there. Where we're looking at security cameras. We're looking at revamping and enhancing some of the dormitories as well. We're also using some of that money because it is shared with our youth group home.
Okay. So, Deputy Commissioner Tricoci. Mr. Chairman, I have one more follow-up question. I just want you to note that the time frame to that the commissioner has stated last year was December 2022. Are we on target? That's my question, and I do have one final question that I want to ask because it cannot be that we're planning. Go ahead and ask the
question, Senator, please.
Okay, so are we on target to meet what the commissioner indicated last year was 2022, December 2022, to get that finalized?
Yes, ma'am.
Okay. Now, I just also wanted, this is my final question because I didn't see anything mentioned in the post-audit report relative to your indirect cost. He has it, we have it there. Are any of your indirect costs being used to cover personnel services?
No, it's not. Lady McGrath, CFO, no.
What is it used to
No
cover?
personnel cost is being used for personnel. The indirect cost is pretty much to
Could you speak into
the
the mic,
indirect cost is used to subsidize those program costs. For instance, like electricity, utility, telephone costs that are
IT services?
Correct.
Okay. All right. That is it. Thank you kindly, Mr. Chairman, for
Thank
the leeway.
you.
I appreciate you, and I appreciate the members
Thank
of
you,
the staff
Senator
for
Joseph.
Human Services. Thank you.
Senator Francis, you're recognized.
Thank you very much, Mr. Chair. Good morning to you. Good morning to the fine folks from DHS. And good morning to the people of the Virgins. Commissioner, thank you very much for your comprehensive testimony this morning. And certainly DHS have a lot going on. I see that you're building out your media team so that you continue to update the public and what's happening there. So kudos for that. In respect to, obviously you have a large department, as you've indicated, some 29 division. Have there been any consideration, discussion whatsoever in respect to restructuring, consolidation, shaving off, some of these areas?
I think when you talk about shaving off, and we serve the public, so to shave off, you mean like consolidate divisions, or what are you referring to specifically?
I guess either transfer them elsewhere where they're better suited, or some needs restructuring, something that would make it a little bit more manageable. Is what I'm seeking.
I think if you have good people in place, you're easily manageable. So right now, our workforce has been down a little bit, but we have some really good people that have come on board. We're definitely going to be restructuring our fiscal office because I feel like we need to. That definitely needs to come first, and then we have 3 new people that just started in our HR.
So let's talk a little bit about a restructuring of the fiscal office because you and I have spoken about this area for quite some time. What is your end stake? What is your end goal in the restructuring of your financial office?
Have more than 4 people would be the first, but I'll have CFO McGrath talk a little bit about our vision.
Lady McGrath, CFO. The way the fiscal office is currently structured, it was structured for operation under the FMS system. With the change to the ERP system, that never changed. So we don't have separation of duties. One accountant is going to do everything from vetting the requisition to putting in the payments to preparing the financial reports to doing the draws. So there is absolutely no separation of duties. So that will definitely be one of the factors in consideration. We're going to establish an accounts payables unit. We're also going to grow the asset and inventory unit. As we're a large department, we have a lot of moving parts where that is concerned.
So essentially, you're hoping to achieve effectiveness, efficiency, and faster service to our community, correct?
And in turn, allowability, allocability, and reasonableness relative to our federal grants.
And timely payment.
Absolutely.
Thank you. In terms of your miscellaneous disbursement, obviously, I saw that there is a significant reduction from FY 2022 to FY 2023. What is the reason for that significant reduction? 2.2 the last time, now $625,000.
Lady McGrath, CFO, the biggest reduction was in the energy assistance. It was reduced from 1.1 to 500,000, and pretty much that was done after looking in the spending pattern over the years. And on top of that, the amount of federal dollars that are coming in specifically for LIHEAP, which is the federal component of ECAP, and LIWAP, which is a water component that we're also receiving.
All right, we're not, again, reducing the services that's made to those in need of that, right?
Absolutely not.
Very well. Collective collaboration, the $40,000, have they yet to receive that money? What's the situation with that?
Doug, go ahead. Ms. Tutine is online, and she's in charge of our nonprofits. Kendall, do you mind?
No, good morning, everyone.
Morning.
Kendall Tutine, Director of Nonprofits and Support Services.
You need to speak up a bit,
collective-
get closer to the device. We could barely hear you.
Can you hear me now?
Go ahead.
Is that?
That's
Oh,
better.
that's better. Okay. Kendall Tutine, Director of Nonprofits and Support Services, DHS. Could you repeat the question, Senator Francis, please?
I was asking about the funding for collective collaboration, the $40,000 that's been pending for some time now.
The requisition has been made in order for me to.
Please put on your
move
camera, Ms.
forward with-
Tutine. Put on your camera.
Excuse me?
Can you put on
Oh,
your
I'm
camera?
sorry. Hold on.
Hold my time, please.
Okay, here I am. Sorry about that. As I was saying, the requisition for the funds has been created. I am unable to move forward with the purchase order. I'm waiting supporting documentation that is required to move forward with that. I have not received it from Collective Collaborations. Once I receive it, I can move forward.
Very well. We'll talk a little bit offline on that. Commissioner, in regards to your vacancy, what's the total vacancies you have currently?
I was just noting that there is in the appendix section for the federal grants expenditures, so you can see that in the appendix section.
So my bigger question is, what's the issue of this rapid turnover? I saw that you had, of course, 32 retirements, which is understood.
2 minutes.
25 resignation, of course, a death, and then a termination. Your DHS employees are long tenured employees. Some of you that sit right before me here have been here for over perhaps about 20 years. So what is the...
I've actually did an exit interview during our time that we didn't have an HRDC. So I've actually done probably 10 of the exit interviews. Most of them leave because of more money. That's been part of it. They've left to go get higher wages at another agency and/or private. Some were just at a place where it wasn't a good fit for them. So I can think of 2 that were not comfortable doing the work that we do and felt like that might be a better change for them.
Very well. In regards to presumptive eligibility, I heard in your testimony that you have made some payments to our hospital as well as I didn't see anything for BOC. Have you been able to resolve the issue with BOC and payment? To the hospital through BOC.
Go ahead.
Mikal Reimer Brown, Assistant Commissioner with Oversight of Medicaid Program. You mentioned presumptive eligibility. Those are only for the hospital payments. So when an individual is in BOC, their care is usually covered there. When they go to the hospital, it takes a period of time before we would even consider paying for that particular person because they're not Medicaid members when they're at BOC.
We have had meetings in respect to that because there's still aged debt on the hospital's finances in regards to monies owed by DHS on the behalf of BOC.
Well, Senator, as we had shared before, there may be indication that this is a DHS debt. However, we do not always agree with that. So although people indicate this is DHS, many units say this belongs to DHS. But we pay our bills to the hospitals as they bill us on the MMIS claim system. So those past bills, individuals may have indicated it belongs to DHS, but many times we do not agree.
Very well. Let's move on from there. Mr. Chair, if I could just conclude.
Yes, you may.
In respect to the borders at the hospital, is there a long-range plan in addressing our borders at both hospitals?
If I can get my 2 skilled nursings built, that might help. That's a long-term plan. An immediate plan would be, we have the opportunity, if needed, to expand some services at Herbert Grigg, but it will definitely cost additional funds in order for us to expand staff and get that unit ready. So we've actually taken 8 borders already. Other option would be to potentially coordinate depending upon their services out of territory.
Very well. Thank you, Mr. Chair, for the time. I'll wait for the second round. Thanks.
Thank you, Senator Francis. So no immediate plans to remove those 20-something borders territorially from the hospital?
I don't believe it's 20 right now. I believe it's more like 8. But we actually just took 2.
8 on St. Thomas, 5 on St. Croix?
Yeah, so we meet regularly with the hospital. So we actually just took 1 from regional and 1 from Juan Louis. Mm-hmm.
Okay.
So we've actually taken on regular
Okay.
as much as we can. And we,
Now, to the limited beds on St. Croix, we have patients that stay in the emergency room after they have been admitted because there are no beds upstairs. Okay, Senator James, you're recognized.
Good morning to the people of the U.S. Virgin Islands. Thank you, testifiers, for being here. My question to the Department of Human Services: when it comes to the homemakers, supervisors in both districts, are those positions filled?
McCall Reimer Brown, Assistant Commissioner. For the homemaker positions, we have some vacancies currently.
How many vacancies?
Under our ARPA grant, we are pending our personnel requisitions. We will be processing those. We got a new grant. So we have 4 there. And as soon as we get those PRFs, they're going to be advertised on the Division of Personnel.
How long those positions have been vacant? And in the interim, who have been filling in those roles to make sure that we have homemaker supervisors in both districts?
Well, we continue. We had a resignation on the island of St. Croix. So
how recent was that resignation?
I would say maybe 6 to 8 weeks ago.
Okay.
So that position is one of our, we have actually changed the position. We're going to have a director of homemaker services and an assistant director of homemaker services.
So I'm not sure if I'm following, but are we accepting applicants or we're waiting for the approval with the ARPA funds?
We are going to be filling those with our social service block grant. The position was just recently vacated. I would say before the end of September, we're going to have those positions online, the Division of Personnel.
Thank you for placing that on the record. And the director for the nutrition program at St. Croix, do you have anyone there?
The program supervisor, right now our departmental nutritionist oversees St. Croix, but we have a vacancy also on our block grant that is pending. Before September, we should see that online. It's a classified position called Nutrition Program Supervisor.
And as far as the nutrition program, do you have any challenges with that? Do you receive most of your funds federal or is it local funds?
Federal, majority of the funds. We have some staff who are covered under the general fund, but the lion's share of personnel and for the meals are under the federal grants, both block grant and our ARPA grants. And additionally, we have, when people think of our Meals on Wheels, they don't think drivers, they don't think nutrition aides. All of that comprises our nutrition program.
Can you break down to me, as we speak about a budget, the lion's share that you said that is covered by the federal government and the portion that is covered by the local government?
Under the general fund, we probably have about 4 or 5 positions, probably somewhere $200,000. We have probably $600,000 to $700,000 under the federal budget. And of course, food is the other cost, which ranges somewhere about $2 million a year.
Thank you for placing that on the record. And as far as social workers, I know several budget hearings ago, I inquired about the social workers. Have you been able to sort that out? And if so, can you place the good news on the record?
well, I'll be happy to, but I'm going to pass to AC Benjamin. She's been working closely with the union as well as the employees.
Carla Benjamin, Assistant Commissioner. Since we were last before this body, the 9 social workers, former social workers, who have been reclassified as family services specialists have moved fully into those positions. They've received their NOPAs and the corresponding change in pay. We currently have 12 social workers on board, one currently being onboarded.
Can you break them down by district?
Okay, give me one moment. I would need to pull that up.
Sure, no problem. And as we speak about that, I think, well, I asked or inquired about that in our previous hearings. I think there was an issue as far as the supervisors or the individuals who oversee, I think, the St. Croix district, and I think I was told that no one was filling that position, or something with an allotment or something like that.
There are 2 district manager positions.
Yes, the district manager's position.
There are 2 vacant district manager positions in the Division of Children and Family Services, and the district manager positions do require social worker licenses. We do have at least one of those positions that's going to be funded on our social services block grant. And when we have the vacancy approved, we have the PRF in hand, we will be able to post that vacancy to see if we can get any qualified candidates.
Funded for how many years?
When they're funded under the social services block grant, those are usually ongoing.
And then the breakdown that you were looking for as far as per district for the social workers. And in the meantime, while you look for that, I guess I can ask another question regarding the Youth Rehabilitation Center and the Island of St. Croix. As far as the recreational area for those young men and women to play basketball, have you been able to rectify that issue to give them things to do?
I have worked with Sports Park and Recreation and started coordinating to see if we can get that resurfaced. So that's not in our budget currently, but we're working to see if we can get it.
So you know the administration received funds from DOI to resurface a lot of the the tennis courts and basketball courts. So are you
We're
utilizing?
in that line of doing stuff, so I think it's more of the vendor, the last time I spoke with Commissioner White.
Good thing. And as far as the fencing, we have rectified that issue. Are we looking into that?
It's going to be extensive cost. It might be, I don't think we'll be able to cover it in the $1 million that we have, but we'll be portion of it. Part of the YRC.
What is the cost? Have you had a quote done?
To complete the whole fence
At least the area that is like,
that's down. Not sure. DC Chirkachi, did you get a quote on the fence for the part that's falling down? Torres might be online as well.
Deputy Commissioner of Operations, DHS. We are looking at quotes.
The short version, please.
We are, the fence line is very specific, and we previously had a vendor who's no longer doing business on that type of fence. So we are now currently getting quotes for that existing fence line. It's a very specific type of fence, Senator.
Thank you, and Assistant Commissioner.
So of the 9 family services specialists, 2 are on St. Thomas, 7 are on St. Croix. And of the social workers,
Time.
4 are on St. Croix. And 5 on St. Thomas.
Mr. Chair, with your indulgence, I have one last question, and it's regarding the Herbert Gregg home. I know we should have received federal dollars as a result of Hurricanes Irma, Maria. Can you just place a status update? And if you did so in the testimony, I apologize. But
okay.
Can you just place that on the record?
We are pleased to announce that we were approved for a full prudent replacement for Herbert Gregg in an amount of $100 million. So it hasn't been obligated yet, but that we just got approval for that.
Thank you. I know there are many areas where you need to improve, but I want to say congratulations for the things that you're actually working on and moving forward with great progress. Thank you, Mr. Chair, for the time.
Appreciate that.
Thank you, Senator James. Point of information, Senator Leiden.
Thank you, Mr. Chair. Congratulations indeed. You also received $73 million for the Queen Louise home for the age on St. Thomas, but you said you're working with PMP to find a location. Seaview, I think that'll be a perfect spot for
We actually
our seniors, to live out their last days. Have you thought about doing that?
Actually, we have a piece of property that will build a brand new structure that'll be closer to the hospital, and we feel that that might be in the best interest of our clients.
Very well. We'll speak offline. Thank you. Thank you, Mr. Chair.
Thank you, Senator Blyden. Senator Bolquez.
Thank you, Mr. Chair. Good morning and greetings, Commissioner Kazi Gomez and the administrative leadership of the Department of Human Services. Your department plays a vital role in addressing social detriments of health, economic stability, education, social connection, housing and safety in neighborhoods, and the ever-growing access to food. I'm very interested to know a number of things today. Let's start off with page number 5 on the post-auditor's report. You are not slated to receive funding for grief counseling or nurse hiring. How do you plan to deal with that shortfall in those areas?
So for our clients, thank you for the question. For our clients that currently receive Medicaid, we actually are able to pay for private providers for any type of counseling through that. And then anything else that's not Medicaid provided, we usually provide with the general fund.
Okay, is there a cost associated with that?
Cost for Medicaid clients is $0 to department, but it depends on the service that they're getting. So a psychological or a psychiatric might be at one price, but then ongoing family therapy or individual therapy may be different. It just depends on the diagnosis and what the age of the client and what the services are needed.
Okay, noted. I'm aware that the administration was able to secure about $10 million for the Schneider Regional Medical Center to strengthen their nursing and workforce program. Did any of the nurses at DHS, were they included in that allotment for nurses?
Not currently, but we're actually in negotiations right now regarding that. So with Office of Collective Bargaining.
Okay, good. Okay, good. And, we've been talking about vacancies throughout the department. Can someone list or let me know what the numbers associated with vacancies that rolled over from last fiscal year? Would it be all of the vacancies, or is there a number associated from last fiscal year to this fiscal year?
I would have to, if through the indulgence through the chair, may I provide that at a later date? I'll be happy to see how many rolled over from 20. You're talking about from 21 to 22 or 22 to 23?
Okay.
22 to 23, just a clarification. You wanted to see how many vacancies we had in 22 that carry over to 23?
Yes, please.
Okay.
How many grant writers do you have on staff?
Actually, each administrator writes most of their grants. We have one grants administrator by title, but the assistant commissioners are, as well as all of our administrators, mostly write their own grant applications.
Okay, so you technically have enough grant writers to accommodate the number of grants of the department?
It would be nice to have a designated person that could assist with writing them, but the expertise in each of the areas is so specific. We used to have an Office of Research and grants writer, which was very helpful for Department of Human Services, so maybe when we're restructuring, that could be considered.
The connection was severed for a second, but I was asking if you have enough grant writers to accommodate the number of grants of the department.
The answer to that question, Senator, was each administrator and director over the major divisions and their support staff usually write the grants because they're so specific to the area of expertise.
Okay, noted.
Yes.
How many families do you currently have under the TANF? How many families do you have under the TANF program currently?
I'll have to double check, but I do believe that might be in the appendix section, so if you give me a minute, I can find that.
Thank you.
Good morning, Senator McAlroy Brown. We have approximately 50 to 55 families. So the eligibility goes up and down, but on average 50. TANF has been greatly reduced with the changes of the requirements over the last years. And of course, many after 5 years have to come off of TANF.
Okay, and those funds don't expire, correct?
No, they do not expire.
Very good. Okay. I recently became aware of your Aldersville Senior Citizen Center in Frederiksted, which is not functional, but apparently there's a number of individuals that are occupying the space. And it's right next to the to the Frederiksted Health Center.
2 minutes.
Are there any plans to renovate that facility with the department?
I actually met with the Historical Preservation Committee about 2 to 3 weeks ago to kind of get what that would look like, because I know there are specific guidelines for the historic preservation. I think the first thing we'll probably end up doing for fiscal year 23 is to clean it up and to make it a more pleasurable site, and then we can make the assessment of how much it would cost in keeping with the guidelines of the historical preservation of what we can do. So I've been in discussions with that so that it is in our plans for 23 to kind of review.
Thank you. And my last question surrounding crime victims compensation funding. I know that it's been a very challenging area for your department, and I've been in dialogue and communication with individuals in that office, and understand that the funding that would be necessary to accommodate individuals who have lost a loved one, whether it was through some sort of assault or homicide, even resulting in death, obviously. Trying to find funding to accommodate those families has been a very big challenge for the department. I'm looking forward to see what we can do in order to try to help and facilitate in that area. But can you please let us know what your current shortfalls are, specifically actual right now, to date in that area?
Sure. It's almost $400,000 in monies owed to criminal victims of applications that we've reviewed and awarded. So I believe we'll be able to take care of not only for this fiscal year, but past fiscal years, in order to make sure that that's flatlined. And I believe that once we get that situated, then we'll start again. We'll be able to also be able to be reimbursed, is the right word, so once you spend local dollars, then you're eligible to receive federal dollars. But you can't, so if we spent zero money this year, we would get zero money federal. So if we spend $300,000 this year, then we'll be able to be eligible for next year. Did I get that right? So this year, we'll spend that money locally, and then we'll be able to have that federal reimbursement.
Okay,
I hope that
excellent.
answered.
I'd like to collaborate. I'd like to collaborate with you, and I know that the chair of the Housing Committee also would like to collaborate with you on that as well. Mr. Chair, thank you for your leniency.
Thank you, Senator Bolquez. Your residential facilities are off island.
Yes.
I don't see them listed.
Are they in the appendix section?
Yeah, I was trying to find out which appendix section.
It'd be under residential services. And if it was omitted, my apologies, and I'll be happy to get that
what
for you.
page? Can you refer me to the page or what section?
I'm going to work on that for you right now.
Are we up to date with those payments?
They're in various stages. So I think we tried our best to keep up with them. I mean, it could be May and June that we may be past arrears. We just got some invoices through. So I'll have to double check on all of them.
Who handles that they can give me a rundown?
For residential. Evie Monique James is currently online, and she's the administrator for residential and interstate compact affairs. And then AC Benjamin is over that as well.
Okay, can I find out what page it is?
Yeah, I'm working on it right now.
And do we have executed contracts?
For all of our residential facilities, not all of them. No, sir.
Okay, it's been a while for some of them. Which one have we been able to complete an executed contract?
Chief Legal Counsel has that list for you, and they're also in the appendix section as well. We have page 69 for the other question.
Okay, I'm saying out of territory census, or somebody's telling me page 58 also.
No, 68 and 69. It starts on 68.
Okay, do we have an executed contract with Devereaux? What's the contract with Devereaux?
Florida or Texas?
Both.
Okay.
Do we have an executed contract?
Kimberly Berry, Chief Legal Counsel. We have an executed the Devereaux, Texas closed. So all of those residents have been relocated to Sunrise in Florida. There is a current contract with Sunrise. However, we are in the process with DPP, Department of Property and Procurement, of amending that contract to make sure that the residents are added to that one. Devereaux, Florida, the Department of Property and Procurement is drafting that contract, so it is not executed as of yet.
Judge Rodenberg Center?
There is an executed contract for that.
And that the ending date for the contract is?
One moment, Senator. Oh, I apologize. That we're doing a new contract with that, and the date should be from July 1st, 2022 to July 30th, 2024.
Sunrise Community?
Sunrise contract expires this month. Expires the end of this month. We're in process of extending that, and as I said previously, amending the contract to add the new residents and compensation.
And Woodward Academy?
We're in the process of drafting Woodward Academy.
So for all of those, we're on a month-to-month?
Yes, that's correct.
Okay, and they're paid up to when? What month of this year?
It depends. It'll be either May or June, maybe
Okay.
July in some cases.
And if I may add,
Well, we have nobody at Woodward.
Exactly.
Okay, so wasn't there a next one for the mentally incarcerated? Or what's the name of the one in South Florida? Was that under you or
No, Department of Health.
Okay, no problem. Senator DeGraff, you recognize.
Thank you, Mr. Chair. Good morning, colleagues. Good morning, testifiers, all viewing, listening, and present. Commissioner, to you and Department of Human Services, thank you for all you and your team do for the people of the territory. I have a quick outside budget question that I got in regards to, I think it's your PEAF program.
Yes.
What is the status on that? They have clients who are waiting a couple of months, I think it is, for applications. Any feedback on that?
Sure. AC Reimer Brown.
McCall Reimer Brown, Assistant Commissioner. We mentioned we received an overwhelming response to the Pandemic Emergency Assistance Fund, over 2,000 applications. We are going through those applications now with our limited staff, but we anticipate we will start issuing awards in the month of September.
Could you contact the individuals and then pass that information on to them? If you have, don't worry about it, but I think
Senator,
if you could do that, it would be a big help.
We actually have a press release that should be going out today.
Okay, great news. Now, Commissioner, I was, in regards to the crime victim compensation, I understand is $300 and something thousand, but in the 2022 post-audit report, it said there was an award of $72,000. So where are you going to get that money from to pay out $300 plus $1,000 for that?
We're going to find it.
Lydia McGrath, CFO. We are working with the Office of Management and Budget on an appropriation transfer.
Okay, so but these are federal grant monies though, or are they local monies also?
It is local monies that we will pay out. Once we pay those out, it will determine what our grant award is for the next fiscal year. So we're really trying to get those paid this fiscal year so we can have a federal award for next fiscal year.
Okay, great. I got that. Now the outstanding obligations. I noticed, excuse me, in the post-audit report for 23, there are no outstanding obligations. But in the 22 post-audit report, there were, I think, about 6 outstanding obligations. Have they been rectified? Approximately $1.8 million.
From last year to this year?
Correct.
I'll have to double check the vendors on that one, sir. May I get back to you on that?
Okay, sure. Because I'm seeing, like I say, a estimation of about $1.8 million. So you could check on that for me. Thank you very much. The Centennial Living Treasurers, the $25,000 that we get for the centenarians. How many centenarians have that service, and how many centenarians do you have assigned to listed with Human Services?
Well, luckily we were able to do this year, and we're so thankful for this body because it was an incredible experience to deliver the checks to the 100 plus
Yes.
individuals and their families. So we did 6 this past year, and I believe on the waiting list, do you have the waiting list, AC Reimerbaum?
I believe the last time I received that, we had about 8 on the waiting list.
Okay, so 6 was able to be covered by the 25,000. So if we get probably a little more money, we could take care of that 8 before,
As soon as possible.
their time passes.
Yes, so
Okay,
yes.
good. So we could look for another 25,000 to probably make that happen. So I'll put it out to my colleagues to try satisfy those 8 living treasures. Now for the post auditor's report, page 2, I'm seeing a a decrease in personnel, fringe, supplies, other services, utilities. What was the reason for the decrease in the personnel and fringe from 21 million to 20 million 5?
Lydia McGrath, CFO. In personnel, the decrease from last year to this year is because the vacancies are now funded at 50%, the general fund vacancies.
Okay, right. Okay, so then wage increases, were there any wage increases that went into play in 22?
2 minutes.
Yes, sir. I believe correction officers at YRC got increases. A COLA went into effect for Head Start, which is a cost of living adjustment, also went in. I believe we're pending. Oh, steel workers was the other one as well.
Okay, and so with this reduction, even for the positions at 50%, would they be covered in the 23 budget for those wage increases?
Yes, they are covered.
Okay. And then you say you have pending contracts presently?
Yes, they're in negotiations currently.
Okay, so nurses were hired in your miscellaneous budget in 21. And then like we're seeing that there's nothing in the 23 budget for nurse hires. I think it was $1.8 million for nurses that we had. Those nurses are pending negotiation presently, and would they be compensated, be able to be picked up in the 23 budget, or you'll need a supplemental for that?
Yes, to the answer of negotiations for nurses, as far as that's a critical hire, so we would make sure that we need the funding. We would have to do but they're in the budget currently for those positions. If the if what I'm clear, let me just make sure I'm clear. In the event that they get wage increases in the next 2 to 3 months, that may differ in the 23 budget for the personnel for those positions.
Okay, great. Also, you have a Life Alert program. And with your Life Alert program, how much money do you have funded for the Life Alert program?
Time.
McCall Reimer Brown.
If I may wrap up, Mr. Chair.
Yeah, Assistant Commissioner. We have a very small grant that was funded of about $25,000. We're pending some larger funding from our federal Adult Protective Services. So we'll be going forth. We already have a list of vulnerable seniors and adults with disabilities for the very limited funding, and we will let the public know if we get the full award for the Life Alert system on a larger scale.
Okay, federal money is what you said.
I was saying we
20,000.
received under one of our ARPA grants for Adult Protective Services a limited of about $25,000 for life alerts, and our Adult Protective Services unit, our district managers, are assigning seniors and adults with disabilities to those funds. We've applied for additional Life Alert funds, and as soon as we are aware of that award, we will be letting the public know.
And Mr. Chair, if I may finally, because the little delay that we're having over here, can I finally ask in regards to the facility in the old hospital facility? There's a portion of it that was destroyed. I think it was either prior hurricane or it was destroyed from before. What is being done about that facility? Is it one of your capital projects, or is there funding to maintain it for the employees that are in it? I know on the backside is what I'm asking about that been destroyed. Could you just wrap that up for me on the chair's time? And thank you for the time, Mr. Chair.
Good morning again, Senator DeGraff. So that, I believe, is owned by Department of Health is what you're referring to. So it's not a DHS section of Newt Hansen Complex. So Department of Health has two.
Thank you.
Thank you, Senator DeGraff. Before I go to Senator Saru, let me make an inquiry. I was told that the last time you guys were in front of us in, I believe, October, with the EBT, it was said that that you guys, it stopped. And you were supposed to start again in January, but it never happened. For those individuals who were in the program who do not qualify for the new EBT funding, what's going on with that? What's going on in that
So
space?
the PBT, if for school year 21-22 school year, are being dispersed next week. So
Next
if
week?
you were in school during that period of time, we would have gotten your information from either the public schools or the parochial or private schools, and you'll get, they're beginning next week.
And our your public relation person is putting that information out there?
That press release went out this morning. He sure did.
Okay, thank you for that. Senator Saru, I'll recognize you for your 7 minutes.
Thank you. Thank you, Mr. Chair. Acting positions. Tell me how many acting positions you have.
I currently have 7 people in acting positions.
7?
7.
So have you been able to, what is owed to those who are acting from last fiscal year?
Total owed, let me check for you. We're in the process from when we were here before, last year. We had, excuse me one sec. Last year, we came before this body. We've resolved 42, and we have 12 pending that are in the revision phases of the PRF, and 7 have already gone down to O and B. So between last year and this year, 42 have been resolved, and so 12 pending and 7 existing ones are PRFs at O and B.
So did you move them into permanent positions, or did you hire someone to replace?
So most of the ones that are currently acting, 2 are acting because the administrator or the directors are out ill, so they're in they're in a position of acting because somebody's out ill. The other ones are promotional exams regarding YRC. And there's one that is acting that could potentially move into a position. The other one, there's just pending a little bit of negotiation with funding for the district manager position, and that should be resolved by the end of the fiscal year.
And what is owed in totality for back pay for those employees that have been acting for years?
I have to get the total number of what's outstanding.
Who's your financial
currently.
person? Where's your financial? Talk to
Lydia
me.
McGrath.
Lydia McGrath, CFO. My office is working with HR. We've actually did have a call with OMB last week, so we can try and resolve some of the acting. Prior to this hearing, the PRFs did go down. Unfortunately, he had to leave on an emergency, so we will resume when we get back on Monday so we can get it all cleared up by the end of this fiscal year. I don't have a dollar amount, but I can get that and provide it
And
to you.
this is for those who've been acting for a long, okay, now what
Yes,
about
ma'am.
the outstanding payments that we owe to the employees? You had some that worked overtime for long periods of time. We know Mr. Birmingham passed away being owed an excessive amount of money. So tell me, where are we on that, and what is the cost? What is that amount?
Revolving, anyone that passes, it goes to the estate, so we're pending documents to ensure that funding can go to the estate because it can't go to him now, so any death that happens. The outstanding settlement awards and the amounts, I don't have a total, but I can give you the amounts outstanding, and they're currently were signed $9,330 for one individual, $32,000 for another individual, $32,000 for another individual, $484.58 for one, and $3,500. Those are outstanding settlement awards that went through grievances. And so that we have a funding source, and they will be completed and made whole by the end of the fiscal year.
What's the funding source from that? Where is that coming from?
That'll be coming from our general fund budget.
Okay, and what about, so beside your settlements, you still owe existing employees right now that work at DHS?
Just a few left.
Okay, what is
just a
that
few.
amount?
I have one for $15,000. That PRF is outstanding. We're pending that one. One's for $8,700. And as soon as she moves in out of one position into the other, she'll be paid out. I owe $351 for another individual. $1,130, $194, $9,000, and $6,000. The two acting for these are some complications because they were already paid.
So tell me, what's your total amount for those?
I'll have to get it to you.
You have to get it to me. So through the chair, I'm asking for the total amount. Through the chair, I'm asking for the total amount of
acting paid.
what's the aggregate amount that's owed for the existing employees now? And I'm also asking for the outstanding amount owed to those who've been acting for quite some time.
Duly noted.
Got it?
Got
Okay. Now let's talk about voc rehab. You had 4 counselors in the past for voc rehab.
You've had four what?
4 counselors.
Okay.
I'm all over right now. You had 4 counselors in voc rehab before. Now you're down to 2, correct?
McCall Reimer Brown, Assistant Commissioner with Oversight. We actually had 6 counselors.
2 minutes.
One resigned. So St. Thomas had 3, and St. Croix has 3. So in St. Thomas, we have 1 vacancy that is pending to be filled.
Okay, so you're short-staffed in voc rehab, correct?
Could you repeat that, Senator? I didn't hear.
You are short-staffed in voc rehab?
On the St. Thomas, St. John district, yes, we're pending 1 hire.
Okay, now, what is the status of hiring? Is that do you have it as a funded vacancy?
Yes, we actually have it. We're pending a release of the vocational rehab budget. We amended it. We got some increased funding from the grantor, and as soon as that's returned, we'll be able to advertise the vacancy.
Do you have a case management system right now?
No, but
why?
Because right now we just got the contract executed around June 30th.
You know how long you haven't had a case management system in voc rehab?
Very aware, Senator.
Okay, now, is this the reason why you're losing your federal funds in voc rehab?
I am not aware of any federal funds that are being lost. Right now,
Have you sent back federal funds for voc rehab?
we had some unused funds, I know, in our transition services funds.
How much?
I don't know the exact number, but it's across the last couple of years when we had the pandemic and there was reduced school and reduced access to the students.
You realize we have an issue in the voc rehab. What about the building, the office getting renovated? Is that part of your capital outlays?
Yes.
And what's the amount for
To
that?
complete the project, that's the one, I'm assuming you're talking about New
Yes.
Hampton, St.
Yes.
Thomas?
What's that amount?
Do you know the amount?
Mr. Chikuche?
Currently? Can we hear? No? No. Senator, we have an old estimate that's being revised so that it comes in line with the current standards. That estimate was done prior to COVID, and materials have changed since that time.
Okay, so I need an amount for that, for the renovation, through the chair, renovation for the New Hanson voc rehab section, and the case management system. Does that have to be purchased as well?
We have funding for the case management system. The contract has been executed, and we'll be going forth with the final design of that system within the month of September.
Give me a timeline. So you plan to have this system up and running by when?
2 minutes.
I have to meet Senator with the project manager from Geographic Solutions. That's the vendor. I should have a time, and we can, through the chair, send that to you within probably by end of next week. We have a project management meeting.
Mr. Chair, can I ask one more question? We really have an issue in voc rehab. Federal dollars are being lost. We don't have the counselors. The unit is deplorable. No case management system. And that is a critical component of Department of Human Services. The last question I'd like to ask, Mr. Chair, would be the Medicaid program integrity unit. I've asked about this almost every budget season. So you have a director, you have an acting director. What is the status of the med? Because that's critical to the MAP program as well.
Yes, Mikal Rima Brown, Assistant Commissioner. We hired a Director of Program Integrity who then resigned probably 30 days later for another position. We have identified a new permanent Director of Program Integrity and are in the process. It's an exempt position, and we are sending that to the governor. The person was just identified. We have advertised fraud investigators and the quality control, but with the current salaries, we have not had any takers. And so we're hoping with the increase in salaries with unions that we'll be able to get those funded. But the program integrity has an acting director of program integrity until the permanent director assumes the position.
And what's the salary for the acting director? What's the salary? That's not.
It's a prorated salary to the salary of the program integrity director, which is usually about 10% of the monies that the.
Give me a number. I need a number.
The program integrity director has a $75,000 salary. And so the acting director gets a prorated amount for the acting in that role.
Because every year we've been talking about this integrity, the Medicaid program integrity unit. And I'm not seeing a forward movement on that, and that is critical to your federal dollars.
Senator, you will see a forward movement on that very shortly. We'll be glad to introduce you to that new director.
Mr. Chair, we're having a second round? No? Thank you. Thank you for the latitude, Mr. Chair. I see the eyes over here, so thank you.
We'll have a short second round. Mikal Rima Brown, you
Yes.
spoke to the case management. You said you had the funding. What's that amount for the case management?
I'm going to ask Attorney Berry because she has that specific for the geographic solutions. If you can give me the total of that contract. I don't have it right. I know she had the contract listing. I don't want to guess. I know it's over $200,000.
Okay, very well. And while she is looking for that, before I go to Senator Gittins, Commissioner or Ms. the financial person, page 9 of the testimony, the grant award, the federal grants, there's $46,914,000 worth of grants, and you have the grant usage. The 4 the first grant for 809,000. The 4 maintenance personnel, those positions are filled? Are they going to be filled, and when?
I'm not sure what you're referring to, but we do have open maintenance positions, yes.
So they're still open yet? They have not been filled?
They have not been filled.
What about a playground grant, the $3.5 million? They're for all of your facilities, the playground, new
For Head Start.
repairs,
Yeah, for Head Start.
new equipment?
No what?
It's for repairs or brand new equipment?
Brand new, and we are anticipating the supply of the playgrounds, but I can have AC Benjamin talk a little bit more in specifics about that.
Succinctly, please.
Simply. The playground project was contracted out. Currently, the equipment has been purchased. There is an unfortunate delay, a delay related to all of the delays that we have with shipment right now. All that we're doing right now is keeping the Office of Head Start, who is a federal grantor, up to date on when we would possibly be able to get the equipment into the territory and get them installed.
Coos Bay, the $2.2 million, what is it for?
That is to demolish and build a new Head Start site. As a matter of fact, we had our public hearing with CZM yesterday on that project, which went very well.
And do you have a time frame for that one?
After the construction time is about eight months. We just finished the CZM public hearing. There is, I believe, a 30-day period for public comments. Demolition packages and everything have already been submitted. I keep looking at DC Trukocheke. This is actually his lane.
And we have been speaking about Bolongo for some time now, What's going on with Bolongo? $4.4 million. Finally, you have the grant funding. Talk to me about that. That's a critical one right there.
It is one of our Head Start projects. That's fully funded, all federal dollars. It is also one of the 8 projects that's in process. We've already done pre-application meetings with CZM, and so that's also moving along in the process.
Okay, very well. Before we move forward, we're going to take a 2-minute break. We're standing recess for 2 minutes. We're back on the record. Senator Gittins, you're recognized for your 7 minutes.
Thank you, Mr. Chair, and good morning to all once again. Still morning, right? Yep. Commissioner, thank you and your team for your presentation today. First, allow me to thank the men and women of the Department of Human Services for the work that you all have been doing and under the stressful conditions as well. Hence, I want to ensure that these employees receive their premium pay. And while I'm talking about the premium pay, let me just say that these monies are considered wages, and therefore, yes, they will be taxed. So there's a number of people thinking that these wages will not be taxed. On from that, let me go straight because this 7 minutes goes like nothing. Are there any outstanding payments currently to employees acting outside of their capacity?
Monies, so I only have 7 people currently acting.
So,
Are you talking about past monies owed?
yeah, are they owed any acting capacity compensation? On or about July 1st of this year, I contacted you via text. I contacted the assistant commissioner, for St. Croix, and I asked specifically about document that I had received and saw approval from April last year, 2021. And I asked the status of that, those monies owed for the acting compensation. And to date, I have not received an update. I checked with the employee to see if this matter was concluded, and of course, it's not.
So my apologies for that. We've been without a deputy commissioner of HR for 5 months. So I'm doing my best to recover all of that. We're going to make sure that everybody's made whole by the end of the fiscal year. So if we owe any acting pay or any of that outstanding pay, we'll make sure that it's being taken care of before the end of the fiscal year.
Commissioner, I'm going to let you off the hook with that. But I really didn't want to hear that you're without an HR person for the last 4 months, because this particular matter has been pending for quite some time. And again, the document that I am in receipt of has an approval date from April 15, 2021. So there's no excuse for this. Now, are there any outstanding payments to daycare centers or preschool using your Black grants?
AC Benjamin has an update on the payments.
And let me go straight to, because on St. Croix, you know, I'm always calling you all over and over. Doremi and Leap and Learn Academy. Why are they consistently behind on the payments? Why are we taking 4 and 5 months to pay these entities?
Good morning, Carla Benjamin, Assistant Commissioner. Currently, of our 36 subsidy recipients, except for 13 of them, if invoices were submitted, they paid through till June. There are 13 providers, though, that there is some arrearage.
So in the essence of time, they are both owed for April, May, part of June, and July. For the one entity, it's totaling over some $42,000. How do we expect for these private businesses to function?
Well, luckily, one of those actually just applied for one of our larger grants, so which is a great opportunity for that. But with an efficient restructuring of our fiscal office. I can assure you that this will not be happening.
Okay, I'm begging and pleading for this for quite some time.
Agreed.
I mean, this should not be occurring. How can people carry on their business? I'll allow for you to please work on that. You've assured us that this will be addressed, please. And those two entities that I named, you know I'm constantly calling you about these two. Kindly look into those payments for me. Tell me quickly the difference between the, you have a crime victim compensation program fund and a crisis intervention fund, correct? What's the fund balance on these two?
2 minutes.
The Crisis Intervention Fund is not funded this cycle, but I believe the fund balance was mentioned in the testimony, a little over $2 million, what that we'll be able to utilize in fiscal year 23.
That's for which one?
The
crime
the
victim?
the crisis.
The crisis intervention.
And then the criminal victims is actually a reimbursable type. So the more money you spend out, then you are able to get the federal grant
So
of 70%.
are we using any of these funds for instance, someone airlifted out of here, victim of a crime, innocent bystander, airlifted out, didn't make it back alive. Now it's time to assist the family in getting them back to the territory. Can funds be used from one of these, the crime victim compensation program or the crisis intervention?
No, sir, because the crisis intervention specific to youth programs and nonprofits.
Crime victim compensation then.
Potentially, if they did an application, they might be able to be reimbursed, but it'd have to go through the vetting process in order for that to happen.
So what funding would you currently utilize for that?
To bring a body back, I'll have AC Reimer Brown.
Yes, Mikkel Reimer Brown, Assistant Commissioner. We would have to use our general fund monies only. As I shared with you, our Medicaid federal dollars are not permissible to be used to return bodies to the territory.
Good. So there is still a need for the crisis rapid response that we have discussed.
That would be very helpful for individuals who have these circumstances.
Okay. So I just wanted to mention that so colleagues, once we get the bill drafted and I share it with you, that you have an understanding that the Department of Human Services have a need for this, and that we don't say, well, why aren't they using the crime victim compensation program or the crisis intervention fund? I've submitted a bill draft to put some $200,000 in there, starting off with $100,000 for each district to be utilized for circumstances like that, and it's called a crisis rapid response.
Time.
All right. Thank you. Now,
you may wrap up, Senator.
Thank you. Page 24, you spoke about the request made to FEMA regarding Richmond Center. What's the status? Quickly on that. Status on the request. And then pages 22, 24, and 25, you spoke about Herbert Gregg Home. Thank you for the good news, some $100 million for the reconstruction of Herbert Gregg. But what's the status? What's next? Is there a timeline in place? And what's the current status of the walkway from the dining room that we're bragging about to the dorms? Our residents can't get from the dining room to the dorm. Where are we with this?
Miguel Tricoci, Deputy Commissioner Operations. Senator, I'm going to go to your first question about Richmond Senior Center.
Yes.
That request has been made, and we're waiting to get an answer. I cannot give you a status on when we'll get that answer.
How long have we been waiting now?
We have been waiting several months, but that is not outside the usual wait time for a request from FEMA.
Send them a weekly reminder, though. Weekly reminder. Go ahead, next.
We have meetings bi-weekly, and that is on that. It is on the agenda when we discuss it.
Thank you. And I have you on speed dial. I'm going to start calling you.
Yes, sir.
Thank.
What was the other question?
Herbert Gregg, the status, any timelines? We know we're getting that $100 million, but do we have a timeline? What's next? And about the awning going from the dining room to the dorms?
No timeline on what's next, sir. It is the same process. We're waiting to get an answer from FEMA. I will speak to the awning. We got awnings, but it was not sufficient to withstand heavy rain or wind. It would have blown over almost immediately. So we took those down. We didn't put them up all the way, and we're looking for structure that will suffice to keep up with our wind and rain that's here.
We've been looking for that for 5 years now. But, Mr. Chair, thank you so much. But one last thing is on the grants for, I see some grants here on page 9. These are some good sizable grants for St. Croix. I see some, 17 million for Charles H. Emmanuel, 1.9 million for Anna's Hope Administration Building, and 1.7 for Concordia. Can you tell us about that? What are these grants used for?
They're going to be specifically 100% federally funded, no local match. It'll be for the reconstruction and renovations of Head Start centers in those areas.
Oh, so all 3 are Head Start centers?
Everything on that list, sir, is Head Start.
Thank you so much.
Thank you, Senator.
Thank you, Mr. Chair, for the latitude as well.
Thank you, Senator Gittins. Senator Sabu, your point of information.
Thank you, Mr. Chair. It's actually a point of inquiry. Based on the previous senator's question with the Crisis Intervention Fund, and that is outlined in Title 33, Chapter 111 of the VI Code, you indicated that you have a rollover from the previous year. And that fund is to actually give grants to community organizations for the prevention and for juvenile related matters, and you are saying you have a rollover of some 2 million. So who are you giving grants to? Which organizations are you even giving?
We didn't, for crisis, we did not. We did miscellaneous. I have Ms. Tutine on the phone that can tell you specifically which ones were given out. But I think that we need to do an RFP specifically for that particular funding so we can make sure that those that need it the most are appropriate for that.
Why would you have to do an RFP when the code doesn't require you to do an RFP?
Some type of I wouldn't say an RFP per se, but some kind of notification that people can apply for it. So just to give it to anybody, they still have to go to get a notification of grant award.
Mr. Chair, if you could allow me, because I don't understand your response to that question, because you have the funding. Why hasn't notification gone out? You have so many community organizations. Great. You have a lot of athletic programs, sports as a means for social change. You have music programs. You have a lot of programs in the community that can benefit from the $2 million. I'm watching the code right now, and it's clear, and the attorney is next to me, so if you want to watch my screen too, right? But the code is very clear on what the intent of the fund is for. And if you're not putting out notices and giving this to communities, then what's the purpose of having an intervention fund? We do have a crisis. Our crime rate is high, and you should not be having a rollover of $2 million. Thank you, Mr. Chair.
Thank you, Senator Sabu. Senator Karian, thanks for being here. You're recognized for your 7 minutes.
Thank you. Thank you, Mr. Chair, and good afternoon to all my colleagues, and good afternoon to the team from Department of Human Services. I want to commend you, Commissioner, and your team, because clearly this is a very comprehensive presentation you did this morning. Your testimony, very detailed, a lot of information you have provided, which is great. It's good for us. The more we know, the better we can be able to assist you in the endeavor and the mission that you have. So kudos to you and your team for the work that you're doing. What would you say that it's your major challenge at the moment, Commissioner?
The diverse populations that we serve, we see everybody in crisis. And so the amount of calls on a regular basis. So right now, workforce shortage to accommodate the calls. Our telephone system, I will go ahead and outright pull it out there.
Good thing you do, because I was going to mention it to you.
It's an issue. We know it's an issue, so we're changing our phone system. We've already got an RFP. We're already working on it. But it's also once the calls are there, you have to get somebody to make sure that they answer the phone correctly. So if 1 or 2 people are meeting with clients, they're not able to answer the phone. So also having an automated system that can have a voicemail so I can call you back. So I recognize that because I called every number myself. to see if it was working, and they were not working, and people were not picking up the phone. And that reference also comes back to my office. So in the event that someone calls, they can't get through, they will call the Office of Commissioner in St. Croix especially.
Well, I'm glad that you're forthcoming and honest
Yes,
with
sir.
that challenge, because that's something I have here on my list, because I myself been calling numerous of times.
Agreed.
And it's really a challenge. And getting a call back, it's also a challenge for weeks
Agreed.
now.
Yes.
So that's something that urgently needs to be addressed, because the population that you serve have needs. You provide that service, and that's the way how they can communicate with your office. So that's a major, that needs to be in your priority list. So I'm glad you brought it up and that you're on it. What timeline should we see this corrected?
Well, definitely not in the early months of fiscal year 23. We're working towards that. We're also, for Medicaid, we have an RFP out for a call center. So those Medicaid calls will be handled a little bit more efficiently and effectively, especially since it could be potentially 36,000 people coming in and calling regarding provider relations and/or a patient. So we'll definitely have a call center for Medicaid, and then we'll work on our phone system. The call center will also be for SNAP or DFA.
Okay. So we should be seeing that maybe by the end of this year?
The RFP definitely is going out. We're working on that right now for the call center. So that will be very helpful, and it'll eliminate off the calls for the rest of the department.
Very well. Well, good thing you're on top of that. We need to get that corrected. Also, let me ask you, in regards to your role in preparation for a disaster. We're in hurricane season. Do you, within your budget, separate an amount specifically for the work that you have to do that has to do with mass care and sheltering? Can you elaborate a little bit on that, and how is your staff, what's the status on that?
It's technically, well, historically, it's been an unfunded mandate under Department of Human Services. We work together with all the other ESFs. But mass care is a tremendous amount. It impacts the community, everyone in the community. So sheltering, feeding, operations, points of distribution all fall under DHS. As far as a hard budget, we've worked with FITEMA and the governor's office regarding all the generators and making sure that we have generators at each of the shelter sites. And so that's been extensive. So luckily that didn't have to come out of our budget. The fuel and the maintenance also. The shelter volunteers and our workers also. Department of Human Services works with Red Cross in the event that they have volunteers. A lot of times during COVID, Red Cross volunteers were not necessarily amenable to work in the shelters. So if any of you would like to work in the shelters, we're opening up the invitation because we're always working it.
Well, I've worked in the shelters before. I've been a Red Cross volunteer for almost 20 years.
Great.
So
You're my first
in
call.
the area of mass care, so you could call me. Those things that I really enjoy. But then your staff, do they get compensated, those that work overtime?
Yes.
Okay, and that money comes from with the general fund, or that's reimbursed from the federal government?
Mostly, well, it depends. So in the event of a disaster is declared, you're able to get reimbursed some dollars for it.
All right. Now, with regards to your federal funds, I know you have some challenges there. What is the plan to really get a whole office that deals with grant management and be able to monitor these grants to ensure that we don't lose these funds?
I think a fully staffed fiscal office would be the most helpful. A new CFO that knows DHS like the back of her hand is also very helpful. And knowing how to restructure it so we can maximize all the federal dollars that we have and not lose funding like indicated before, and to make sure that we're up to date on all our reports. So that's the most important aspect of things.
So are we actively recruiting to establish this?
Yes, most definitely.
Very well, because that's important. We have to try to use every single dollar that we can. Regards to on page 7 of the post-audit report that speaks about miscellaneous appropriations for nonprofits. I know that now falls under the Office of Management and Budget, but you were handling it for FY22, correct? What's the status? You have here a list of different nonprofit organizations, and we know how important nonprofits are, how much they do with so little. So what is that collaboration in assisting the nonprofits? And I want to get some actuals of what has been drawn down and what has not.
Lydia McGrath, CFO. all the nonprofits for the first.
Can you
and-
speak closer into the
Sure.
mic?
All the nonprofits for the first and second quarter have been paid. The third and fourth quarter have been released. So Ms. Tutine is working with OMB so we can get those payments in for the third quarter and encumber the funds for the fourth quarter, which would be paid in probably October once the funding reports come in from the nonprofits.
But the first and second have been paid.
Yes.
For all in profits you have listed here.
Yes. I think there is two that, and Kendall can probably chime in. I think a dial-a-ride, and there's another one that are no longer existing.
Okay. Can I get some more information on that?
Kendall Tutine?
This is Kendall Good afternoon. Kendall Two-Time Director of Nonprofits and Support Services. I can speak with you offline and give you the details of any outstanding, but for the most part, the nonprofits have been paid first and second quarter. I think I have 1, 2, 3, 4, 5, about 7 programs that are still awaiting release of their payments. And as
They're waiting
Ms.
release of
McGrath
their payment
stated-
for which quarter?
Time.
First and second, the requests have gone in with the required documentation. The checks just have to be cut and sent out to the organization. But the majority of the organizations have received payments. Only $170,000 per quarter is outstanding, so it's not a lot. It isn't a lot, and I'm working very closely with the nonprofits. They're fully aware of where their payment status is.
Okay. I'm glad
But
to.
I can give you the details if you need it, sir.
If you can, through the chair, please submit that so we are aware. I think my time has been called.
Senator Carian, please repeat that request so the clerk can get it. What the
Yeah,
request?
through the chair, the list of nonprofits that are still outstanding for the first and second quarter.
Thank you so
And
much.
thank you very much, Mr. Chair.
Thank you so much, Senator Carion. Colleagues, we're going to do a quick 2 minutes wrap-up round because we have our next agency about to come in, waiting to come in. So, and please be succinct with your responses. 2 minutes. 2 minutes. We're going to get them back and do a hearing in the near future. Senator Joseph, you're recognized for your 2 minutes.
Thank you so much, Mr. Chairman. I want to ask you a question relative to post-audit report on page 9 with the bank accounts. I noted under public assistance, you've expended, you had a beginning balance of $209,251.92. You got a deposits of $1,220,946.62, and then you expended $1,230,122.20. Tell me quickly, what were those costs and what is this fund used for specifically, the public assistance?
Mikal Reimer Brown, Assistant Commissioner. Public assistance is our cash assistance programs for our low-income individuals.
Is that the TANF program?
They include TANF, Aid to the Aged, Blind, and Disabled.
Okay, so is this a federal fund or is it local fund? Because TANF doesn't require a match.
There's the Aid to the Aged, Blind, and Disabled. There's federal and local contributions we have to maintain.
And how much is the local contribution, and what do we contribute to it locally? And what's the, because is there a federal match?
Yes, there's a match, and there's something called a maintenance of effort.
Okay, so what is the local contribution?
I believe we're budgeted $550,000
And this is annually?
annually.
Okay. And the federal?
Federal ranges at 2.83 million and change. It's around that. I don't have the exact number.
Okay, and I understand from a previous question that the TANF monies are usually revolve. If there's any balance, it goes into the next year. It stays there until expended.
Time.
So if we could get the full amount, I'm sorry, Mr. Chairman, I'll be quick. If we could get the amount of money that is left in the TANF fund for public assistance, both on the federal side and on the general fund side, that would be great, through the chair. The full amount for each year, because I know it has money in there. Thank you, Mr. Chairman. I'm finished.
Thank you, Senator Joseph. Senator Francis, you're recognized for your 2 minutes.
Thank you very much, Mr. Chair. Commissioner, who's responsible for maintenance and upkeep of your facilities, landscaping, and everything else?
It goes through our Deputy Commissioner of Operations, Tricochi's team. We have some contracts, and then some are in-house.
When was the last time you visited the Diamond facility?
3 weeks ago.
Are you satisfied with what's happening at that facility?
Not necessarily, no, sir.
What are we doing to address that?
Deputy Commissioner of Operations, Miguel Tricochi. Senator, we have grass cutting pending. We have been getting the grass cut. I know what you're referring to. And we're having that done by the end of the month. There was a lag, but it will be done by the end of the month.
But at that facility, you have additional work to be done there. I mean, that's.
And that is a FEMA project that is pending. It is coming down the pipeline. It's been looked at, and it's in the final stages just before we get started on that project.
Very well. Thank you. And at the appropriate time, Commissioner, I think that you should do a full onslaught of the Herbert Grigg expansion. I think that's critical for the public to be aware of what's transpiring there. I know we have had side conversation in respect
Yeah, we
to that.
just got it, so it hasn't been obligated yet, so we'll be happy to do so.
Thank you, Senator Francis. Senator James, you're recognized for your 2 minutes.
Thank you, Mr. Chair, for the time. As far as your vendors, I see my brother's workshop, St. Croix Mission Outreach, Men's Coalition of the Virgin Islands, Collective Collaborations, and many others. And I'm not doubting any of these individuals, but as far as monitoring performance and making sure that we're getting the bang for our buck, as far as being able to assist these organizations, have you been able to do an assessment?
Director of Nonprofits, Kendall Tutine, keeps in contact, and there also submits quarterly reports, and she also visits each program.
So everything is effective?
Most of them, yes.
All right, just want to make sure. And I see for my brother's workshop on St. Croix, you have an amount of $100,000 to provide at-risk and high-risk young people in the USVI and assist with paid job training, education, and job placement. But how many youth on the island of St. Croix benefit from that $100,000 appropriation?
I'll have to double check the report. I don't have that report with me, but I can double check with.
And while we speak about getting that for St. Croix, I want to make sure we find out on the other side of the aisle, which is the St. Thomas, St. John district. And like I said, we're not doubting anyone. I know my brother's workshop is a reputable organization, but I want to make sure when we appropriate funds that we maximize on how many individuals can benefit from
30 seconds.
these dollars. And as far as your vacancies, I know I made mention or I inquired earlier about your vacancies, but tell me, what are your main challenges with filling the vacancies? Is it qualifications? Is it people not coming forward? What are your main challenges with filling your vacancies?
I think it's a couple of, because we are so diverse, and so some are the local match required. Some are credentials. So we posted a couple of 4 positions that didn't have anybody apply at all.
Time.
Some are salaries that are low. So fiscal is one. Accounting positions are very low salaries, so that can be difficulty. Also licensure and credentialing as well.
Thank you for placing that on the record. And Mr. Chair, one last thing, if you don't mind. It was brought to my attention that, and I think one of my colleagues made mention of it earlier today, with individuals filling the roles but not being compensated. But I just want to make sure that you do address that so individuals can feel appreciated, so we don't have individuals resigning, because as you can see, there's a mass exodus across government when it comes to individuals feeling either burnt out, not feeling appreciated. So please take care of them, and whatever we can do as a body, we will try our best to assist you. Thank you, Mr. Chair, for the time.
Thank you, Senator James. Senator Bolquez, you're recognized for your 2 minutes.
Thank you, Mr. Chair. Good morning. Afternoon. Good afternoon, Commissioner, again. Quick
afternoon,
question with adult foster care. I know that the program provides supervision in homes for adults with disabilities, and it helps with things like the client's Medicare and applying for different services. How many adult foster care individuals do you have in your program currently? And how do individuals who may not be aware of the program contact the department in reference to applying?
Mikkel Reimer-Brown, Assistant Commissioner. I believe you're talking about our personal care attendance program, because we don't have the adult foster care, so to speak. We were speaking about those individuals who are Medicaid clients. Once they have a plan of care that requires personal care attendance, that's activities of daily living, bathing, grooming, running errands, taking them to the doctors. Our personal care attendants, that service is 100% paid for by the Medicaid program. So any Medicaid member who needs
on your
it. Say that again, Senator.
On your website, you have adult foster care on your website currently. So if that's not accurate, I would ask your webmaster to take a look there and make sure that they make the necessary edits.
Okay.
Because I'm looking at it right in front of me. So
30 seconds.
I think it's a great program for the elderly, and as we know, we may all at some point develop disabilities through the process of aging. So definitely it's something that we all should be able to access. So I'm really interested to know how individuals would go about applying for that or contacting the department. What phone number would they call? Is there an email associated? Could you let the listening public know?
Yes, we have adult protective services.
Time.
And those are social workers who you can call them they respond, and our intake and emergency services, they respond. So adult protective services in our Newt Hansen complex and our senior citizens division in Mars Hill. So adult protective services, we get reports of suspected abuse, neglect, financial exploitation of seniors and adults with disabilities.
Okay. Thank you for your answers, and thank you for your leniency, Mr. Chair.
Thank you, Senator Bolquez. Senator Francis, I'm going to give you back your 1 minute because you thought you could only ask one question, so I'm going to give you another minute. You're recognized for your minute.
Thank you, Mr. Chair. You're so kind. Commissioner, I got a constituent's concern regarding the elevator in the St. Thomas office. It's been out for quite some time. What is the status of that?
I don't mind answering it, but Deputy Commissioner, so the only outstanding thing now is the inspection from ADT. And so everything else has been addressed. And so I believe that's scheduled either for next week or the week after, and then it should be up and going.
So the repairs have been made?
Repairs have been made. It's just a matter of inspection now.
Okay. Also, in respect to your key performance indicators, who's ultimately responsible for tracking those? That drives accountability in terms of efficiency and effectiveness. And you have some very ambitious key performance indicators here, and I'm seeing that you've fallen short in some of the instances. Who's responsible for monitoring them and making sure that there is some quality assurance here on these?
So all of the senior leadership here, we have, I think it's monthly meetings with OMB regarding the key performance indicators, and then each person is that's over that program is responsible for the key performance indicators.
Time.
Very well. And in conclusion, then what happens when you fall short? I mean, is there some timeline by which you intend to step it up?
I think some of the key performance indicators are not necessarily applicable at this point or not measurable in a way that I think is effective. So I think that realigning those for 23 will be most beneficial for us.
Very well. Thank you for the time. Thank you for your response.
Thank you, Senator Francis. Before I go to your point of inquiry, Senator Saru, because you are next anyway. But before I go to your point of inquiry, let me inquire in respect to three constituent concerns right quick. The exempt employees that have been at Human Services for many, many years, are they in line to get a raise also? Because I was told they have not gotten a raise.
They have not, and that's something that we'll be looking at for 23, 24.
23, 24?
23 going into the 23, because right now they're not budgeted, so we would have to get cost savings or vacancy savings in order to do that increase.
Well, why were not budgeted, or they have been here for some time, they are doing the work, so why shouldn't, why not, wait, slow down, one at a time, why were they not included?
For two reasons. One is that it needs to be assessed on, I agree with you 100%, because there are a lot of exempt employees and administrators and directors that their subordinates are making more than them. And so what happens is that now they don't want to go into a management position because they're already getting paid more. So we'll make some considerations for that for 23.
And the next inquiry, the CSEP program and other elders who have been working throughout the pandemic, are they, do they qualify for those funding also?
Qualify for premium pay or something
Yes.
different?
Yes.
Yeah, Mikhail Reimer Brown, yes, we submitted those CSEP workers who actually worked in person. They were on our premium list, our premium, yes.
Thank you for that. And lastly, in respect to the emergency assistance funding and the cap, because many folks would not qualify. Who sets that cap? Can you adjust the cap, or that's federally
The emergency
implemented?
allotments are set by our federal guidelines. We maximized them during COVID, meaning that if you were getting 200 and maximum elevation was 300, then we maximized all of them. Those waivers and flexibilities are going to be pretty much phasing out.
So with the ARA funds also, there's no kind of adjustment based on your department?
And they're federal related.
Okay, very well. That was my question, and that was the inquiry. Senator Saru, you recognized for your inquiry in your 2 minutes.
So the point of inquiry was germane to the previous speaker on the adult protective services. We have a problem in that area. So did you have no staff? Do you have staff? What was the answer? No, right?
We need additional staff.
Okay, so is that included in your personal request?
Yes, so what was happening is the two people were social workers were acting in district manager positions. Now one of us already moved and the other one is moving. That will free up the two social work positions and be able to fast it up. Plus, we're having another couple of grants, the social services block
Because you're
grant.
saying social workers, and we're having an issue with your social workers component as well, passing the test and having the credentials, right?
No, not right now. All of our social workers that are social workers
Okay,
have license.
St. John needs a...
Yes, they do,
And a person that lives on St. John.
preferably.
Okay, because they are having sporadic site visits, and there's an issue with our seniors on St. John.
Do you have a social worker on St. John that you would like to refer?
We can talk offline.
Okay.
Thank you for the point of inquiry.
Speak into the mic, please, Commissioner. When you speak into the mic.
Okay.
Now, quickly, last year, I chided you for giving people job letters and never hiring them.
Yes.
What's the status?
I have one person.
You have one person. So you've improved on that?
Yes.
Okay. Now, the senior component of human services. So I know that you have placed a lot of their positions, like a nutrition supervisor, the Queen Louise supervisor position, a lot of positions, even a support staff under the block grant, correct?
Yes, variations, yes.
And OMB has denied that request, correct?
Not all of them.
Their response to you was that you have to find another funding source for those positions, correct? Yes, that's the answer. So with these positions tied up on the block grant and OMB giving you the denial, you are unable to meet the demands of the community, of that community, particularly because you have all these positions tied up into the block grant, which have not been approved. You've been told to find another funding source. Have you included those positions in the budget? Or will we continue to be at that impasse?
They were not included because we thought we'd get them in the block grant. So when we submitted the budget,
So you need to send a revised budget then?
We'll do a revised social services block grant budget.
Colleagues, I hope you're listening in your senior area because these positions are not included in the budget. And our senior homes and
30
all the
seconds.
support services for our seniors will be unmet because they're tied up into the block grant and you've been denied and you have no funding for those positions technically at this point, correct?
Not for all of them, but
Okay.
for a few
And
of
those
them,
are
yes.
critical positions, right?
Yes.
Okay. So, Mr. Chikoche, quickly, tell me about the Richmond Center. What's going on there?
Richmond Senior Center,
Mm-hmm.
we are almost finished with the repairs to the bathroom.
What is left to be done? Because I know particularly they always ask for donations for the Richmond Center. So
Time.
tell me what is left to be done.
What left to be done is the outside. We still have to do the fence, landscaping, the roof, but we have worked on the interior, and it's almost going to be ready.
And Mr. Chair, just lastly, what is the cost of those repairs and what is it coming from? Federal? Is it coming from the FEMA funding? Because was it destroyed during the hurricanes? Is it disaster related or is it from capital outlays?
Senior Center revolving fund
And what is the amount?
for,
What is the amount of those repairs to the Richmond Center?
I couldn't tell you offhand, Senator, but I can send it to you before the day's done.
Through the chair, I have like a million requests to the chair. Through the chair, I'd like to find out the total cost to repair the Richmond Center and the fund that it's coming from. And then also we need to, through the chair, I'm requesting the list of positions needed to staff up the senior component of DHS that is not included in this budget, because we really need to fund those positions. Thank you, Mr. Chair, for the time.
Thank you so much, Senator Saru. And I believe it's important moving forward, Commissioner Gomez, in terms of data, it's critical, especially during budget season. You know, when you come in front of us, it's good to work with all of the data in terms of balances, what our use is, etc. that we requested, because there's a lot of requests today, but it's good to work with that information moving forward. And I'm sure, like I said, we're going to have an update hearing, and hopefully you'll have that by then, and we can I'll do a deep dive. Senator Gittins, you recognize for your 2 minutes before we wrap up.
Thank you, Mr. Chair. Commissioner, what's the number of vacancies you have again, funded vacancies?
Funded vacancies.
And of those, of that number, how many are classified versus exempt?
I only have, I believe, 1 or 2 exempt positions that are vacant. That's a DIPS administrator. And maybe one
Tell me,
other.
start with the total number of vacancies, funded vacancies you have.
Okay, so the total positions for vacant and new, it was 39 new for GVI, 83 are vacant, so there's a new and a vacant, and then 17 for federal, and then 95 for federal for vacant.
Y'all are confused me with these things. But
234, but there's some duplicated counts in that because there's a match requirement for that.
so, of those that you don't need a match for, that we do have the funds, what's the status of these hires?
Okay, so if you want to break it down to the 116 true vacancies that I currently have, I had in the fiscal year 23 personnel listing that you got with post audit, I have 57 have been approved. So you'll see a vacancy, but I've already done an approve and a person's working in that position. So there's 57 there. 25 of those positions that are listed as vacant are either interviewed and or onboarding. So we might have
30
been
seconds.
selected. 12 are currently posted on
slow down
personnel.
for the 20 seconds that's
Okay,
left.
sure.
And any of those like in-house promotions where you fill a spot, or these are new direct outside hires?
It's probably, we've done a lot of internal promotions this year. I think we've done 20.
So a number of those that you're talking about is just filling from within. But what about those from outside, new hires?
New hires were.
You need cooks. What's the status with the cooks at Harvard Gregg again?
So I had 44 new hires and 34 rehires this fiscal year. So rehires is that you were in government, left government, came back to government. 15 transfers from another government agency into DHS, and then I had 26 internal promotions.
Okay,
which
so
then
what
rolled
about
up
those that want a job that's on the outside? What are we doing?
to recruit them?
not to recruit them. I mean, you have these vacancies. What are you doing to hire them?
Recruiting as best as we can and onboarding as quickly as we can.
Okay, so what's the status of the cooks that you need for Harvard Gregg?
I'll have to double check do you know the status of the, did we get an eligible listing?
Listen, I'm going to continue to do what I do best. I'm going to ring your phone down until I can get some answers.
I'll be
all right?
happy to.
Okay, thank you. And again, thank you to the DHS staff. I really salute the work that they are doing, but we must do better. All right?
Always.
Thank you.
Always strive.
Thank you, Mr. Chair.
Thank you, Senator Gittins. Commissioner, the social work, the Masters in Social Work from the University of the Virgin Islands and individuals being able to intern at Human Services, they have not been getting good response. In reference to interns, they have been getting response that we don't have anybody that could mentor you, or we don't have availability at this time. What's going on?
It's twofold, but I'll allow AC Benjamin because she took that over.
Carla Benjamin, Assistant Commissioner. The first few semesters, we had quite a number of UVI, MSW interns. The last couple of semesters, there weren't as many qualified MSWs who were willing to take on an intern, because it's not just a matter of having them experience the work, but it also requires a number of written up reports, setting aside additional time to meet. It is a personal investment, and we are incredibly short-staffed, but we are continuing to talk about that. And we have had interns.
Hold up there. The intent of the overall program was to grow the number of social workers that work for the government of the Virgin Islands. The private entities are gobbling them up. They're taking them, they're providing all the legwork, doing the paperwork, and then they're hiring them full-time. They're reaching out to the government entities first. We expect the government entities to design a program that would be able to accept them. I can't see how individuals working in social work, they're too busy. We have a lot of them that are towards retirement age. If you need to create an incentive, you need to give them X, so we need to legislate something, but you can't be turning away students from the University of the Virgin Islands, and they have to go to private entities.
May I offer a clarification? Not every social worker is qualified to take on an intern.
Find somebody that is qualified. That's Human Services problem. That's not the Senate problem. Find somebody that is qualified to mentor those students. That is why the program was created. It's created to be able to increase the number of social workers that we have in Human Services. And they're calling Human Services to do an intern there, and they're being turned back and say, oh, we don't have time, we don't have anybody that's willing to mentor. Then let one of the deputy commissioners or assistant commissioner mentor them, because all of you guys are qualified social workers from the commissioner right now. That's one thing we have with the positions.
She actually has done that before.
I mean, it might be upsetting that you're saying, well, but programs must work. That's the intent of the Masters in Social Work, to be able to expand the number of social workers that we have in Human Services. It's time for them to be turned back because we're too busy, we don't want to do this, we don't have time. And as soon as they call the private entity, oh, we're so happy to receive you, come. And then they intern a couple months, and they say, you know what, I don't want to go to Human Services anymore. I'm going to stay where I am at because of X, Y, and Z. The Centennial Treasure Award that's been going, it's in effect?
Yes.
Yes.
So individuals are receiving the money?
Yes, we had 6 this past year.
The restrooms that we had passed for Richmond, we had passed money to fix the restroom. That's completed?
Almost, I believe. The DC Chircochi, the restrooms were completed at Richmond. Yeah.
Yes, Commissioner.
We also appropriated monies for a bus with a lift for the wheelchair. Is it here?
That's in process.
Yes, sir.
It's here?
No, it's not here.
When is the arrival date? Or tell me what's going on with that.
I can get you the ETA for that vehicle, but the process has started to get that vehicle.
So you have already purchased it and you're just waiting for it to arrive? Or you're going through the bids now?
Which Senator McElroy Brown, which appropriation is it for the Herbert Gregg?
For both.
Okay,
It
Herbert
was
Gregg.
Herbert Gregg, Richmond, and wasn't it St. Thomas too?
Yes. So Herbert Gregg, Queen Louise has their wheelchair van. Richmond has their wheelchair van. It's the Herbert Gregg. At the time when you appropriated, it was about $92,000. That's what we got. We are being given costs of about $108,000 to $110,000.
Okay. And you don't have any savings in that category, other supplies, and you don't have any savings that you could utilize towards that?
So that is a capital expenditure. So our CFO is working now on the appropriation transfer, and I believe she will be helping us with that.
We have submitted an appropriation transfer to OMB.
We've been waiting for that appropriation transfer for the last 4 months. And September 30th is the end of the fiscal year, and we still don't have it. And September 1st coming. So we need to know what you need in order to get at least that van, because it's quite unfair to have the 1% Croy for Richmond, and then we don't have 1% Thomas. If it's a $5,000 or $10,000 or $15,000 that we need to transfer, we could do that as an amendment. And just make sure that we get the van for the seniors and St. Thomas, which would make the process a lot easier. Senator Carrion, you are needed in 2 minutes.
Thank you, Mr. Chair. Commissioner, is there any master plan in mind that you guys are working on? Because looking at how much the department spends on lease, it's close to maybe 2 million a year. What's the plan in order to change that? Maybe reduce that amount, or looking into owning property and having your own building?
We actually do own property. It's just a matter of renovating and finding that funds to do so. So with the consolidation of our Head Start centers, that'll free up Herbert Gregg, and we'll be able to expand and maybe do more senior services at Herbert Gregg. So we might be able to combine some of those. And then at Kings Hill, we also have that other space of freeing up Head Start. We'll be able to renovate some of the ruins there. So I would like a consolidated space. It's a lot easier for all of us as far as landscaping, supply contracts, maintenance, everything. Diamond is also our property, so maybe building that out a little bit, but there's some historical stuff there that we have to take care of too. So it is my ultimate vision to make sure that we consolidate, try to get out of the lease agreements and be able to have our own space.
So there's a consolidation plan that you guys are working on.
We're working on it. So once Head Start moves out, then Herbert Gregg can
some space becomes available and so forth. Well, that's some good news. Now, with regards to your professional service contract,
30 seconds.
Didn't see anything here for extermination.
The supply contract through DPP, and I'm sorry if we didn't put it in there, but we do have an extermination contract.
For both districts?
I believe so, yes.
Okay. Do you know what's the cost of that? Because
I can get that as well through the chair.
very well. Also, I was a bit puzzled with regards to the vehicles. Can you give me the numbers per district?
Miguel Chicochi, Deputy Commissioner Operations,
Time.
85 vehicles in St. Thomas, 58 in St. Croix.
How many in St. Thomas, I'm sorry?
85 St. Thomas, St. John combined, 58 in St. Croix.
Okay, and how is that compared to the ratio of employees by district?
It's not by employees, but more by program and the type of services that are offered through the outreach. So those that need outreach may have more vehicles than those that don't.
Okay. Are they or do we have any programs on St. Croix that we don't have on St. Thomas, or on St. Thomas that we don't have on St. Croix?
Not necessarily programs because they're territory-wide. So like Meals on Wheels obviously is outreach. Homemakers is outreach. Some don't need as many vehicles because they're more in-person client service. People come to us. So it just depends on the service that's being offered in the program.
Okay. And just finishing, my colleague was asking about the cooks for Herbert Gregg, and I don't think he got a response as to, what's the plan with that. I think YRC also just has only one cook. How are we managing with both of these? Herbert
Well,
Gregg
for the cook
and
for
YRC.
YRC, that's on the list as far as an update to hire. And And then the cooks for Harbor Grig, anybody that has a vacant position will be posting those as well.
Well, and these are 100% funded position, or these are at 50%?
These are all general fund positions, sir.
But
For Herbert Grig and for YRC, they're general fund positions.
funded at 100%?
For if we hire in 22, they should be good to go for 23.
All right. Thank you very much, Mr. Chair.
So you have some applications that you might be able to hire in 22?
I believe for cook for
YRC actually has 2 cooks, and there are 2 vacancies. One for a cook and one for an institutional service worker.
Would you be able to fill those positions in FY22?
They're pending PRFs, they're backfills, so yes.
So we're trying, all the vacancies, or most of the vacancies are funded at 50%.
Yes.
Correct? So we're trying to see which ones we need to fund at 100% because that would definitely increase your budget if you're able to get those individuals on now. So I think we'll be doing budget markup in a couple of weeks. If you could let us know how many of those positions you were able to fill. And I missed a bit of the meeting, but I heard your response with the acting positions. You only have like 7 or 8, you said, left?
Correct.
Okay, and your plan to correct that is by when?
Well, 2, the administrators, they're out sick, so until that's solidified. The other ones are promotional exams for YRC. We're working with Division of Personnel,
Okay.
got the BOC plan for that. And then 1, I think, is in a position, and the ones that backfill or the PRF comes, they'll be able to be slotted.
And those individuals are retired. Were you able to take care of them? They were in an acting position for a number of years and they retired
I think
last
there's
year?
just a few, 1 or 2 more. The retirees we paid out already.
Okay. Quickly, the local grants, let me know whether or not they have received the money. American Cancer Society? That would be Mr. Tyne, right?
Correct.
Mr. Tyne, American Cancer Society?
1 minute, sir. Let me get my list out. American Cancer Society, first and second quarter. They've received it. Would you like me to just go down the list, or did you want to call them out and then I?
Yeah, I'm just calling. American Cancer Society, you said yes?
Yes, they received first and second quarter.
Somehow you're not coming in clear. How much did they receive? 50,000 or?
They've received first and second quarter.
First and second quarter?
Yes.
Okay. And when are they going to receive
That's
third and fourth?
25,000. Catholic Charities, for the 3 programs that are funded, they are still awaiting first and second quarter.
They're still awaiting first and second quarter?
Yes.
Why?
I am not sure. I've been in contact with Catholic Charities. They received payment in June, but they're not clear as to whether it is for last year or this year because the year was not listed on the check stub. So they did not receive any funding for last year, and they are going to apply these dollars to the funding that's owed to them for last year.
I can't remember us making that appropriation available until expended. So it has to be this year?
I put in a request to encumber funds last year.
Yeah,
So,
but,
again, we're trying to
unless
figure out what
unless
that
the
check is
legislature
for.
gives authorization to remain available until expended, that really can't be done. I'm concerned about Catholic Charities because they really do great work for the Virgin Islands. Collective collaboration.
Their funding has been, a requisition has been created for their funding and allocated. I need some updated supporting documentation to move forward with the purchase order.
Community First.
Again, I am in need of a supporting documentation in order to move forward with producing the purchase order.
So they haven't submitted their documentation yet, Community First?
Well, one of the issues that we're having is the SAMS.gov requirement for registration is holding up the 9 subgrantees that I am unable to execute notice of grant awards for. I'm in constant contact with the subgrantees. They just seem to have gotten caught up in a backlog at the federal site.
So they have not
So once
submitted
I receive those,
they have not submitted their SAM number yet?
that's it. They've submitted for registration. I've seen proof of that, but DPP does not accept a notification like that, I have to have a document that clearly states when their SAMS.gov expiration is effective.
Family Resource Center,
They've received first and second quarter.
Lutheran Social Services,
First and second quarter.
Men's Coalition of the Virgin Islands,
First and second quarter.
My Brother's Table,
Documentation issue, unable to have their program paid.
My Brother's Workshop, St. Croix,
First and second quarter.
St. Thomas,
First and second quarter.
Project Hope,
They've received first and second quarter.
Project Promise,
First and second quarter.
St. Croix Mission,
Their funds have been allocated and the purchase order is issued. Their payment is going to be processed.
St. John Community Foundation,
Again, documentation issue. I'm working with the organization to get their notice of grant award executed, but they have not received their first and second quarter yet. I did put in a request for that.
10,000 Helpers,
They receive first through third quarter.
The Village,
First and second quarter.
VA Association for Independent Living,
They have not received first and second quarter. That's one of the issues that we're trying to resolve with OMB as to why.
Viva Casa,
They received first and second quarter.
VA Resource Center for the Disabled,
First and second quarter.
Women's Coalition,
They have not received any funding yet. Again, that's one of the ones I'm following up with OMB as to why.
they had paperwork issues. They've been around a long time. Say that again?
It's the SAMS.gov. They just submitted to me the SAMS.gov. So I have gone ahead and put in the request for the release of the funds for them. So they should be getting a payment soon. And then the last grantee, Youth Arise, again, documentation issues.
Okay.
On the part of the
Well, what I
subgrantee.
would request, Commissioner, is that those entities that have not received their funds to let us know so we can make the funds available until expended. Okay, and we would do that.
Oh, thank you.
When we're doing the upcoming budget, because most of just about all these entities really do a good job in providing services to the people of the Virgin Islands. So we need to make sure that they're funded. Mr. Tricoci.
Thank you.
Thank you. Mr. Tricoci, you wanted to put something on the record? You may proceed.
Yes, sir. Miguel Tricoci, Deputy Commissioner of Operations. I'd like to put on the record an answer to Senator Sarau's question about the cost for the Richmond Senior Center project. That cost is $165,301.
Okay, I did miss the question. What is the project?
Richmond Senior Center
Yeah,
project.
no, what are they doing?
I'm sorry.
I'm just trying to find out 165,000 for.
Oh, repairs to the roof, AC, the fence, yard.
Okay.
A-
So this will
a
include the
renovation.
senior and the head start.
Yes, sir.
Okay. Colleagues, I know that you guys had 2 rounds, so you have exhausted all your questions. We are going to allow the commissioner to close out and move directly into the next group. I will ask the committee chair, Senator Noble Francis, to convene a next meeting where all the additional questions can be asked, as I think, I know that the senators have a lot more questions. And you're a big entity, so we could never run out of questions when it comes to human services.
We can take it by program, sir. Anytime you're
So
ready.
you may put a closing statement on the record.
So I want to thank this body for allowing us to present our fiscal year 2023 budget. What the work that we do impacts our community regularly. It impacts everybody's lives in here, somebody's family member. And a special thank you to all the hardworking DHS employees. We truly appreciate the fact that you come to work and you get to come to work to do the love that we do and the mission that we do. And then, sir, I will take this opportunity to say that we're actively recruiting for positions, and if you'd like to work for DHS, please let us know. So thank you, Chairman. We appreciate the time today.
Thank you, Commissioner. Thank you for your testimony, and thank the many individuals who supported your testimony today. Colleagues, the next two entities are pretty small. They should not take a long period of time, so we are going to run through them and try to get an early break today. So the Committee of Finance will stand in recess for 5 minutes. The Committee of Finance is back on the record. Madam Clerk, next item on the agenda.
Office of the Territorial Public Defender. Invited testifiers, Samuel L. Joseph, Esquire, Chief Public Defender.
Thank you, Madam Clerk. So Joseph, I allow you to put your name and title on the record along with Mr. Moorhead. So beginning with you.
Good afternoon, Chairman. Samuel L. Joseph, Chief Public Defender for the Office of the Territorial Public Defender.
Thank you. Mr. Moorhead.
Good afternoon, Ronald Moorhead, Fiscal Accountant, Territorial Public Defender.
Thank you. You may proceed with your testimony.
Thank you. Good afternoon again, Senator Kurt A. Viale, Chairman on the Committee on Finance, other honorable senators of the Committee on Finance and the 34th Legislature of the Virgin Islands, the listening and viewing audience, and others present in legislative chambers. I am Samuel L. Joseph, Chief Public Defender for the Office of the Territorial Public Defender. I'm here today with OTPD Fiscal Officer, Mr. Ronald Moorhead. We are thankful for the opportunity to present our fiscal year 2023 budget request in the amount of $5,676,220. The Office of the Territorial Public Defender was established in 1973 under Title V, Chapter 302, Section 3520 of the Virgin Islands Code for the purpose of representing appointed indigent criminal defendants that appear before the Superior Court of the Virgin Islands and now the Virgin Islands Supreme Court. We are a semi-autonomous agency governed by the Public Defender Administration Board, which consists of 5 attorneys. The President of the Virgin Islands Bar Association or his or her designee, 2 appointees of the Chief Justice of the Supreme Court, one of whom must be a resident of the St. Thomas-St. John District, and 1 a resident of the St. Croix District. Of the 2 members appointed by the Chief Justice of the Virgin Islands Supreme Court, 1 shall serve for a period of 3 years, and the other shall serve for a period of 2 years. There is 1 appointee of the Governor of the Virgin Islands and 1 appointee of the President of the Virgin Islands Legislature. The terms of the members appointed by the Governor and the President of the Legislature are the same as the terms of the persons who appointed them. A vacancy on the board is filled for the unexpired term of the vacant member. The board makes rules and regulations governing employees' rights and relations and approves the annual budget for the OTPD. The board is authorized to hire and terminate all personnel of the office upon the recommendation of the Chief Public Defender. The board members are Melanie Turnbull, Esquire, Clive Rivers, Esquire, Pamela Colon, Esquire, Amos Cardi Jr., Esquire, and Ezra Winter, Esquire. The OTPD is comprised of 2 district offices, 1 in St. Croix and the other in St. Thomas, representing the St. Thomas-St. John District. Currently, the office is staffed with 13 attorneys, including myself. The St. Croix District Office has 4 trial attorneys, 1 juvenile attorney, 1 paralegal, 1 investigator, 1 administrator, 1 IT director, 1 fiscal accountant, and three legal secretaries, 1 receptionist, and 1 custodian. The St. Thomas-St. John District Office has 5 trial attorneys, 1 juvenile attorney, 1 investigator, 1 appellate attorney, and 1 appellate legal secretary that serves both districts, 1 assistant administrator, 3 legal secretaries, 1 receptionist, 1 messenger, and 1 custodian. The Chief Public Defender serves in a territorial capacity, overseeing both district offices, and is also admitted to the Virgin Islands Bar. All employees of the office are unclassified and are members of the Government Employee Retirement System. In total, the entire territorial staff comprises of 32 employees. It is said the idea of the public defender system began with the U.S. Supreme Court decision Gideon versus Wainwright. However, the idea of the public defender system came sometime before that. Clara Shortridge Fultz has been recorded as the first person to pioneer the idea of a public defender system in the United States, somewhere around 1893. Even back then, it was apparent there was a need for a solution to defend the poor and disenfranchised that found themselves within the thralls of the criminal justice system. The idea that an individual who cannot afford an attorney in a criminal matter was required to go forward in his or her case without adequate legal representation was inhumane, morally reprehensible, and illegal. Notwithstanding, that unchallenged, unlawful, systematic approach remained in place for the next 70 years until the U.S. Supreme Court in Gideon ruled the Sixth Amendment of the United States Constitution requires states to provide attorneys to criminal defendants who are unable to afford their own. In the U.S. Virgin Islands, the OTPD is mandated by law to represent those assigned to our office at every stage of the process, before or after conviction, and in any action considered to be in the interest of justice. Our functional duties include, but are not limited to, alternative resolution, investigation, discovery, motion practice, trial preparation, trials, appeals, writs of habeas corpus, etc. Each public defender is required by law to devote his or her full time to the discharge of his or her duties and cannot directly or indirectly engage in private practice of law. Additionally, they will not directly or indirectly refer any civil or criminal litigation to any particular lawyer or lawyers. Furthermore, they are prohibited from counseling, defending, or prosecuting any legal matter or litigation when such action would conflict with their duties as a public defender. The OTPD provides expert legal representation and operates as a check and balance on the justice system. We protect the rights of our clients and, by extension, the rights of the community. I am proud to say the OTPD continues to fulfill its mission, which is to provide each client high-quality legal representation that is good as or better than that provided by the best of the private bar. The fiscal year 2023 proposed budget request is presented in the amount of $5,676,220. The submittal represents an annual budget for existing salaries and increases and operational expenses, which includes but is not limited to additional staff, software and hardware purchases, expert witnesses, transcripts, and other critical needs, which are a direct result of the increasing demand for indigent criminal defense services in the judicial system. As of July 31st, 2022, there were 466 cases pending in the St. Croix District and 385 cases pending in the St. Thomas St. John District. As of July 31st, 2022, 153 new cases have been appointed to the St. Croix District and 126 new cases in the St. Thomas St. John District. The average caseload for trial attorneys range from 50 cases to 130 cases for any given month within a one-year span. The overwhelming majority of cases assigned to the OTPD are felonies. Those cases are more detailed and involved. Thus, they require the most time and resources. The work of the OTPD involves a tremendous amount of hours in and out of the courtrooms. Nonetheless, the staff performs exceptionally when working conditions are trying. I'm truly inspired by the zeal and dedication of each employee. OTPD staff often carry home the burdens of difficult cases, particularly those involving violence, abuse of children, and those where significant jail time can be imposed. It is said, you never know how difficult a person has it until you walk a mile in their shoes. For the OTPD staff, these shoes remain tattered on the surface, with the core completely held together by a commitment to law and a dedication to the people of the territory. There is no standard or typical day in this line of work. Every day requires dedication, resilience, innovative thinking, and most importantly, the necessary resources for each case. Early mornings, evenings, and weekends are part of the job. The OTPD is the receiver of the overwhelming majority of the resulting workload that comes from the arrest and prosecution of cases. Historically, across the nation and the U.S. Virgin Islands, an extraordinary amount of resources have always been utilized for the arrest and prosecution of those charged with crimes. This is a side of the proverbial coin that many in our society focus on with little regard for constitutional rights. As Fulton said, for the conviction of the accused, every weapon is provided and used, even those poisoned by wrong and injustice. but what machinery is provided for the defense? The answer is the OTPD. Across the territory, day in and day out, it is a public defender standing between the client and the powerful and very well funded and a very well resourced arm of the government. The courtroom is our battlefield where we lay it all on the line every day. It is a public defender that protects the rights of our clients. It's a public defender that protects the rights of the community. It is a public defender that ensures fairness and equality is applied to all as required by the Constitution. At the OTPD, we have declared this past year to be one of proficiency and efficiency. As a highlight, since the resumption of jury trials, the OTPD has represented the majority of individuals in those cases. At this time, I would like to recognize the staff at the OTPD for all their hard work and dedication. I would also like to recognize the judiciary for its work in the resumption of jury trials. Another accomplishment the OTPD is proud of is the implementation of our own accounting system, along with the necessary procurement policies that reflect those of the territory. We have also completed our website redesign and have begun the implementation of our new file management system. We have also participated in, or scheduled various trainings to ensure the staff is always performing optimally. While we have had a few minor setbacks, notwithstanding, we continue to hone our skills to become better advocates of the people. In closing, the view of what justice should look like may vary from person to person, but for the OTPD, the view never changes. It is a crystal clear picture of the past, present, and future. We represent people who are often at the lowest moments of their lives, the least educated, the most disadvantaged, and the most afflicted with mental illness, the most scared, abused, and youthful. At the OTPD, the work we do impacts every aspect of our society. We're integral and mandated check and balance. We work to ensure justice is fairly applied to all, regardless of financial background. The fiscal year 2023 proposed budget request is presented in an amount of $5,676,220. I would like to thank you for your time afforded to the OTPD to present our budget. We remain available to respond to your questions.
Thank you so much for your testimony. We're going to go to a short 4-minute round, colleagues, beginning with Senator Blyden.
Thank you so much, Mr. Chair. Good afternoon, Attorney Joseph and Mr. Moorhead, and thank you so much for that testimony. I want to thank you and your team for what you continue to do on behalf of our people here in the territory. Mr. Moorhead, let me go to you in respect to the postal report. I just need to clarify these numbers because do you have a copy of the postal report on page 3 of 8 on the unclassified employees' salaries? It's show how much, first of all, before I go there, how much classified employees do you have and unclassified?
No, all employees are unclassified. So.
Okay, now that we got that clear, let me ask you then. Because it's showing as of April 30th, the expenditures thus far for this fiscal year is $881,984. And also it's showing a request for 23 for 3.1 million. But if you look at the numbers, you're averaging 125,992 per month, and that's 1.5 annually for employee salaries. So why it's half? So why is that accurate?
Well, that number is from April. As of June, end of June, we're already at $2 million, and still have the rest of the fiscal year to go through. And then the 2023 budget is assuming our positions will be filled.
You expect all positions to be filled by the end of the fiscal year?
By October, because we only have 6 vacant.
I know you do have 6 vacant, which I was going to next, because so you're basically stating you're going to utilize those funds.
According to the chief, he told me we should get our position filled by November 1.
3 of those positions should be filled shortly.
Which 3? You have the Deputy Chief Territorial Public Defender, that's vacant. You have the Assistant Public Defender, another Assistant Public Defender. So which 3 should be filled by the end of the fiscal year?
By the end of this fiscal year, we should be able to fill, I don't see why we wouldn't be able to, the Deputy Chief and 2 Assistant Territorial Public Defenders.
Where are you at in the process? Since you think you don't think you should not be able to, where are you at in the process? Have you interviewed already? Where are you at?
Yes, we've interviewed already. We have selected the majority. We just have to go through a few more rounds of interview, and we should be completed by then.
Okay, that's good to know. Also, under your professional service contract, what plan do you have for 23? Because I see you're requesting 200,000. You have expended so far this year, based on the postal report, 28,000. For the whole of 2021, you expended 7,000.
One minute.
What accounts for the 200,000 amount?
That is anticipation for expert witnesses and transcripts for trials, because we expect trials to be ramping up in both districts.
Okay, very well. So you're making sure you're well equipped, basically, to defend the individuals that you represent.
Correct.
Okay, very well. Let's go to office supplies. Again, it's showing that only 2,000 spent, 2,500 spent out of April, but you're asking for 30,000 for fiscal year 23. Talk to me about that.
We anticipate spending some money for furniture for both St. Croix and St. Thomas, and that would be under the small tools category. So we would roll the money down as needed.
Okay. But that will take care of that, and I appreciate that. And finally,
time.
Because I know my time has been called. When it comes to your vehicles, you have an adequate amount of vehicles to carry out your duties?
Thus far, we do.
Okay,
I don't
very
believe
well.
we'll need any more.
Very well. Thank you so much for your response, and thank you again for all that you do on behalf of our people. Thank you, Mr. Chair, for the time.
Thank you so much, Senator Blyden. Senator Joseph, you're recognized.
Thank you so much, Mr. Chairman. A pleasant good afternoon to everyone. I want to begin by, of course, commending the Office of the Public Defender for the job that they're doing. I really, really must appreciate that you don't have any classified employees. Everybody's unclassified. It speaks to the level of commitment that you, Attorney Joseph, as well as your team members as well as your team members have to carry out your duties and responsibilities, as well as the mission of the Office of the Public Defender. I want to dive into a bit of your other services and charges as delineated on page 4 of the post-audit report. Kindly follow me to the line item that speaks to all other. I noted that in fiscal year 2021, the expenditures there was $28,372, and the year-to-date expenditures for fiscal year 2021, I guess I don't know if that would have been 2022 actually, is at $13,998.55. But you don't have anything appropriated for that portion for this fiscal year. Why is that?
Ronald Moorhead. We don't budget in that category because we can roll money from any other of the subcategories.
Okay, so you just haven't budgeted.
Right.
What cost normally is absorbed in that category specifically then?
Currently, it's bar dues, some employee bank charges, VI bar, stuff like that.
Okay, now let's go up further to insurance. what is used to absorb, what insurance are you paying for? Because I noted that you have some rental properties. You rent most of your properties that you work from?
We only rent in the St. Thomas district, and the insurance majority is for car insurance.
For car insurance,
Correct.
okay. And that's different compared to some other agency that you take out your own liability insurance. I commend you in doing that, because I know of a specific agency that they have issues. It's usually a challenge to pay individuals who may be injured. Okay, and then I also wanted to ask you a question relative to the differential in salaries for your public defender.
1 minute.
I note that an assistant public defender in the St. Thomas district is paid $92,500, but another assistant public defender is paid $125,000. What accounts for that differential?
We look at, excuse me, years barred and experience.
Okay, so what is the entry level of a public defender who payment on their salary who is entering into becoming a public defender?
Currently, at this time, it's at around $89,000, but we intend to increase that in light of some of the recent negotiations across the other government agencies, and to stay competitive with that of the Attorney General's office.
So you're going to increase that amount. So we will see also, has your budget increased for fiscal year 2023?
Time.
Our request has increased by, I believe, about $170,000+.
So you have sufficient funding, you believe, to cover that increase in getting and ensuring that you retain qualified and competent attorneys?
Correct.
Okay, my time has been called. I want to thank the chairman for the time, and as also thank you, members of the Territorial Public Defender's Office, for the job that you continue to do so well. Thank you so much, Mr. Chairman.
Thank you, Senator Joseph. Senator Bolquez, you recognize?
Thank you, Mr. Chair. Good afternoon and greetings to Chief Public Defender Joseph. Thank you for being here today, and an administrative team. Your entity, in my opinion, bridges the justice gap and describes the shortfall between legal needs and the available.
Frozen.
Please, Senator Bolquez, recognize Senator Bolquez's mic.
Connected. I'm not sure if I'm.
I think we froze
Can
for
you
a
hear
minute.
me over there?
Okay, now we're hearing you. We'll
Okay.
start over your time. Start again, Senator
Okay,
Bolquez.
thank you, Mr. Chair. Thank you, Mr. Chair. Greetings, Public Defender Joseph. Thank you for being here with us today. Your entity, in my opinion, bridges the justice gap, in which I describe as the shortfall between legal needs and the availability of legal services for low-income citizens, and provides necessary balance within the justice system. I'm going to ask you a series of questions concerning the post-auditor's report. I know some of them have already been touched on. I'm not sure, we froze over here a few times, but concerning the professional services under other services and charges, I see that that is going up to about 200,000, and I was curious to know what that would be associated with.
Ronald Moorhead. That's mostly we're getting ready for experts, for trials, and transcripts as the attorneys would need as trials ramp up.
We're having some difficulties. You're frozen again.
Okay. I was interested on page 4 of 8 in the public defender's, the post auditor's report concerning other services and charges, specifically professional services. The amount has jumped up substantially to 200,000, and I was interested to know what constitutes that change.
As Mr. Moorhead, I'm sorry, Samuel Joseph, Chief Public Defender. As Mr. Moorhead was noting, that is primarily based on the resumption of jury trials and the ramping up of the jury trials. As you're well aware, over the past 2 years, because of the pandemic, there were no jury trials. There were other court matters being handled, but no, those cases have actually resumed.
Okay, I may have missed that with the spotty connection today. But concerning the absence of local and federal grants, will these shortfalls affect the operations in 2023?
I don't believe so. We constantly have been looking at different grants. A lot of times they don't apply to the public defender's office. They're more so on the side that is concerned with the prosecution of these cases.
Okay, last year you reported 773 pending cases as of July 31st, 2021, and this year you have 851. What are your thoughts concerning the rising of 8% in cases, and will that also impact your budget?
It does to some extent, but we've already accounted for it in terms of the total amount of our requests. Part of what we have looked at is the number of cases that we have, and not only just the number of cases that we have, but the cases that are considered felonies. And in that, what we did is look at also the number of attorneys that are needed to fill each courtroom. It is our goal to have one attorney per courtroom, and that would allow us to handle all these cases.
Okay, in 2021, 773 cases again. 22 involved murder.
1 minute.
In the 851 this year, how many involved murder?
24.
How many?
24.
24.
Correct.
Okay. Were those associated with gun violence?
A good portion of those cases were associated with gun violence. That's correct.
Okay. What is usually the turnaround response concerning someone who comes to the public defender's office to get services? How quickly is the turnaround for that individual once applied?
Could you clarify your question, please, Senator?
I'm talking about the turnaround on receiving responses or getting a case manager to work your case for an individual who goes to the public defender's office. I am aware of a few situations when people have mentioned that they have tried to contact the office and they were having some issues with communication.
Time.
Well, generally speaking, when a case is assigned to our office, it's immediate. The person that is assigned to our office comes in by virtue of their arrest. When they appear before the court and they are deemed indigent, the court assigns them to our office. From that period on, the next time they would appear before the court is what's considered for the arraignment, where they are assigned to a particular attorney. So our contact with them remains constant. The only times that I can think of where the communication may not have been as it normally should have been is during the earlier part and the latter part of or throughout the pandemic. But nonetheless, we still remain open, and our staff work from home. It was just a matter of the communication was a little bit slower at that point in time.
And you are correct about the timeline concerning the communication. That was in fact around that timeline. And Mr. Chair, if I may ask just one more question, please.
Yes, you may proceed.
Thank you, Mr. Chair. I'm trying to find out if the ODP offers any internship or community service to individuals who may want to seek a profession in the legal service, and of course, students.
Always, our position is These are our people, and we would like to groom people for the future who would take up these positions. So our doors are always open to persons who want to seek legal internships. It's just a matter of them making contact.
Very well. Thank you for your responses and thank you for the time, Mr. Chair.
Thank you so much, Senator Bulquez. Senator James, you recognize?
Good afternoon to the people of the U.S. Virgin Islands. Thank you, testifiers, for being here. Before I get into my line of questions, I would like to say congratulations to the BOC St. Croix graduation program that is being held on the island of St. Croix as we speak from 1 o'clock p.m. to 3 o'clock p.m. at the John A. Bell Adult Correctional Facility. And I'm happy to know that individuals in there are taking advantage of the programs available. As we speak about the programs available, I remember during COVID-19, I think your office came down here to provide testimony and an update, and at the time there were a backlog of cases. How are we doing with that ever since that conversation?
It's doing better. As you know, that was a difficult time for everyone. The world changed, a lot of things shifted, and it forced everyone into change and shift as well. And since that time, as I noted earlier, the court has actually resumed jury trials. Well, we've had the majority of jury trials in the territory, criminal jury trials. So as much as the cases can be worked in terms of on the public defender side and the judiciary, it is occurring. So there has been a pickup. And we expect it to ramp up a lot more based on the scheduling that we have been seeing coming out.
Was there any decrease or increase in the staffing ever since those conversations?
We've had a fluctuation, so where we had some staff, very few, or some staff leave, and then we've onboarded some people. But based on the numbers that we're seeing and the scheduling orders that are coming out, and the caseloads in terms of the time frame, we anticipate that we will need to increase our staff, and have outlined those positions that we'll be increasing, and that's primarily in the area of assistant public defenders.
And when you do the math as far as the fluctuation from what you have lost and what you have gained or have you actually lost?
We've lost. We're somewhat equal at this present moment, but based on the caseloads and what we believe will be coming up, we will be at a loss, but we intend to fill those positions shortly.
Thank you for placing that on the record. And the psychiatrist services, I see here, you have paid to date $0, but the terms of contract is $3,000 plus expenses. So you haven't been able to utilize the services of that individual? That's on the post-audit report, page 5 of 8. I remember the last time you came down here, I inquired about the psychiatrist services.
I know definitely we have been utilizing psychiatrist services, especially recently to even to a few months back. Dr. Marshall, I believe, is who we are utilizing for our cases.
Okay, just want to make sure I'm going based off of the post-audit report. So if you are doing that, I'm happy to know. And is it being successful as far as the relationship with that individual, I'm assuming?
Yes.
Okay. And as far as, okay, your vehicle's looking all right. You have a very straightforward budget. As far as, what's this? Abacus data processing. Contract ended May 2022, paid to date $11,200. You plan to discontinue that service, or you plan to renew that contract?
So what the Abacus is that is a file management software, and it's the contract ended, but we picked up. If you look down at the bottom, you see Zola Suite. That is the new file management software.
Okay, so you upgraded, you transitioned. Okay, awesome. Thank you for placing that on the record. And as far as bulk storage, you don't have to put everything on the record as far as what you're storing, but as far as paperwork, are you still in the business of filing documents? Have you updated to an electronic system? You can put that in the cloud?
Time.
Yes, so what we're doing is eliminating the older paper that we have so that we'll be completely electronic at some point in the near future. But there is a paper aspect that's still required as far as keeping files on record.
Thank you for placing that on the record. I'm not going to abuse my time. I'm just asking you to please work on increasing the staffing so we can share the work equally with those individuals who are dealing with those cases so we can see some smooth transition as we defend the people of the U.S. Virgin Islands. Thank you, Mr. Chair, for the time, and God bless.
Thank you, Senator James. Senator DeGraff, you recognize.
Thank you, Mr. Chair. Good afternoon, colleagues. Good afternoon, testifiers, all viewing, listening, and present. Attorney Joseph, Chief, what actually is your personnel and fringe? Could you go over those numbers for me again, please? If you did, because it was a little back and forth here. Attorney Joseph, you're able to hear me?
Yes, 1 second, if I may have a moment, Senator.
Oh, you're checking. I apologize. Sorry about that. We have a little delay here, so I just making sure.
Good afternoon, Ronald Moorhead again. So
yes, sir.
So the request for 2023, it's 3.1 million.
Yes.
3.2 million dollars for salaries, and then the fringe is 1.2 million.
Okay. I was trying to figure out with the post auditor's report on page 6. You have a copy of the post auditor's report?
That's correct.
Okay, on page 6, the general fund 2023 budget request $5,506,220, and then have 00, and then the total recommended operating budget $5,230,000. Type O, or which is it?
I believe that's a typo.
General fund and the total operation the same? Excuse me, say again.
The recommendation seems to be a typo of the last year's budget, and the correct amount is the 5.5 million.
Okay, 5.5 to 20. Okay, good. I'm just making sure. Now, has anyone received wage increases of all the employees, to include attorneys, everyone?
No, but we factor that into our budget requests, and that's where we came up with the number of $5,676,220.
Okay, so your number again is different. So you are saying 5,000,000, but the gentleman just said that 5.5 was the accurate number. I just try and get all the numbers straight, so when you need your wage increases, you have your money.
Okay, so initially, when the information was submitted to the legislature, it was 5.5 million, and there was some fluctuation on the board. And then when we did analyze the amount of cases, and we looked back at where we would be heading and what would be the needs of the office, after a meeting with the board and getting approval, that amount increased. So that would be the $5,676,220. So the numbers before you, Senator, were April 30th numbers.
1 minute.
Okay. No, you guys, what your weighting goes. So I don't have a problem with it. I just wanted to make sure I have the correct numbers. Okay, 5,676,220 is your total asking.
Correct.
Okay, and that's to include the wage increases for all the personnel, not just the attorneys.
Correct, all personnel and fringe.
Okay, good, and fringe.
Yes.
Because I'm happy to see the attorney salaries creep up from, over the years of budget. So and I feel good to know that this body was able to make that happen. So I'm happy to see that. Now, in regards to the facilities that you're renting for your employees, do they need work, or is it done by the landlord, or do you have to get funding for capital outlays?
So the facilities in the St. Croix district, we Happy to say
Time.
we own that building, and that building is 25 plus years old. So there's always a level of constant work that has to be done. With respect to the St. Thomas St. John District building, there is some things that we would be required to take care of, as it's a commercial space. We'd be renting. We're renting, but other things are taken care of by the landlord.
Okay, so the funding for the building on St. Croix, you have some funding in there to work on those and the facility to make it conducive for the employees.
Yes, Senator.
Okay, good. Thank you. Thank you for all that you and your team does for the people of the territory. Thank you for the time, Mr. Chair.
Thank you, Senator DeGraff. Senator Sarro, you ready? Senator Sarro?
Thank you, Mr. Chair. I'm going to take an unpopular stance today. Per usual, Director Joseph, where are your deputies?
I have one deputy at the current moment.
And where's Mr. Ware?
I'm sorry?
Where's Attorney Ware?
Attorney Ware?
That's your deputy, right?
No, we don't have
Not Ware. I name in Hannibal Ware is one person. O'Brien.
That's around.
That's an uncommon name on Hannibal's, right? I know a Hannibal Ware too.
Okay.
Michael Ware. Where's Mr. O'Brien?
Attorney O'Brien is, I believe, is currently at the office, handling some office duties.
Now, you understand why morale would be a little low for a few things. One, your deputy is he's here more often than you are.
Here
in
where?
the territory, right?
In the territory?
Mm-hmm.
I would disagree with that.
Okay, go ahead.
You said in the territory?
Mm-hmm.
Yeah, I disagree with that.
Because morale is important, because
Correct.
when you have unhappy employees, you have a high turnover rate, and no, it leads to a high turnover rate.
Correct.
Which could impact the operations and the budget of the public defender. And we are inundated with calls from the public defender's office about your absence in the territory as it pertains to the office of the public defender.
That's incorrect. I live in the St. Thomas district, and I travel between St. Thomas and St. John. In fact, what I've done is make it my business every year, from the latter part of the year into the beginning part of the year, to spend more time in the St. Croix district, because I live in the St. Thomas district, there are times where I wouldn't be in the St. Croix district for longer periods of time.
Okay. As long as it's on the record, because we've been, I don't know about anybody else, but I've been inundated with calls about your prolonged absence. So it's on the record. Now let's go to your legal secretary. When I compare the post-audit reports last year, your legal secretaries were at 40-something thousand in both districts. I know this year you have more legal secretaries in the last, you following me? You've hired legal secretaries, right? Based on my comparison to last year.
We have this, last year we lost, I want to say, 1 or 2 legal secretaries in both districts, and we replaced them.
Okay, so you replaced them at a higher salary than the existing legal secretaries.
No, what we did is we looked at, if I said yes, it would appear, that statement.
I'm looking at the
somewhat
numbers.
in a vacuum. Correct.
Okay.
Some of the persons that were replaced came with a certain level of experience and college degrees degrees as well. So some were replaced at higher salaries than the ones that previously went out.
Now, in the
1 minute.
In the world of human resources, a lot of jobs equate years of experience to a college degree. Because if you're in the same job with all the training and everything else, when you look at a lot of websites and jobs and job fairs, they count years of experience as well. So I'm asking you, with employee morale again, if you have legal secretaries that were there and making 40-something thousand, and you hire new legal secretaries, close to roughly a $10,000 difference between the existing ones and the ones that you hire, and I'm sure that the ones that are there had to have given the new hire some level of training. Do you understand how that impacts employee morale?
To some extent, but we also have to consider what is competitive in terms of bringing people in, whereas those individuals who have previously been there would be continuously burdened with additional work because they will be the only persons
So when
there.
they were burdened with additional work, do you intend to increase the salary of the existing legal secretaries?
That is included in our budget request.
So what are you going to raise their salaries to?
I'm sorry?
What are you going to raise
Time.
their salaries to?
We're looking at up to a 6% increase.
Okay, and Mr. Chair, one more question, please. And you don't have anybody specifically here in the bilingual areas. And I know some of your legal secretaries now go to court and translate on the public defender's behalf, correct?
Not necessarily. So it's not listed as bilingual, but in both districts we have bilingual individuals. In the St. Croix district, we
Okay,
have
so hold on. So those bilingual individuals are still legal secretaries, correct?
in the St. Croix district and the St. Thomas district, yes.
Okay, so, and those are the existing legal secretaries that have been there before. They're still at the bottom of the totem pole with their salary, and they're doing additional work by translating because they're bilingual. So are we compensating them for the additional work that they're doing?
There will be increases, as I noted.
I have a bilingual colleague, so I mean, I take up the mantle, but we have to pay them for the additional work that they're doing. That's not in their job description, and we have to really even know what's happening, Mr. Chair, with our legal secretaries. I don't think that this is right. Thank you.
Thank you, Senator Sarro. What are the qualifications for the job? What are the qualifications for the legal secretary?
The qualifications for the legal secretary are persons who have worked within the field, starting with a high school diploma. If you don't have necessarily the experience, the working in the field or the experience, we look at what your degrees are and your potential for learnability.
So you could get the job without a degree?
Without a college degree, correct.
Okay. Senator Francis, you recognize.
Well, thank you very much, Mr. Chair, and good afternoon to everyone.
Good afternoon.
Chief Public Defender, is it traditional to have two deputy chief public defenders?
Yes. What has happened, which is sort of bittersweet, is within this past year, we've lost 3 employees who are ascended to the bench, and 2 of those are from the St. Thomas district, 1 being a deputy chief, former deputy chief.
Very well. So you said that the process of selecting, you make recommendation to the board, or?
I make a recommendation to the board, and then the board makes a final determination.
And you have already made a recommendation to them?
Not at this point. We are scheduled to have a meeting before the end of the fiscal year.
How is attorneys separated? I move legislation to secure those attorney generals in the attorney general's office because they were able to arbitrarily, because they serve as exempt position, operated at the pledge of the governor. I move legislation to make sure that they will be removed for cause, disciplinary cause versus just willy-nilly and arbitrary. How is attorneys separated in your public defender's office?
If I follow your question correctly, Senator, if you're talking about, for example, removal, I lack the ability to remove any staff. I can only make a recommendation to the board based on the facts and circumstances, and from there the board makes a
They
determination.
make the final determination
Yes.
on that. Very well. What does technology look like for the public defender's office?
I think we are far ahead of most government agencies. Prior to even the pandemic, we had made a number of moves to be on the cutting edge of technology. So when the pandemic came around, we were a little bit ahead of everyone else, at least in my opinion. We've hired an IT director who is constantly looking at ways to upgrade and make ourselves better able to service our clients and communicate with the court. As you are aware, a lot of hearings are now done online, or done virtually rather. And what we have done as a result is, like I noted, hired an IT director, but we have a network specialist that we need to hire for the St. Thomas St. John district because the workload is becoming too much for that one individual.
So in respect to cyber attacks and firewalls and everything, you do have those things in place?
Yeah, well, yes, we have those things in place, and we're always constantly advancing them. Unlike some of the agencies locally and nationally, we haven't had the issues of the cyber attacks impact our office because we set out an IT plan, and that has helped us to keep ahead of that.
What about
1 minute.
case management system? Do you have a case management system in place?
Yes, we do, and we are, as noted earlier, we have moved from what we had before, which is Amicus Attorney, and we're now transitioning over to Zola.
Very well. And trials, how many trials have you had this fiscal year?
This fiscal year, I can't recall how many misdemeanor bench trials we had, but we've had at least 4 jury trials.
Okay. And you have the results of those trials? How did it go?
There were guilty and not guilty in terms of within the same case. The last trial that we had, that person was found guilty.
What are some of the challenges that you face at this time? Is there anything that this budget present a challenge about?
Well, our request would allow us to continue our operations and also put attorneys in each courtroom. So essentially, in both districts, you have 7 courtrooms, and for years we've operated where the attorneys are not necessarily in the magistrate courtroom and they bounce around. I would like to have an attorney in each courtroom, and even those with less work in the magistrate division would be able to fill in other courtrooms and second chair. I think that will put us in a good position.
Okay, Mr. Chair, if I may I just wrap up one final? In respect to appearances of visitation, I know that in the past we have visited the Bureau of Corrections, especially in the St. Thomas district, and there were allegations or complaints by the inmates that they had not been able to speak to their public defender in quite some time. Have we been able to resolve that issue?
Well, that issue primarily is on the BOC, and part of the problem, especially within the last 2 years, has been because of the lack of space or rooms at the BOC, because BOC hasn't been allowing people to traverse back and forth because of the pandemic. So essentially, there's one room where they can communicate virtually with our office, and we set up regular appointments with BOC inmates. So we meet with them, regularly as much as possible. But what you have to take into consideration is that one room also serves as a room when the court is having virtual hearings. So if it's not a virtual meeting where we could have that secure connection, the conversation, we don't go into much detail just on a regular telephonic conversation because those calls are recorded.
What is the recommended fix for that situation?
If BOC could get additional space, but it's a fixed place, from a physical standpoint. But if they could provide additional spaces, that would also help us communicate with our clients as well as the court continue to move forward its hearings.
Okay. And in St. Croix?
Same thing.
Same thing applies. All right. Thank you. Thank you for your response. Thank you very much, Mr. Chair, for the time.
Thank you, Senator Francis. I was listening to you said 4 trials for the year?
4 jury trials.
And how much that were not jury trial, that were plea bargain or?
Well, I don't have the number of bench trials, but plea bargains are a normal part, and plea bargains are a normal part and routine of the trial process.
Okay, let me change the question. What I'm trying to see is how many cases were resolved this year?
I don't have that number right now. I can get a number to you, but a lot of cases have been resolved. Please take into consideration the resolution of the cases are not just only on our side, but we also have to, get plea offers that are offered by the AGs, and it's up to the client as to whether or not they would accept. So we've tried to move cases as much as possible, but still we have to adhere to the will of our clients.
Do you have a lot of your clients presently in BOC and as a detainee?
No, we have a number of clients in BOC. Anytime a client comes before the court initially, and if they are unable to be released on bond because of the lack of resources, we immediately file motions for the release and continue to renew those motions even throughout the pendency of the trial.
Okay. Because one of the issues we're seeing is that cases are just not being resolved. You know, individuals are getting arrested, and then a year and a half later, they get arrested for something else, and they say they were out. They were released on unbanned for this particular offense, and now they're arrested again, and they release them again, and sometimes they're arrested a third time. Or sometimes you're seeing individuals that are committing murder or being murdered that were out on bail for extended period of times. And I'm like, why can't we get it together in the Virgin Islands that we have all of these cases that are just unresolved and just releasing individuals back to the street and then something else happened and something else happened? What's your viewpoint on that?
Well, so we should try to not look at it, in terms of in a vacuum. There are so many different factors that impact the case actually moving forward. So you have the police department on one side, and which the AG's office is dependent on them collecting information and the discovery, whatever happened in the case. If a case has some specialized issues, whether it be forensics and DNA, things of that nature, that information now has to be sent off, tested, ballistic tests, so on and so forth. And that's just coming from the police. And the AG's office has to look at the cases and see whether or not they need to move forward. They have to look at witnesses, other legal issues that may be involved in a case, motions that may be filed, and then we have to respond in kind and in turn. And then it still has to comport with whatever the court's schedule is. So there's so many different moving parts and factors that occur within a case. So sometimes it may seem as if the cases aren't moving at a speedily manner, but they are. I know the judges try to move the cases as much as possible.
I beg to differ. I honestly beg to differ. I think that our legal system support crime in the Virgin Islands. It's a bad statement to make, but people are just being released. There's no case. It doesn't. It's never resolved. I just read the newspaper this week, and I was reading, I don't know which case, but the person was arrested twice before. And it just continues. It's just like it's a spiral. And I'm not blaming the public defender, but all of the entities. I heard, I'm hearing that the police department have a whole set of warrants in the AG office waiting for them to be signed.
Well, as I said, Senator, we're the receivers.
That's not true, but I'm just pointing this plea out there that we just can't continue to address crime in the manner that we're addressing it in the Virgin Islands. It just can't happen. And then they're on house arrest, and they're all over the place. And then you hear, they committed this crime at this particular juncture, but they were on house arrest, and we have to see if there was a violation. Of course there was a violation. I mean, you got to see. They weren't at home. They were someplace else, and they committed the next crime. And, we got to make the Virgin Islands a safe place. So we got to get these cases resolved. You empower individuals when they get away with doing something. They're literally empowered, and they are charged to do it again because they know they go before the court and they're going to be released, and the case won't be called for 3-4 years. I mean, I don't know the last time I've seen an attorney general show up to a crime scene and support public safety and support the police department. So, those are the areas that leaves me very, very concerned. Senator Carrion, you're recognized.
Thank you. Good afternoon, gentlemen, and thank you for being here and presenting your testimony this afternoon. I want to commend you for the accomplishments that you've been able to obtain within the office, especially implementation of your own accounting system. I think that's great, along with procurement policies that you guys have established. I do have a few questions. I realize that from the post-audit report, there are no federal funds that are in the pipeline for your office. Is that correct?
Correct. At this moment.
Has that been the case historically?
Just to a large extent. A lot of the federal funds unfortunately go towards what is considered crime prevention, right? So you get federal funds for AG's office, police department, but not so much for the indigent.
Or to your recollection of Mr. Moorhead, what was the most recent federal fund you guys had and the source from?
The only one I remember was from LEPC. It was a juvenile attorney grant.
Okay. Yeah, that was what I was going to ask you if with LEPC they have a variety of different funds that are available. If there are any that your office can tap into that maybe can assist in the operations or even be able to part of it assist in one of the programs. Mr. Moorhead, do you remember what year was that?
That was Attorney Amelia Joseph King. Oh, probably
Approximately
2012 to 2015.
2012, 2015. So maybe since then you haven't received any federal funding.
No.
Okay. Well, I would encourage the office to try to seek if there's anything available that you can use. In capital outlay, on page 3, I think, is of the post audit report. Let me verify. You have projected for FY 2023 $160,000. What exactly are your intentions with that?
The majority is going to be, we need to get some new laptop computers. And also the St. Croix office, we're looking at some major improvements in the, because we need some kind of barricade and parking lot repairs.
Okay. And nothing was used in FY 22 in this current fiscal year?
We use about 3,500 for the first phase of the security barrier, and we're doing some procurement for some other items.
Well, 3,500, okay. Yeah. And that would fall under which category? Because I didn't see it under expenditures for capital outlay.
Well,
it's zero.
The post-audit report is from April, and we purchased it like last month. So.
Got you. Okay. Following right along at the supply section on page 4 of the post-audit report, you are projecting $80,000 in office supplies, but you also have operating supplies projected at $30,000. Your current expenditures actuals, I guess, as of April, and that section is just $5,549.
1 minute.
And in operating is $2,474. So can you share justification then for those two amounts? And are they the same operating supplies as office supplies?
Well, the operating supplies usually cover our fuel. We haven't made a purchase yet. We usually purchase at the end of the fiscal year, gas coupons. And also, we're going to need to purchase some office furniture. And we will roll that money down from office supplies as needed. So that'll be under the small tools category.
How much was given to you for FY 22 for office supply?
Yeah, 1 second.
Sure. As you look through that. Also, in utility services, there's a large increase here because your expenditures for FY 21 was $34,000. Up to date, I guess this is as of April 30th is $15,000, but you're projecting $120,000 for FY 23.
Time.
With the power, with the electricity, currently we're only paying directly one district. St. Thomas, we pay that directly. And then the St. Croix district is paid from the OMB one fund, and we have to try and get the information direct, and they'll pull the money as they're needed from our account.
Why this large amount of 120,000?
Say that again?
Why this amount that you're projecting 120,000?
I believe that will cover the St. Croix and the St. Thomas power.
But you paid in FY 21 $34,000.
Well, that's what we pay directly for St. Thomas, and then we budget. The OMB would send us what we owe them for, I guess, for the one fund. So I think that's the maximum.
Gotcha. Well, my time has been called. I did want it before closing to talk about quickly.
You can go ahead, Senator. Go ahead.
Your legal secretaries, and I heard my colleague from St. Thomas speak about some of their duties. So are part of their duties and responsibility also to provide translation interpretation?
Yes, and we have on both islands legal secretaries who are bilingual.
Speak, I can't.
Yes, on both islands we have legal secretaries who are bilingual.
Well, bilingual. Are they receiving any additional compensation for the additional services as interpreters?
They will be receiving as part of the raises that we plan to institute this fiscal year.
It's part of the raises.
That we plan to institute this fiscal year.
Okay. So in those raises, you have something separate apart because of they're doing interpretation and translation, and they're just getting a raise because they're legal secretaries?
No, they're getting a raise, but the raise is up to 6%. That's what we looked at in terms of what was approved by the board.
Yeah, but my question is, the 6% is across the board for all legal secretaries? Is there an additional raised increase for the interpretation, translation service they're
Yes, it's
providing?
across the board.
Okay. So what do you plan to do in regards to the additional duties that they have as interpreters and translators?
We'll reevaluate again and see what monies are available, resources are available to increase.
Because that's a whole
for those.
different job description in itself when you're an interpreter or translator.
Correct.
So I would urge you to look into that and to
I understand.
properly compensate these individuals that are doing this duty. Thank you very much, Mr. Chair.
Thank you, Senator Carrion. Are they exempt or they're classified?
Exempt.
Everybody's exempt, right?
Correct, everyone.
So we're at the budget here, and you could bill in a stipend for the translators, and we could provide that on line item. If individuals are providing, interpretation is a very expensive thing. You know, if you really go out and try to get interpreters, you pay some more money. So we should be able to deal with that if you will let us know exactly what it is.
Will do, Senator.
You have 38 employees.
32.
Total, correct?
32.
32?
You mean 38 positions? but-
Positions, yeah.
Yes.
So 38 positions, 32 employees.
Currently, correct.
You don't need an next assistant. We just so much levels of bureaucracy or leadership position. You already have one deputy chief. I can't see two deputy chief for 32 employees. You run St. Damas, the next deputy chief runs St. Croix.
The way the office is delineated or structured is the chief public defender oversees both districts. While I am primarily in the St. Thomas district, there are some duties that would be on a day-to-day for the deputy chief in the St. Thomas St. John district. That's pretty much the way it's always been, and it's worked out well that way because of the court cases that we have, and sometimes the assistance that's required in each case.
So there have always been two deputy chief?
Yes.
Going back how much years?
As long as I can, well, at least since I became a
So
public
this isn't a
defender.
new position. This was already structured this way.
This has been, I became a public defender, not chief public defender, but I became a public defender in 2006, and it's been like that even prior to that.
Okay. Your colleagues, we have exhausted our questions. I'm going to allow Attorney Joseph to put a closing statement on the record.
Thank you, Senators, for the opportunity to present our budget. As always, and as we presented before, this is a constitutional issue. We are mandated to represent those that are considered poor, indigent, and underserved. We are the check and balance that's necessary and required for a functioning, running justice system. I want to say thank you to the employees of the Office of the Territorial Public Defender. They work extremely hard to ensure that these things occur. And they put a lot of time and effort into ensuring that attorneys also have all the necessary tools or things that are required. We just ask that this body respond in favor, in kind, to the requests that we have, and we will also take into consideration and implement the recommendations made by the senators.
Thank you so much for your testimony. Thank you, Attorney Joseph. Thank you, Mr. Moorhead. The Committee of Finance will take a 5-minute recess. The Committee of Finance is back on the record. Madam Clerk, can you read the next item on the agenda?
Legal Services of the Virgin Islands. Invited testifiers, Shelby King Gaddy, Esquire, Executive Director.
Thank you, Madam Clerk. Attorney Gaddy will allow you to put your name and title on the record, along with both individuals that are here to support you.
Good afternoon, Senator. Good afternoon, Senators. Can you hear me?
Yeah. Bring it down a little bit more.
Okay.
Okay, that's good.
Good afternoon, Senators. And I am Shelby King Gaddy, Legal Services of the Virgin Islands. I am the Executive Director. Testifying with me today is our...
I'll let them put the name on. You go ahead, sir.
Good afternoon, Senators. My name is Kenneth Guy, Director of Finance and Administration.
Good afternoon. Dawn Dyer, Managing Attorney of the St. Croix office.
Okay, thank you so much. You may proceed.
Good afternoon, Chairman Violet and all the illustrious members of the Committee on Finance of the 35th Legislature of the United States Virgin Islands. I am 34th. I've taken you a year ahead, right?
Putting them in.
Ambitious. I am Attorney Shelby King Gaddy, the Executive Director and CEO of Legal Services of the Virgin Islands, commonly known as Legal Services. I'm accompanied by, as you've met already, Attorney Dawn Dyer, who's our Managing Attorney of the St. Croix office, and Mr. Kenneth Guy, who's the Director of Finance and Administration, also our CFO. Again, as we do every year, we look forward to the opportunity to appear before this committee to present to you and all the taxpayers the evidence of our efficient, effective, and fiscally responsible stewardship over the funds that you've entrusted to us. Legal Services continues to be a responsible steward of taxpayer dollars. Each year, we receive and report the results of our annual audit, which again this year has always been an unqualified or a clean audit. For fiscal year 2022, the governor's proposed budget included $1,632,700 for legal services, and as well, the fiscal year 2023 request is the same. While legal services, like all other legal aid entities in the United States, are underfunded to meet the growing demand for our assistance, we're extremely grateful for the funds that we have received, especially given all the circumstances that we've experienced here in the Virgin Islands. We're here today to support the sum of $1,632,700, which is the amount that was included in the budget for legal services. This sum, again, will only allow us to maintain the status quo at our present level of service delivery. And I will explain that service delivery has increased quite a bit. Over the past 4 years, Legal Services has been in a continuous rebuilding posture to replace the experienced attorney resources that we lost after the 2017 hurricanes. Presently, the total number of Legal Services attorneys are 6, with 3 in St. Croix, not including the Executive Director, and 3 in St. Thomas. And I have to tell you that we recently got a response from one of the attorneys that we had engaged who has for health reasons, is not going to be able to join us. So we are still seeking a position in St. Thomas. Additionally, the St. Croix office has employed a law clerk who is preparing to take the VI bar. When we began fiscal year 2022, Legal Services was fully staffed with no vacancies. And this body extended additional funds to pay competitive salaries to attract and retain attorneys. Over this year, we've experienced a significant turnover of attorney staff for a variety of reasons, ranging from those who were seeking increased salaries to unique outside opportunities like fully paid fellowships to pursue studies abroad. Nevertheless, I'm happy to report today that we are almost fully staffed with only 1 vacancy that recently occurred this week. Additionally, Legal Services has pursued the engagement of development professionals to create and implement a development plan that will allow us to increase, diversify, and sustain our funding. We are specifically seeking funding to hire at least 1 net additional attorney in each office to handle the ongoing types of cases we traditionally handle, as the volume of requests for assistance have continually increased. We implemented the Senior Medicare Patrol Project in 2018 to assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud errors, and abuse. And as we have a rapidly increasing senior population who receive other legal assistance from legal services, this program augments those services. We obtained federal funding for this program and hired a project director to coordinate the efforts. And we concluded the implementation of technological enhancements that were funded by the one-time disaster-related funding from Legal Services Corporation. And it covered the costs related to establishing the comprehensive approach for the provision of disaster legal services. That also included software, equipment, and non-attorney staffing to go out into the community to coordinate the necessary services when residents would be unable to get to our offices following a disaster. The technology acquired with those funds provided the necessary tools for our staff to continue serving the client community while working remotely in a teleworking environment during the COVID-19 pandemic. But further, the S&P program sought and received federal funding to assist seniors during the COVID-19 pandemic. One of the programs LSVI implemented in collaboration with the University of the Virgin Islands permitted us to train seniors on basic computer, internet, and social media usage. This allowed seniors to reduce the social isolation experience during the pandemic from not being able to participate in their in-person health services and other social activities. And Senators, while we are cognizant of the government's additional financial challenges created by the circumstances of the COVID-19 pandemic, the requested funds, again, will only allow us to maintain the status quo. However, simultaneously, we are continuing to seek and secure other sources of funding to meet the extraordinary costs associated with providing services to our community in a COVID-19 endemic environment. As we've shared with you before, we again reiterate that the U.S. Constitution guarantees a lawyer when someone is accused of a crime. But there's no constitutional right to an attorney when someone faces a civil action. For example, unless you can pay for legal assistance, you're on your own to try to rectify unsafe rental housing, challenge a wrongful discharge from a job, obtain a protective order against an abusive spouse, fight for custody of your children, or secure veterans benefits you earned by your military service. It's very challenging to navigate the legal system on your own. Having legal assistance is crucial to protecting the liberty and justice for all, upon which our nation was founded. Legal Services is the equal justice advocate in this territory. Our mission is stated in our mission statement is as follows: to access justice, protect rights, and educate people in poverty in order to empower them to move towards self-sufficiency. Legal Services is a non-governmental 501c3. It's a not-for-profit corporation whose primary purpose is to provide high-quality civil legal assistance and do so free of charge to low-income persons, the elderly, victims of domestic violence, and other disadvantaged individuals in our territory. We are a public interest law firm, which must adhere to the professional responsibility and ethics rules and codes as any other law firm. Legal Services has provided high-quality civil legal services to the client community territory-wide for 53 years. Legal Services is governed by a 15-member volunteer board of directors, and its management staff is very efficient, creative, and effective. Our attorney advocates and legal support staff, who have over 40 years of combined legal practice experience, have an excellent reputation in the bar, the courts, the community for providing high-quality civil legal assistance to eligible clients. And as a result of the negative economic effects of the COVID-19 pandemic, Legal Services has seen an increase in anticipating and is anticipating an even greater number of evictions and foreclosures. These matters will be in addition to the range of issues typically experienced by persons living in poverty, circumstances like employment matters, domestic violence, and a wide range of other family law-related matters. Legal Services is well into the second year of its strategic plan, which charts the course for the next 3 to 5 years, given a number of scenarios. Our strategic plan outlined a course that is currently being followed, which reimagined our service delivery model. It maximizes our resources by employing the best tools available for providing effective and efficient civil legal assistance in accordance with our mission. And as part of the strategic planning process, a recent formal comprehensive needs assessment was conducted, and we affirmed that there are still many unmet legal needs in our community. Since we cannot serve all of the clients' unmet civil legal needs based upon the results of the needs assessment, we set program priorities, and I will go through them just quickly. Housing is a priority, health is a priority, safety, which includes domestic violence, family-related matters, elderly and disabled, economic opportunity and security. The lack of decent paying jobs is a big issue here in our territory. Consumer issues, education issues, and transportation. The reimagined service delivery system model that resulted from the strategic planning process is based upon the visionary theme of providing equal access to justice anytime, anywhere. Legal Services has proceeded with implementing a variety of intake methods, procedures, and policies, including telephone intake, online intake via our website. And after the intake is completed in real time, our clients will be contacted by an attorney within 1 business day, thus eliminating the need for scheduling an appointment to have an initial consultation, which used to occur weeks later. The accessibility was significantly expanded, even more with the launching of our mobile justice units. They're designed to operate as mobile offices, taking attorneys into remote locations of the community to provide on-site legal assistance. The mobile justice units are at pre-scheduled locations in the community each week in both St. Croix and the St. Thomas, St. John districts on Tuesdays and Thursdays, respectively. Mr. Chairman, I'd like now to offer an opportunity for Attorney Dawn Dyer, who will give a summary presentation of an overview of cases and other matters that have been handled by Legal Services, as well as some success stories.
She may proceed.
Good afternoon. During 2021, Legal Services maintained COVID protocols that were implemented in 2022. With the emergence of the Omicron variant, staff worked remote for 4 weeks and returned to the offices in person on January 24th and have remained in person since that time. Client assistance remains largely by telephone, and in-person assistance has been available as needed. A comparison of numbers of LSVI's case numbers for 2021 and 2020 show a significant increase in client cases in 2021, which may not be very surprising given the unexpectedness of the pandemic starting in 2020. However, a comparison of 2021 statistics with the 2019 cases also shows an increase for cases in 2021. Thus, one might conclude that the implementation of enhanced client outreach through our mobile justice units, online intake procedures, and 24-hour telephonic callback for intakes policy have all been instrumental in increasing LSVI services to our broader community. In 2021, most of the cases, the legal matters that we handled were family law, being 41%. Wills and estates and deeds of transfer were 37%, and housing 11%. Employment matters were 4%, consumer 2%, and other miscellaneous cases were 5%. Our clients who contact us continue to be largely the senior population of the territory, being over 60 years old. That is closely followed by the 26 to 45 age group, and then followed by 46 to 59, with the smallest age group being 18 to 25. We continue to efficiently and effectively handle most of these matters through what we call a brief service or advice and counsel. A small percentage of cases have to go to a court hearing or require an extended service. I'd like to tell you about some of our success stories. We had a disabled senior citizen come to LSVI after she was served with a foreclosure complaint for a home that she had owned for several decades. The client had taken out 2 mortgages to make repairs on the home after it was damaged by Hurricane Marilyn. Unfortunately, following that, the client became disabled and was unable to work, and she fell behind on her payments. She had been trying to negotiate for a modification of her loans but had not been successful. Then, following Hurricanes Irma and Maria, the client was issued insurance checks in both hers and the bank's names representing repairs that needed to be done to the home. LSVI was able to step in and represent her in the foreclosure hearing by answering the complaint and through the mediation process, successfully negotiating an outcome that resulted in her keeping her home and a reduction in what she owed the banks so that she no longer had a mortgage and would be able to stay there long term. Another senior citizen came to our office. She had received a notice from the SNAP office, also known as food stamps, accusing her of committing fraud in the food stamp program. And according to the notice, the client had made purchases at a supermarket that were unreasonably high, and therefore, for what that supermarket carried at that particular store. The client denied having committed any fraud and sought our assistance, as she had been unable to receive food stamps for 2 years. We agreed to represent her at an administrative hearing, and although we were unsuccessful in negotiating a resolution, at the hearing we were successful in establishing that this lady committed no fraud. She was entitled to those benefits, and they were reinstated. We had another client that also a senior citizen that was concerned for her brother. He was elderly, homeless, and mentally ill after being seriously injured as a pedestrian crossing the street. Her brother received medical treatment for the accident, and the client was able to become his full-time caregiver. However, with the coming of the pandemic, the brother's medical appointments were canceled, and he soon stopped taking his medication and returned to life on the street. She came to us, and we were able to obtain a guardianship help her obtain a guardianship for her brother so she could provide a safe home and oversee his medical care. We agreed to assist her, which was somewhat difficult given the lack of recent medical treatment for her brother. However, after 2 hearings, the brother testified in court that he agreed to his sister being appointed as his guardian, and as his guardian, she's been able to assure that her brother is not living a dangerous lifestyle and regularly receiving medical care and other supportive services. Another client contacted LSVI after being terminated from her job with a nonprofit where she had worked for 15 years. The client was terminated due to an incident where she had accidentally injured a customer on the job. She sought LSVI's assistance for a wrongful discharge claim against her employer, as the VI Department of Labor had erroneously informed the client that she was not eligible to seek this since her former employer was a nonprofit agency. Upon LSVI's attorney representation, LSVI first successfully assisted the client in receiving her final paycheck, and next LSVI was able to convince the Department of Labor that the client should be afforded a fair hearing on her wrongful discharge claim. LSVI then attended the client's preliminary conference on the client's behalf, and after this, the client's former employer offered to resolve the matter with the client by paying her back owed wages in the amount of $5,600. The client agreed to accept this settlement, and this allowed her to become financially secure until such time as she was able to obtain new employment. I would also like to tell you about some things we did that we refer to as community outreaches. Generally, this has been somewhat different given the status of the pandemic, but we have still been able to be creative and remain active and present to the residents of the Virgin Islands. Many times throughout the year, LSVI staff appeared on several radio shows to educate the community about services and issues important to our senior citizens, and also economic empowerment for women. In May of 2021, LSVI staff took our mobile justice units to senior centers in each district and conducted presentations on powers of attorney and fraud prevention. We were able to actually prepare and execute powers of attorneys for seniors right on the spot, so they did not have to be transported to our office. In July of 2021, LSV staff joined the Virgin Islands Bar Association Young Lawyers and conducted an educational presentation on tenant rights for attorneys. The purpose of this was to educate and recruit pro bono attorneys from the private bar to expand our services so that we are able to help more citizens who are faced with eviction. In September, LSVI staff presented at the District Court CLE on the Pro Bono to Empower and Represent Act of 2018. In October, being Domestic Violence Month, LSV staff participated in the Women's Coalition's Domestic Violence Special Populations Virtual Forum, and we also participated in Domestic Violence and Sexual Assault Awareness Motorcade. In November, I presented at DVSAC's Know Your Laws virtual workshop. Additionally, we had paid advertising running 4 times a day on several radio stations from April to October of 2021. LSVI also ran notices in our 2 local papers and on social media pages to inform the public of the schedule and location of the mobile justice units. Information regarding our operations during the pandemic were published in the newspapers as well as our website and social media. Mobile justice units were in the community weekly in each district for the 2020 year since March of 2021. Thank you.
Thank you for your testimony, colleagues. We'll go right into a round of questioning. We'll begin with 4-minute round. Senator Blyden, you're recognized.
Thank you, Mr. Chair, and good afternoon, Attorney Gotti and your team there. And thank you so much for all you do on behalf of our people, especially our elderly and those that are most in need. As the young lady read out some of the achievements that you have done as of late, I do appreciate that. I know that I've sent many individuals to you guys, and we have met on several occasions. And thank God for the work you do. Much appreciated. You spoke to your budget, and you have received the same amount for the last 2 fiscal years, the same exact amount in many areas to include supplies, etc. But with a growing amount of demand, as you stated in your testimony, and a growing amount of cases that building as a result of the pandemic, and on. You said the demand is growing. By what % would you say your demand is growing as a whole for the agency?
We've seen a 20% increase.
About 20%. And in dollars and cents, what number does that represent in terms of funding that you see you can utilize to do all of that you have been doing and continue to do?
What we were considering is
Speak into the mic. Speak into the mic.
I'm sorry, I've never had that as an issue of speaking too softly.
Exactly.
What we really would like to see is a net increase of 2 attorneys net over what the positions are that we have. That would be 1 in each district, and 2 non-attorneys. Those are support staff members. If we could do that, we would be able to put our mobile justice unit out in the community a lot more, because that's a bigger issue for us in trying to serve clients, is because they can't get to us.
Correct. And in respect to the services you provide, I know you mentioned several stations you have been on, etc. You have a broadcast on a weekly basis going on. What else are you doing to reach out to, especially our elderly population? Have you had folks in terms of the different parishioners, the churches, etc., put up information out there in the bulletins, etc.?
Actually, we have a new senior Medicare Patrol project director, and she's been reaching out to pastors all over the territory to give us an opportunity to give them information, even if it's just giving them paper information. We're welcoming the opportunity to come and present in their church services wherever they want. We intend to reach out to the community that needs us most.
Okay, very well. And you do not have any outstanding vendor payments, do you?
No, we do not.
Okay, very well. In terms of your budget and your mission statement, let me ask, in respect to professional service contracts.
1 minute.
You have several contracts here. Have you been up to date with those also?
Yes.
And finally, before my time is up, Because I know in back in June, with the eviction moratorium when it was up, have you seen an increase in cases at legal services?
Absolutely.
I know back then also I met with you and I met also with HFE in terms of working together when it comes to handling those cases, especially at the courts. Have anything been done since then in that respect?
We just had a recent conversation with the VI Housing Finance Authority. Is that what you're referencing?
Yes.
And that conversation just recently took place, and we're still waiting to try to work out how we're going to be able to assist them.
Well, I look forward to you guys working with them, because I know in many other states the legal services are actually at the courts, and they're basically ramping up and dealing with those individuals where it avoids that gap in terms of eviction, having people on the streets, because you pick them up and automatically go on a program. So
Time.
I mean, short, I look forward to hearing what the results are, because it only makes sense. And I appreciate everything you guys do, and thank you so much, Mr. Chair, for the time.
Thank you. Thank you, Senator Blyden. Senator Joseph.
A pleasant good day to the testifiers and everyone listening and viewing this hearing, as well as my colleagues. I want to, of course, commend Legal Services for the hard work that you do. I am familiar with your organization, having worked at the Virgin Islands Housing Authority for a significant amount of time, and the great work you do as far as advocating for safe and decent housing for those who are the least among us. So I really want to commend you on that work that you have done. Now I want to go to our post-audit report, specifically page 6. I do have one question in this area, page 6. If you come down to mortgage, land building on page 6 under total supplies, it looks like. We have a variance here based on what post-audit is reporting of $22,632. Seems as though you had budgeted in fiscal year 2022 $96,609, and now for fiscal year 2023 it's budgeted at $73,977. Is that something that you are comfortable with? Because that's a reduction.
Yes, good afternoon, Senator. Yes.
Say your name.
My name is Kenneth Guy, Director of Finance.
Okay.
During 2001, and after having gone through the pandemic, we realized that we needed to take a look at our debt service. And one of the things that we as management on the board decided to do was to pay off 2 of our notes. We have 5 notes with USDA, and 2 of the notes we decided to pay off. So that's why the amount is reduced. We have less of a note, and thus we are requesting less of the VI government.
Okay, perfect. Great that you have been able to pay down on your debt. Now, I wanted to ask you, I know Attorney Gaddy, you mentioned that you have a need for 2 additional attorneys, 1 for each district, and of course, 2 supporting staff, 1 for each district. Are those salaries projected in your fiscal year 2022 budget?
No, they are not.
And what would be your ask to include that? How much would you look at as far as getting the support here? Because I know it's a lot of services that you provide, especially for our indigent community, which is needed.
Two experienced attorneys and 2 experienced legal support staff would be approximately $400,000. 400? No. Is that what we have in our other budget?
1 minute.
If you would, indulgence, please.
Mr. Chairman?
Yes, go ahead.
See if we hire.
Let me go to another question while we wait, because my time is running. Kindly indicate for us, when was your last audit performed? I noted under professional services, you have allotted or have contracts of the same amount for each fiscal year, including this fiscal year and the incoming fiscal year. When was your last audit completed?
We're happy to report that our last audit was completed as of yesterday. It was for the year ending 2021.
Okay.
And it also had no opinion.
No
It's a
findings?
clean audit.
No findings. Perfect.
No findings.
Congratulations
No
to you and
substantial
your
findings.
fiscal team. Now, I'm sure you have the answer.
Repeat the question.
The question was,
Question.
there was a call for 2 additional attorneys and 2 support staff. What would be that cost?
Yes, we were just consulting. It's about $400,000 if we have to hire 2 attorneys and 2 support staff, which includes their fringe benefits.
Okay, so that's including the fringe. Mr. Chairman, may I wrap up?
Go ahead.
Thank you kindly. Now, I wanted to just ask about these federal grants that you have listed here. Are all of the federal grants, and I'm on page 10 of 12, are all of the federal grants being expended timely?
Yes, absolutely.
Okay, thank you so much, Mr. Chairman, for the leeway. I really want to commend the staff and the leadership of Legal Services for the hard work you continue to do every day. Thank you kindly.
Thank you.
Thank you, Senator Joseph. Attorney Gaddy, what do you think is the reason why we have so many more cases on St. Croix?
I think you ask me that every year, and we're not really sure if it's the demographics or what the situation is. Because we have a larger aging population in St. Croix than we do in St. Thomas, seniors will come to fight for their rights. I don't know how else to explain it, but it has been that way since I've been at Legal Services since 2006.
And substantially more. And
Substantially more.
despite St. Thomas having a larger population, it's substantially more.
That's correct, but I don't know how else to explain it other than when you look at the kind of cases that we handle in St. Thomas, the cases are more family law cases, and that means they're fewer. But with our seniors, they have a number of needs where they come for wills and deeds and powers of attorney and revocable transfer of deed on death and all kinds of matters that pertain to them. And we've also seen an uptick of elder abuse.
Okay. Thank you so much, Senator Francis.
Thank you very much, Mr. Chair. Good afternoon to everyone.
Good afternoon.
I certainly want to thank Legal Services for the work that they continue to do in this community. It warms my heart every time I hear of the case scenarios that you bring to our attention. It's both bitter and sweet, because it's sweet because, of course, you know, we glad to see that there's some resolve, and it bitter is because we see where our elderly, our seniors are up against some challenges in our community. Hence, I often think about, you know, what would it be like if we didn't have Legal Services around to actually support these elderlies and our seniors. It's unfortunate. And all I can imagine is that a lot of our seniors will be swindled out of their personal possessions and you know, put out onto the streets, you know, be deprived of certain essentials in life and stuff like that. So again, a hearty thank you for all the work that you do and continue to do there. And it's unfortunate that you don't receive equal pay to the rest of your community or colleagues. So in the post-audit report, page 12 of 12 speaks to the fact that the salaries of employees of Legal Services are not 100% covered under the general fund. Anyone care to expound on that?
We have a number of grants, and from the other grants that we receive, we apportion out salaries for individuals so that they're not dependent upon one specific grant, but that when we apportion them out, then we're able to pay their salaries. We have federal grants, and we use some of those funds, and then we have some other grants that are not federal, but from other nonprofit entities.
So are you forced to do that because of inadequate amount of funding, or you just want to be able to meet these grants requirements?
both. Grant requirements, when we apply for grants, we're looking for grants that supply for the need of in our community, the needs in our community. But in addition to which, we are always looking for an opportunity to diversify so that if one funding source disappears, we're able to still continue to pay salaries and meet the needs of the community.
Very well. And I see the effectiveness of the mobile van out into our community. What can this body do to support and assist in that endeavor?
Give us some more lawyers so we can put that van out there more often.
Personnel. Yeah. So obviously, your infrastructure. I know that your previous presence before us, there was some concerns about the roof of your building. Has that been taken care of?
1 minute.
No, not yet, but not because we have not been working at it. We were fortunate, the delay that it seems to have taken us brought us to hazard mitigation and FEMA. We didn't realize that we were eligible for assistance, and we are pursuing hazard mitigation. And in addition to that, there's various projects under the roof that we mentioned to you all about that we have, that they will be assisting us in. So we would like to break ground by the end of this year, but we're still pursuing, working out the arrangement with hazard mitigation and FEMA.
Very well. And in you being a 501c3 organization, have you applied for any additional funding? I heard that there's a number of funding that's being made available for a non-for-profit organization. Are you pursuing any of those funding that's coming out of the governor's office?
Time.
We were made aware of some monies that is at the government's office, but we are not aware which specific fund it's coming from. But apart from that, no, we have not applied for, and so
we'd be happy to do so if you give us
funding, right? Yeah,
we always do, but if we knew that the funding was available for our organization, in the past we've sought funding through our local government, and some of that funding does not apply to the kind of work that we do.
Yeah. Well, I'm not sure that it's available for that, but I'm saying that you're non-for-profit, and obviously it's worth the ask.
Right. And again, it depends on. Even though it's a nonprofit, it can only be used. The monies that we've sought in the past were for certain types of work and not legal work. And in fact, I think the last time we looked at that funding, it specifically said not for legal work.
That's right. Yeah.
And that's what we do.
Very well. Thank you. I know for the needs for our seniors and everything else, I'm sure that there's a nexus that could be driven to address that. And you guys are very creative, and innovative.
Yes.
So let's pursue that. Thank you very much, Mr. Chair, for the time and your leniency.
Thank you so much, Senator Francis. Senator James.
Greetings to the people of the U.S. Virgin Islands. Thank you, testifiers, for being here. Before I get into my line of questioning, I want to publicly thank you. And it's not to say that you are doing a personal favor for me, but I recommended a family member of mine to reach out to you all, and you were able to assist them. And I'm only hoping and praying that you're doing so for a lot more Virgin Islanders. So thank you for your services to the people of the U.S. Virgin Islands. I see here where you have a vacant position for development officer contractor. And I apologize if this question was asked before, but what is the main role of the development officer / contractor at $45,000 per year, if I'm not mistaken, yeah?
That was a projection that we came up with for that position. The development officer is one who actually seeks grants. They do they put together a plan that we would call a development plan as to how we're going to be funded based upon our strategic plan, so that if we're looking to go out into a specific area and provide services in a specific area of law, then they would seek funding for that. And that could be in the form of grants. It could be a fundraising, an annual campaign. As you know, legal services does not have an annual fundraising campaign at this point. And we really need to have that done as a development officer. Thus far, the executive director has been performing that role, and I'd like to get back to being the executive director only.
And as far as you mentioning grants, do you have a working relationship with Delegate to Congress Stacey Plaskett as far as possible lobbying for any grants that might be out there?
She has been very helpful in us identifying things, but in terms of federal grants, I think we have been awarded the grants that we're eligible for.
Okay, thank you for placing that on the record. And I see here, while I was reading, it was made mention of some of your main priorities, and housing fell into your program priorities. So as far as housing being one of your program priorities, as far as funding, whether it's on a local level or a federal level, can you speak to us? How do you assist individuals as far as carrying out this mandate and utilizing what funds or in what manner?
With the funds that we get to provide legal assistance, we provide legal assistance for persons who have issues in rental housing, whether it's Virgin Islands Housing Authority, Virgin Islands Housing Finance Authority, any subsidized housing, any private renters, as we've seen an uptick in that as well, where landlords are not following the law. So our lawyers assist in that regard. But in addition to which, there may be circumstances where persons do not have decent, clean, healthy housing that they should be provided as a part of the lease that they have. In addition to which, under housing also includes foreclosures.
1 minute.
And I'm assuming that you do have a relationship with the Virgin Islands Housing Finance Authority and the Virgin Islands Housing Authority. And if so, as far as funding, I'm not sure, you don't provide funding, just services.
We provide legal assistance only.
Legal assistance, okay. And you've been successful at doing so. Do you need any lobbying or help from us as far as getting our seniors helped?
Yes, and we will call upon you as necessary.
Okay.
Right now, I believe Senator Blyden has been assisting us with trying to get some assistance from the Housing Finance Authority with respect to funding to help us pay for the legal assistance we're providing under the government funds that came into the territory.
And of course, I'm assuming a territorial initiative, right?
Correct.
Okay. All right, just want to make sure. One Virgin Islands. And as we get back to the budget, I see here that you have vendor payments. How are you going about making sure that you address these vendor payments? You have more than enough funding, right, to pay?
Yeah, we only have one vendor that sees the 17,000 to the auditor. He has just completed audit, so we'll be paying him
Okay.
shortly.
Time.
All right, thank you for placing that on the record. And I'm happy that you corrected me because I was watching the federal grants. Yes, there's only one outstanding vendor payment. And I'm happy to know that you are equipped, and I know you need some more staff. As far as the pool of attorneys in the U.S. Virgin Islands, do you think you will be able to fill that vacant position for the staffing attorney?
Unfortunately, I can tell you that we've been seeking attorneys for the last 9 months or so, and most of our attorneys have been from off-island, out of the territory.
Okay, I don't want to abuse my time. Thank you, Mr. Chair, for the time. If anything this body can do to help you, please let us know. And as far as your advocacy for bringing in outside individuals, if you have to do so, do so. If you have to have sign-on bonuses, initiatives, whatever to attract them right now, we have to be competitive with the market. So thank you, Mr. Chair, for the time.
Thank you, Senator James. Senator Carrion.
Thank you, Mr. Chair, and good afternoon to the team for legal services. I also want to join in echoing my colleagues and thanking you for the services that you provide to our community. I know many would have been lost if it wasn't for legal services and all the work that you do. So thank you. I wanted to ask, regards to fundraising initiative, do you have a development officer, fundraising officer within the organization?
The development officer has not been hired. When we looked at best practices throughout legal aid organizations throughout the United States, what we found is that they thought it was best, and it has been the practice of legal aid, is to go out and have a consultant look at the development processes for your particular jurisdiction, for your specific strategic plan. And we are looking at a couple of proposals that we've received for how to do that, because they look to see what kind of development activities would fulfill your purposes, whether that person should be contract, whether that person should be full-time staff, and what skills that person should have. And then, of course, how much you would have to pay them.
Okay. So you guys are still in that process of
Absolutely.
assessing, evaluating which direction to take.
Absolutely. We have proposals on the table we're looking at.
Okay. In the past, any collections through fundraising initiatives, donations, and so forth?
We get donations from time to time, people who have been, or their family members have been beneficiaries of our services. They provide donations. We have some faith-based organizations who have provided donations, but we do not have an ongoing fundraising drive, and so we don't have sustaining gifts, I would call them.
yeah.
You know, we don't have that right now, which is part of what we want the development activities to generate.
To generate. All right. Very well. You did mention about the 4 new positions, and okay, that was one of the questions I had, to be able to facilitate the work that you're doing and expand more. So I'm sure that we're open to receive that information and see how we can assist you with that. With the grants that you're managing currently, you have how many grants?
3.
Three grants.
Actually 4, sorry.
4 grants, okay. And the total awarded from those grants are?
SMP, which is the Senior Medical Patrol program, we budgeted $105,000. LSC, Legal Services Corporation, for this year, that's close to $130,000. VOCA, that is through LEPC VOCA and VAWA, Violence Against Women and Victims of Crime, that's a total of over $300,000.
1 minute.
So what percentage from your budget comes from federal funding?
Well,
through grants?
We bought about 30%.
About 30%?
Of their salaries, yes. And 70%, 25 to 30%.
25 and 30%. And then from the general fund that we provide through our appropriation, what percentage is
The
that?
difference is about 70%.
70%. Okay. And do you have, who manages your grant? Manages. Grant manager, monitors, who and staff?
We do it internally.
You do it
Mr.
internally.
Guy, and yes, we have.
You don't have anyone specifically?
No, we assign project directors to grants, which is how we're able to pay salaries in each grant. And those project directors ensure that we're in compliance with those grants by virtue of the work and the project plans and the grant proposals that we submit. We have to do regular reporting on those. So we don't have a grants manager like they do in other agencies.
Okay.
Time.
Mr. Chair, if I may conclude, in the absence of my colleague from Frederickstead, I'm going to ask this question on his behalf. Premium pay. Have you guys submitted the listing to OMB for premium pay?
Yes, we have.
Okay, that's good to
We
hear.
were not
'cause-
included in the first tier, but prayerfully will coming up.
Okay, hope so. Because the work that you're doing, and you've been in the front line, even through COVID, providing assistance to our community. So thank you for that. Thank you, Mr. Chair.
Thank you, Senator Carrion. Point of inquiry, Senator Francis.
Thank you very much, Mr. Chair. I wanted to ask you whether or not there is a similar legal services van in the District of St. Thomas, St. John.
I'm sorry.
Do you have a mobile van in St. Thomas? St.
Yes,
John as
we
well?
have a mobile justice unit, one in each district.
One in each district?
Yes.
Okay. And how is the deployment of that one on St. Thomas? How is the deployment of the one on St. Thomas?
They're both deployed the same amount of time weekly.
Okay. Very well. Thank you. Thank you.
Okay, thank you so much, Senator Francis. Colleagues, I think we have exhausted all questions. This is a small entity. Point of inquiry, Senator Carrion.
Do you all have an arm for advocacy? Like, I know you represent clients, individuals, but on a larger scales, issues and make recommendations to this body or tackle issues of equality or injustice in the territory at a larger scale?
No, we don't. One of the things that we are limited in doing is lobbying and testifying. I know a number of senators have contacted us to see if we will testify and promote or help to give information on bills that they're sponsoring. We are prohibited by Legal Services Corporation in doing so. So the way we assist, if you will, is if we are provided some information, some questions, we can provide answers to that. But because of Legal Services Corporation's prohibitions for lobbying and assisting in that regard, we can't do it.
Okay, thank you very much for that info.
Thank you, Senator Carrion. Senator DeGraff, you're recognized. 4 minutes.
Thank you, Mr. Chair. Good afternoon, colleague. Good afternoon, everyone. Attorney Gaddy, to you and your gang, what you're doing, keep doing it. I highly appreciate it. I support you 100%. Now, I was looking at the post-audit report. If the question was asked before, I do apologize. I had to step out. Your ask for recommended general fund from the general fund is $1,632,700.
That's correct.
Okay, I noticed that from the post-audit report for 2022, your ask for the 22 budget was $1,432,700.
That's
a
correct.
difference of 200,000.
That's correct. That's
okay,
because
so the difference is two. Oh, you go ahead. You go ahead. Sorry.
this body graciously, agreed to give legal services an additional $200,000 after we came before this body, and that money was supposed to allow us to pay increased salaries and to try to seek additional attorney staff. And so that's why we've come with the exact same amount, because we came with $1,432,000 last year, and then this body graciously gave us an additional $200,000. And in order for us to continue and sustain it, we included it again.
Okay, no, and like I said, I'm in full support. I just wanted to know, is that sufficient now, a year later? Is it still sufficient?
Not if we can get the additional 4 staff members that we requested, that we've requested here during this hearing.
Okay, good. So I'm on board. I just want to make sure we have it. We provided an additional 200,000, and you graciously asking for another 4. Hey, that's good to hear. That's basically all I had for you. That's basically all I had. So again, thank you for what you're doing. Thank you for the time, Mr. Chair.
Thank you so much, Senator DeGraff. I was closing last time and saying that I think we've exhausted all our questions. It's a small entity, so I'm going to give you an opportunity to put a closing statement on the record.
Again, we say thank you to this body and for the funding that we've received. I just publicly want to thank our staff who have worked hard to make sure that we can provide services to the people of the Virgin Islands. So as we go forward, Legal Services will continue to seek ways to maximize our efficiency, effectiveness, and the quality of service while serving as many clients as possible. We have requested $1,632,700, but in order to meet the high demand and to do exactly what we could if we had what we really needed, we would ask for an additional $400,000 to meet the critical needs of our client community. We look forward to working with you to ensure that Legal Services is properly funded and able to meet the goal of providing equal access to justice for all the residents of the U.S. Virgin Islands. And we again thank you for the opportunity to make this presentation to this committee and the observing public, and we would be most happy to answer any additional questions you may have.
We thank you so much for your testimony and thank those individuals who assisted you in answering the questions. It's been a long week for the Committee of Finance, 5 straight days of meetings, so we are happy to go home today. The Committee of Finance is here, we're adjourned.